Good morning, everyone, and welcome to the Commission on Behavioral Health meeting. My name is Al Roulette, and I'm the Vice Chair of the Commission. I'll transition back to Sandra for the official taking of roll and the commencement of our meeting. Establish a quorum.
Commissioner Bear. I have visual of her. Commissioner Burnick. Visual of him. Commissioner Bontrager.
Here.
Commissioner Brown. Here. Commissioner Bunch. Here. Commissioner Callan.
Here.
Thank you. Commissioner Carnevale. Commissioner Chambers. Commissioner Contreras. Do we have Contreras online? Nope. Designee Swartz. Commissioner Cross. Here. Commissioner Fairweather.
Here.
Commissioner Fernandez.
Here.
Commissioner Gordon. Here. Commissioner Designee Pulmano.
Here.
Commissioner Larson.
Here.
Commissioner Madrigal Weiss.
Here.
Commissioner Mitchell.
Here.
Commissioner Robinson.
Present.
Commissioner Southard. Let's see, okay. Commissioner Sy. Commissioner Wilkes.
Present.
Commissioner Vice Chair Roulette.
Present.
Chair Alvarez. We have quorum.
Thank you, Sandra. We're now going to move to Agenda Item 2, Announcements and Updates. Before we begin our usual announcements and updates, I'd like to welcome Commissioner Thomas Beckett. Hi. And welcome, Commissioner. And please introduce yourself and say a little bit to the Commission. We are thrilled that you're here, especially this morning. Thank you.
Thank you so much. Thank you, everyone. My name is Commissioner Thomas Beckett. I go by Jay also. I guess I'll be J squared. I'm thrilled. I am honored to be here, to be sitting with you guys at the table to make sure that we are able to give all the necessary needs for Californians when it comes to behavioral health. This is something that I've been passionate about since probably I was a little girl, and it is something that I am honored to be a part of and to be here with people like you guys. So thank you for even allowing me to be here.
Welcome. That's a unanimous welcome and thank you from everyone at the Commission. I'd also like to take a moment to welcome our newly appointed Executive Director, Brenda Graylish, and I'm just going to give her a round of applause. Brenda brings more than 25 years of experience in California state government, most recently serving as the Executive Officer for the Council of Criminal Justice and Behavioral Health. Her previous leadership roles include Chief of the Medi-Cal Behavioral Health Division and Acting Deputy Director for Mental Health and Substance Use Disorder Services at the State Department of Healthcare Services. Brenda, we are more than excited to have you here. We look forward to your extraordinary contributions and leadership. Please take a few moments to say hello to everyone. And again, thank you so much for being here.
Thank you, Vice Chair Rowlett, and thank you all for such a nice, warm welcome. I'm just so honored and privileged to be able to sit amongst the Commission team, just a wonderful group of very highly passionate and dedicated public servants, really seeking to better the lives of individuals who live with, mental health and substance use disorders in our communities. I was gonna say, just like you, Commissioner Thomas Beckett, I got my passion when I was a kid as well, and so, I had a first calling to be a teacher and then ended up doing a 180 to become in to really focus on mental health and substance use disorders, just seeing how many folks were suffering in my own community, but just across our state as well. So, I've dedicated my career to working in this space and trying to better the lives of those who are most vulnerable in our communities. And I think at the end of the day, really what I focus on is the person, and the people that are out there in our communities. And that's what I think about when I think about any proposals of how is this actually going to impact the person that we see, in our communities, that we want to make sure that we can lift up and help them live the best lives that they can live. So really honored to be here today. Want to bring energy to this space and collaboration, and just a big thank you. And I just want to let you know what an honor it is for me to be here with all of you today. Thank you.
Thank you, Brenda. And I again want to acknowledge that we're looking forward to your extraordinary leadership, your passion, and your enthusiasm for not just for the individuals we're privileged to serve, but for the community that provides that service, and for the people here that work at the commission. Thank you so much on behalf of every commissioner and on behalf of our chair. I thank you very, very much. I also note that our chair will be arriving momentarily. Unfortunately, there were some flight delays that were out of her control, but she will be here shortly. That said, I also want to take a moment to thank Will Lightburn. Will was our interim ED. Yes, what a big round of applause. Commissioner Bontrager called him our relief pitcher. He was an extraordinary relief pitcher. He was. He threw a few sliders, but primarily just fastballs straight down the middle. You knew what you were getting with Will every single day. Will, if you're out there and you hear us, on behalf of everybody at the commission, we thank you for your consistency. We thank you for the caring that you have for California and the people we're privileged to serve. And most importantly for this commission. Thank you, Will Lightburn, very much. Will, again, a nice round of applause. And we know that Will be retired for about 15 minutes, and then he'll be doing this work again somewhere else. I'd also like to recognize Tom Orrick, who has announced his retirement from the role of Deputy Director over Research and Operations. Over the years, Tom's impact on the commission has been significant. His work has helped shape meaningful initiatives and move us closer to a more effective and accessible behavioral health system. He has been a steady presence, indeed a steady presence, a thoughtful voice, and an advocate. We will deeply miss his leadership and partnership, but we're excited for what lies ahead for him, including traveling to Northern Europe. We wish him all the best in his next chapter. Melissa Martin Mollard will serve in the acting capacity until the commission, under Brenda's direction, has completed the process of hiring a replacement for Tom. Thank you very much, and I'll pause and see if there are any comments from commissioners. Seeing none. If members of the public have any comments to share about Commissioner Thomas Beckett, Brenda, Will, or Tom, please share those during the general public comment period. All right. Seeing no comments from commissioners, I'll continue on with our agenda. You recall last month that the chair mentioned plans to host listening sessions for the CFLC and the CLCC members, commissioners, and public. This session will provide an opportunity to reflect on the work of those committees to date, as well as to discuss their goals and purpose moving forward. Commission staff are currently developing a proposed agenda for the session and expect to announce the date sometime in the month of June. And again, the chair and I are very excited about the work and the opportunities moving forward here. Our 4 new commissioners missed the previous announcement regarding committee membership as they were not appointed yet. Don't worry, we are going to appoint you. So I am pleased to announce to appoint Commissioner Wilkes to the Budget and Fiscal Review Committee. Welcome, Commissioner Wilkes, to the Budget Committee. Commissioner Fairweather and Commissioner Thomas Beckett to the Legislative and External Affairs Committee, and Commissioner Fernandez to the Program Committee. Okay, you all restrain your excitement. But we know you're very excited about doing the committee work and that this committee work will chart a path for us going forward. Were there any comments from those commissioners regarding their appointments? All right, thank you. Yeah, very much. We're going to just keep going through the agenda. I'd also like to share that the chair and I had an opportunity to extend an internal town hall that was facilitated by our previous executive director, Will Lightburn. The town hall, due to Bagley-Keene requirements, the chair and myself were the only two commissioners that attended the meeting. We want to acknowledge the comments and sentiments made by staff. We look forward to continuing to work collaboratively with staff in advancing the primary tenets that were established by the chair and myself when we were selected by this commission to be chair and vice chair. Those tenets include transparency, proactive, positive, supportive communication, and then really making sure that the commission and its staff and the great work that we are all able to do, along with our wonderful partners in the public, get highlighted by everyone in the state of California. So thank you very much for the privilege and the opportunity to attend that town hall meeting. Yeah.
Can I ask you a question about the town hall? Is that something that's going to continue to happen on a regular basis? And if it is, can you clarify? I got an email that only 2 commissioners were allowed to attend because of Bagley-Keene, but can you clarify that a little bit? Because that wasn't my understanding of how Bagley-Keene worked, so that it could be more.
But the specific nuance around Bagley-Keene and the meeting requirements, I'm going to defer to Sandra. And then in terms of Executive Director, you ready? In terms of future town hall meetings, I'll ask the Executive Director what her plans are, what she's thinking about going forward. I know that, again, I note that from my perspective that the town hall afforded us an opportunity to listen and then report back to this commission as you so charged us to do. That said, Sandra, Bagley-Keene.
Of course. The Bagley-Keene is considered largely the rule of 2, where you are safest in maintaining the rules because there's so many rules on serial meetings. And I mean, I can meet with you and explain that, but it's basically the golden rule of 2 is to keep communications within 2. The minute you start adding, it gets very hairy, and to control serial meetings, serial communications. For example, you'll notice that when you receive emails, they always go in the blind copy so that no one can reply all and now start a chain of communications. That's very intentional because you want to maintain generally to 2 commissioners is the rule of thumb for all Bagley-Keene outside of noticed public meetings where you're doing the 10-day notice and such. I do want to interject before giving the floor to Brenda that I understand that the chair is working on a charter to potentially do more of a workforce committee that would handle and oversee matters within the organization. So I think something's in the works. I don't want to speak for the chair, Alvarez, but I'm sure she would be interested in sharing what's in the plans to be able to set more touch points going forward in terms of being able to understand the culture, the happening, so to speak, within, and then again, it would be 100% Bagley-Keene. That would be a committee that's noticed, publicly, so that you can have these types of forums or these types of, with the commissioners in that meeting room. So I think there's something in the works, but I don't want to get ahead of the chair.
Okay, so I'll touch base with the chair to volunteer for that committee. But in the meantime, as far as the town halls go, it sounds like it's a golden rule, but not disallowed. So if it's just a golden rule, which means opening up more than 2 could kind of get hairy, you can still have more than two. So if there's going to be more town halls, I would like to request to be a part of them. Thank you.
And just in terms of the question for me, Sandra took the words right out of my mouth. I know that the chair is working on a committee to try to figure out that strategy and maybe even other strategies to really try to take a comprehensive look to make sure that, to assess the culture of the team over time. So, thank you.
Comments from other commissioners or questions from other commissioners? All right. And staff, I want to just make sure that I stay in order. I'm going to, I'm looking at, we have, the next item announcement is that we have swapped items 7 and 10. The impacts of firearm violence item will begin at 11:10. And the Mental Health Wellness Act Full Service Partnership Grant item will begin at approximately 3 p.m. We'll also today, everyone, be doing a working lunch. A working lunch. So what that means, commissioners, is that you go in, you grab your lunch quickly, and we come back because we have an action-packed agenda. For those of you who are new, we'll let you go first in line so you can get your lunch and get back and get settled. But today is a working lunch, and we're going to eat here today. All right? That concludes the announcements for this morning. And because I know that you want to continue to hear my voice, we are going to now move on to our caring moment to help us center ourselves around the purpose, thank you, Jay, of our work and the people that we serve. The practice is meant to remind us of why we do what we do and share stories of or moments that may be impacting others in ways we might not always see. Today, it's a bit unplanned, but you're going to hear from me. This was going to be my first opportunity to speak, but the chair, again, as I said earlier, is delayed due to her flight. So I'm going to be sharing the caring moment. I'd like to take this moment to highlight an incredible event that members of the commission had the privilege of attending. The United Parents and Caregivers for Wellness 5th Advocacy Day, which took place in Sacramento on Tuesday, April 22nd. United Parents is the commission's advocacy grantee for the parents and caregivers population. First, I want to express how impactful this event was for the staff. I've heard staff sentiment about how impactful it was. Not just an informational perspective, but also from an emotional and personal perspective. It was a day that underscored the strength and resilience and the vulnerability of parents and caregivers who serve, who face daily challenges with compassion and tireless dedication. United Parents has long been a vital resource for parents and caregivers navigating the complexities of behavioral health, offering education, training, community engagement, and advocacy. This event was a celebration of that work. The event began with a heartfelt message from Executive Director Melissa Hanna, followed by an inspiring presentation by Ip Yancey, and please forgive my pronunciation, Ip Yancey Lockhart, a motivational speaker and author. What stood out for staff was a keynote address by Senator Rubio, focused on the need for student mental health and education, something I know that is dear to many commissioners here. For students in grades 1 to 12, she emphasized the need for mental health curriculum in schools, as well as a crucial step towards destigmatizing mental health challenges and empowering young Californians to better understand and support one another. Some of the attendees had the opportunity to walk the Capitol and meet with senators and assembly members, sharing their personal stories in support of Senator Rubio. Many parents and caregivers shared feelings of emotional stress, anxiety, guilt, and inadequacy, and listening to the rippling effect associated with those challenges and how they've impacted their families and other members of their households. It was an amazing day. Suggestions for remedying some of the issues included providing access for respite care, expanding support groups, continuing support of organizations that advocate for mental health rights and systemic changes, even in the midst, this is my own commentary, of budgetary challenges. The event concluded with powerful testimonials. By the end of the day, there were not many dry eyes in the room, and you can understand why. They shared experiences of deep empathy, and the healing that took place should remind staff at the commission and the commissioners, this is why we volunteer our time to do what we do, to change the trajectory of lives for many individuals in the wonderful nation state of California. It is through community engagement events like these that we are able to witness the strength of families we serve and understand how critical our work is in creating real, meaningful change. With that, I encourage all of us to find time to attend these events and connect with those we serve. I again want to welcome everyone here today, and I'll pause. I don't know that who is here, if there's anyone here from United Families or our staff who would like to make a few comments, and certainly commissioners. But again, very powerful, impactful day for our staff. And for me, just reading what was written here, the sentiments speak very, very powerfully of how impactful it is when you hear people who are involved in the work talk about the difference that this commission and our partners are making in their lives. I'll pause. Well, thank you to the commission staff, and thank you everyone who was involved in this. Brenda, again, please convey the sentiment. I think that sometimes silence speaks loudly, more loudly than a million words, and that the silence is deafening today, and how impactful the work that people here are doing for the individuals and families and children in the state of California. Thank you very much. Yeah. All right, it is now time for agenda item 3, general public comment. This is a time reserved for comments on items that are not on the agenda. Amariani? Welcome, Chair.
Good morning.
Good morning. Yeah. Amariani, please lead us into general public comment.
Thank you, Vice Chair. If you'd like a live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front to indicate you would like to make comment on this item and any other agenda item. Cards can be given to staff located at the front table. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. Once the public comment period for the item starts, we will close the queue, so please make requests to comment at that time. Yeah. You may also request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. For virtual comments, I will insert the word "last comment" to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. We truly appreciate your understanding with this process. We will begin with in-room comments. We do not currently have any, and we have 2 virtual comments. The first one is from Jerry. Your line is open. Jerry, we can't hear you yet. I think your line, you're still muted.
So I am. Thank you. Hi, good morning, commissioners, staff, and community stakeholders. My name is Jerry Hall. I'm a longtime advocate, former advisory board member, and a blogger at behabrehab.com. I'm compelled to address concerns that key elements required by the updated BHSA, specifically those detailing local community program planning process procedures, are an issue. The heart of the issue is that BHSA requires local advisory boards or equivalent commissions to review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. By all appearances, local BHS systems seem to misinterpret and subsequently miss the opportunity to represent that the planning process was followed. This review and approval process is important because typically annual plans report the stakeholder engagement activities that were used to create the plan, not the procedures and budget that they plan to use to engage stakeholders over the next fiscal year to create the next plan. This is really critical because the community's voice is lost in the opportunity to meaningfully engage throughout the year compared to the process that most counties follow, which is typically consumer forums and some surveys and then a plan. The answer is not to overlook or bypass the BHSA requirement to inform and engage these advisory boards. The answer is to provide them with guidance. The guidance that could come would be a recommended CPP procedures, plan, and budget, and it could include templates of the plan, a timeline, and a process map. So I believe that consumer and family members are uniquely qualified to co-develop their county's integrated plans as they're motivated to see a loved one suffer less and receive the care and services they need. Since I believe time is of the essence because we're in the beginning of the creation of our next 3-year plan, and the last time that stakeholders will be required to be engaged is this particular year right now. So rather than wait 3 years, I just encourage us to fix this and address this issue sooner than later. Thank you.
Thank you. Our next public comment is from Laurel. Your line is open.
Good morning. My name is Laurel Ben Hamida, and I'm representing Mass Social Services Foundation and also REMCO. I want to thank Tom Orrick and Will Lightburn for helping write the ship. And I want to welcome the new executive director. Thank you for taking on the ship, and we look forward to working with you.
Thank you, Laurel. Our last public comment is from Dr. Isrule. Your line is open.
Hello, good morning, commissioners. My name is Dr. Israllah Mohammed. I'm a licensed clinical psychologist, systems equity advocate, and the author of the Bureau Care to Custody Cemetery Pipeline. It's a diagnostic framework now on public record through this commission. At your April 24 meeting, you identified several challenges that I've spent the last decade analyzing, including bureaucratic complexity as a barrier to care and the systemic marginalization of families and culturally grounded providers, and the urgent need for trauma-informed accountability. The Bureau Care to Custody Cemetery pipeline is not just a critique, it is a strategic tool. It provides a diagnostic structure and implementation pathway to reform public behavioral health systems with integrity. That includes oversight fidelity, ethical postvention, and alignment between MHSA equity goals and internal workforce protections. The model has already shaped changes in county systems. What remains is not capacity, it's courage. I remain available to support this work through consultation, systems analysis, and partnership grounded in ethical fidelity. Equity does not begin with new task force. It begins by acting on what the system already knows. Thank you very much.
Thank you. That was our last public comment.
Thank you, Mariani. And thanks everyone for your patience with my tardiness. And thank you, Vice Chair, for serving in the role.
I told her she owes me.
Yes. I appreciate you all. As a late mom to a now almost 4-year-old, I really like to be home for bedtime, which means I try to fly out in the morning. And so I'm sorry. Blame Southwest. Okay, our next agenda item, thank you to the members of the public for your public comment. Our next agenda item is our consent calendar. This month's consent calendar includes the approval of our meeting minutes from the April 24th meeting, as well as 2 innovation plans from Napa and Yolo counties. All matters listed on this consent calendar are routine or non-controversial and can be acted upon in one motion. First, we have the minutes from the April 24th meeting. I hope folks had a chance to review those. The next 2, again, are the innovation proposals, and according to staff, Yolo County's proposal should be relatively straightforward as it involves a collaborative effort across 23 counties that this commission has heard about in previous meeting discussions. That proposal is to join the Electronic Health Records Multi-County Collaborative. Again, it's a 23-county collaborative that was originally approved by this commission in January of 2023. It's designed to affect local level system change by creating a more integrated, holistic approach to county health information technology collection, storage, and reporting. YOLO is coming forward seeking approval to join that 23-county collaborative. The proposal from Napa County is to help prepare for BHSA by joining Orange County's PIVOT program, which is the Progressive Improvements for Valued Outpatient Treatment Initiative. In particular, they'll focus on 3 components: full service partnership reboot, developing capacity for specialty mental health plan services with diverse communities, and innovating countywide workforce initiatives. Again, building on previously approved proposals that the commission has discussed in the past. All these proposals align with the BHSA and include plans for sustainability. The commission staff have sent the documents related to these projects to our commissioners, as well as a copy of the staff analyses for the proposals in each of the packets. At this time, I'd like to open it up for discussion from our commissioners to offer comments or to ask any questions.
Chair, I'd like to move the consent calendar, move approval of the consent calendar.
Thank you, Commissioner Gordon. We just need public comment right before that, but I'm holding on to that. Seeing no comments or questions from our commissioners, Mariani, if we could please open it up for public comment.
We do not have any public comment in the room, and we don't have any online.
Wonderful, thank you. Commissioner Gordon, thank you for your motion to approve the consent calendar. Is there a second?
Second.
Thank you, Commissioner Robinson. Seeing no more comments from Commissioner Sandra, if you could please take the roll.
Commissioner Bear, and actually, I'm asking all our commissioners joining us online to please unmute your lines right now so that I can hear a verbal yay or nay on this item. Thank you. Commissioner Bear.
Yay.
Commissioner Burnick.
Yes.
Commissioner Bontrager.
Yes.
Commissioner Brown.
Abstain from the minutes as I wasn't present, and aye on the two plans.
It's one motion, so you abstain from the vote? Okay. Commissioner Bunch, yeah.
All right, I'm sorry, can you clarify?
It's one motion, so if we want to vote on the consent calendar separately from this, we would have to pull it out and make its own motion to approve the minutes and then have a separate. So this is,
I think that's what you need to do, Sandra.
okay, so then we'll start over and this will be the first, we'll need a new motion just to accept the minutes. And so do we have a motion for?
So moved.
Okay. Gordon, and then who's seconding?
Madrigal Weiss.
Madrigal, okay. So minutes only. So to clarify, this is a motion strictly to approve the minutes from April 24th. And then we will go into a second motion for the innovation items. Starting over again. Commissioner Bear.
Yay.
Commissioner Burnick. Commissioner Burnick, he was just there. Okay. Commissioner Bontrager,
Yes.
Commissioner Brown,
Abstain.
Commissioner Bunch,
Approved.
Commissioner Callan,
Yay.
Commissioner Carnevale, Commissioner Chambers,
Yes.
Commissioner Contreras, Commissioner Designee Swartz, Commissioner Cross,
Yes.
Commissioner Fairweather,
Yes.
Commissioner Fernandez, Commissioner Gordon,
Aye.
Commissioner Designee Pulmano, Commissioner Larson,
Aye.
Commissioner Madrigal Weiss,
Aye.
Commissioner Mitchell, Commissioner Robinson,
Aye.
Commissioner Southard, Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilks,
Aye.
Vice Chair Roulette, Commissioner Alvarez, Chair Alvarez.
Aye.
The motion passes. Now we're going to entertain a motion for two innovation plans. So those are items number 2 and 3 on the screen for the Napa Valley, the Napa County Program Improvements, and the Yolo County semi-statewide. Do I have a motion?
Motion.
Thank you. A second. Who second? Okay. Okay. So again, for the commissioners joining us online, please unmute your lines as I will need a verbal aye or nay. Commissioner Bear,
Aye.
Commissioner Burnick, Commissioner Bontrager,
Aye.
Commissioner Brown,
Aye.
Commissioner Bunch, Commissioner Callan, Commissioner Carnevale, Commissioner Chambers,
Aye.
Commissioner Contreras, Commissioner Designee Swartz, Commissioner Cross,
Aye.
Commissioner Fairweather, Commissioner Fernandez,
Aye.
Commissioner Gordon,
Aye.
Commissioner Designee Pulmano, Commissioner Larson,
Aye.
Commissioner Madrigal Weiss,
Aye.
Commissioner Mitchell, Commissioner Robinson,
Aye.
Commissioner Southard, Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilks, Vice Chair Roulette,
Aye.
Chair Alvarez.
Aye.
Motion passes.
Thank you, Sandra, and thanks, everybody. Just as a friendly reminder, the consent calendar is a new addition to the commission's operation, and it's intended to streamline our communication so that we are able to move things a little bit more rapidly. So just a reminder, it's not intended to be controversial. If that format is not working out, would welcome that feedback, because this is an effort to try and shorten our time, because these meetings tend to be quite robust with content. Next item on our agenda is the May revised budget update. For this, we're going to hear an update on the state budget. I know this is a very important topic of conversation right now, as many folks are grappling with the May revise that was released, as well as the ongoing uncertainty at the federal level that will have additional implications on our state budget. We will review that budget and will consider approving a revised spending plan including associated contracts with that plan. To follow up on our commitment to transparency and ask that I made at the April meeting, I want to make sure that our commissioners, especially our newer commissioners, but members of the public, that you know you can find a list of all of the commission's active grants and contracts on our website under the heading Grants and Contracts. This includes contracts and grants of all sizes and offers the public an opportunity to better understand where the commission resources are expended. I'd like to invite Norma Pate, our Deputy Director of Administrative Services and Performance Management, to provide the update. Norma.
Thank you, Chair. Just quickly, I wanted to announce that I've been meeting with Vice Chair Rolette on the Budget Committee. The Budget Committee is one of the committees established by the Commission at the last meeting, and so we're starting to put together an agenda for an upcoming meeting, and encourage new commissioners to pick our committee, the Budget Committee. It's going to be the most exciting committee. I heard there's a little bit of internal competition going on here with committees, and so we're recruiting you for our Budget Committee. Don't know, Al, would you like to say something?
Again, consistent with what your expectations are, we've talked about really setting a schedule and putting out a draft of a charter, which all the committees will have a charter, so that you can provide feedback regarding the purpose, the objectives, the key performance indicators of the committee. Again, one of the primary expectations that you have of a person that's serving in chair of the very exciting, very, very, very stimulating fiscal budget committee. Okay? Thanks. Thank you.
All right, thank you. All right, to ensure expenditures align with priorities and promote fiscal transparency, the Commission receives budget updates in July, January, and May. And as the June 15th budget deadline approaches, we're expecting intense negotiations with lawmakers. Let's see, and then under the May revision, the total expenditures of $321.9 billion are proposed, including $226.4 billion from the general fund. A projected $12 billion deficit is reported, with the actual deficit nearing $40 billion when considering financial remedies. Major proposals include the revised spending plan includes Medi-Cal adjustments to state-funded insurance and reductions in home health care services. To manage cost, measures are measures such as freezing new enrollments, raising premiums, and reducing benefits are being implemented. For additional information on the budget, if you'll look to your tab 6, there's more information, and I've highlighted some of the budget items related to behavioral health and provided 3 documents that provide additional information. As you can see, our budget for 25-26 has been reduced to half. The budget includes reductions to the Commission's Mental Health Wellness Act program, which is $20 million, and this will be ongoing reduction to the Commission's budget. The Governor's May revision proposes that this cut is part of the, this is part of the local assistance funding for the Commission. And as the Commission's largest and most impactful grant program, the Mental Health Wellness Act plays a crucial role in our programs. The immediate consequence of this reduction is the elimination of grants focused on children ages 0 to 5, full-service partnerships, and peer respite. The long-term impact is by fiscal year 3031, the Commission will lose all permanent grant programs, undermining the behavioral health transformation. The administration has suggested using 2026 Innovation Partnership Funds to support Mental Health Wellness Act grant programs. However, the $20 million Innovation Fund under Proposition 1 is temporary and cannot be replaced with the Mental Health Wellness Act. The innovation focuses on public-private partnerships and requires initiatives to be innovative, unlike the Mental Health Wellness Act's emphasis on crisis prevention and community engagement. There's an urgency to continue these funds. The Mental Health Wellness Act addresses urgent needs such as older adult care, psychiatric emergency rooms, and substance use disorders. Cutting this funding abandons promising pilots, severs partnerships, and jeopardizes behavioral health reforms. Without this grant funding, the Commission will be unable to fill critical gaps necessary to support the state's behavioral health transformation, and more importantly, to serve those most in need. The 3 launched grants that are already developed in close partnership with our departments, with other departments and community stakeholders, address the major gaps in the system. Number 1 is the 0 to 5 maternal mental health. Our $20 million grant focuses on children ages 0 to 5, is about to be awarded to 6 community-based organizations and 1 technical assistance provider. Eliminating this funding would pull resources directly from organizations serving birthing people during pregnancy, infancy, and early childhood. Their goal is to connect families and vital supports like CalAIM and BH Connect. No other state entity is doing this work at this time. The organizations that would be impacted are the Casa de Esperanza, Child Parent Institute, Foothill Family Services, North Main Community Services, Redwood Community Services, and St. John's Community Health. Next is the next reduction would be to the FSP program. Cutting our $20 million FSP partnership grant would derail a major effort to strengthen behavioral health systems and fulfill the promise of Proposition 1. This grant was developed in collaboration with state and local partners to ensure alignment and add technical assistance capacity. Eliminating this grant puts both progress and people at risk. Next is the peer respite funding. Cutting our $20 million peer respite grant, which is set to launch later this year, contradicts the state's crisis response goals outlined in the 988 strategic plan. Peer respites offer dignified voluntary alternatives to hospitalization and incarceration, providing people in crisis with the kind of compassionate support they deserve. Ongoing impact of eliminating the Mental Health Wellness Act. Again, I want to stress that the long-term impact of this cut is the total elimination of the Commission's grant-making ability by fiscal year 3031. More importantly, it eliminates services that are most vulnerable, residents rely on, and severely limits the Commission's role in supporting behavioral health transformation. One of the other budget items that we had this year was we had asked to reappropriate funds for our empath units and for our early psychosis prevention program. And the empath program is a key program expanded medication-assisted treatment access, aligning with Proposition 1 goals. The Commission secured $7.8 million to address licensing and delays for empath units, which reduce emergency visits, streamline mental health assessments, and provide calm crisis environment. These units can cut transfers to locked facilities by approximately 70 to 80%. Licensing challenges persist, but state and local agencies are collaborating to resolve them. The request extension ensures sustainable empath program delivery, aligns with the Commission's mission, and maximizes the impact of Mental Health Wellness Act funds. The next program is the Early Psychosis Intervention Program. Provides evidence-based care for psychosis and mood disorders, improving outcomes. The $430,000 reappropriation will extend Sacramento County's program's liquidation date, ensuring full fund use and uninterrupted services. Despite initial challenges, clinical staff were hired, enabling service delivery, and the county seeks 1 more year extension to complete the full 3 grant term. Welfare and Institution Code Section 5845.8 requires the commission to fulfill biennial legislative reporting obligations by conducting data analytics and evaluations of FSPs in California. This is established by Senate Bill 465, and the commission receives $400,000 annually to support these requirements. Today, I'm asking for the commission to consider a proposal for evaluating child-serving FSPs. Staff recommend amending the commission's agreement with the University of California, San Francisco to evaluate child-serving full-service partnerships, comprehensive care programs for children, and intensive behavioral health needs. This aligns with legislative requirements and builds upon prior research to integrate statewide data sets, enhancing accountability and performance. The project supports the Behavioral Health Services Act goals by improving data utilization and outcomes for children with behavioral health needs. Today, have that for expenditure authority updates, we are asking today for the commission to consider the $400,000 for the FSP evaluation. And then also an additional contract for $143,000 for Salesforce, which is the software that we use to support our research and evaluation efforts with SAS. And then just to, for transparency, we're just making sure that the commission is aware of contracts that are approved under the executive director's delegated authority. The rules of procedure provide that the executive director can approve contracts $100,000 and under, and then interagency agreements $200,000 and under, and anything else goes to the commission for approval. So under the executive director's authority, we have approved one contract for $55,000 to support the innovation effort, the innovation public-private partnership efforts, and then that was the $45,000, I'm sorry. And then the $55,000 is for software and support for our criminal justice data. And we are deferring the item that we have here for $18,000 because of the budget deficit. We were trying to create wellness in our office, and we've been trying to think of ways to make our office more exciting. And so we're wanting to bring in office plants, but we're going to wait on that until we figure out what's going on with the budget later. And then $9,000 for another software for our research projects. And Brenda, do you want to say anything about things that we're going to be doing around wellness in the workplace?
I just think, in terms of, we have a staff team, and I know I'm just still coming up to speed with what's going on, but my understanding is we've had a staff team who have been meeting and have some recommendations, and so this environmental budget line item was in response to that, but given everything going on, particularly with regard to our $20 million cut that we have right on the cusp and everything else happening with the budget situation, I'm going to go back and meet with the team and see if there might be something we can do in the interim period and then revisit that at a later time, or even see if there's anything else that we can do, because it's $18,000 for plants with $1,000 every month to keep them up. So anyway, that's just something we wanted to do to make sure that we're responsive to the team's needs, but also trying to balance the budget issues.
Yeah, with the state rules, we can't buy artwork, or we can't buy things to hang on the wall or decorative items, and so leasing plants is one option that we have through a master agreement through the state, and other state departments do this, but we just don't think it's the right time to spend $18,000. So
I have a question. If I,
Yes.
Okay, great. We'll open it up for commissioner questions in just a minute. So thank you, Norma, for the presentation and overview. One thing I want to acknowledge and appreciate is the leadership of Commissioner Chambers and our executive director this week, who testified in front of both the Assembly and the Senate budget committees to advocate for the commission and to push back against the reduction in the Mental Health Wellness Act appropriation. The Mental Health Wellness Act are funds that this commission has utilized over the last few years to work closely with the public to identify specific priorities that this commission can uniquely move forward in its partnership role. Everything from maternal health and 0 to 5, peer respite was an opportunity, full service partnerships, substance use disorder services, older adult supports, and empath, as Norma outlined above. This reduction is a substantial one, and just want to deeply appreciate their leadership in pushing back, as well as the partnership of a number of organizations across the state that have highlighted the importance of these funds. Given their leadership and the conversations that we've been having thus far, I have asked commission staff to follow up by drafting a letter to both committees, as well as to Assembly and Senate leadership, and ensure it's sent out this week. Again, outlining the use of those funds and the importance of maintaining them in order to build on what the Behavioral Health Services Act is trying to do. We expect to have an update on the process in the next couple of weeks as budget negotiations continue. I also want to highlight that the budget negotiations in these next couple of months are really TBD overall, given the federal implications that will come down later this year. So it's a very uncertain time. So just also appreciate the pause and the intentional thinking that this staff is having amongst every aspect of our work. It is a tough time across the board, and just want to acknowledge and appreciate your consideration in that. With that, I'm going to open it up to comments from our commissioners. I saw Madrigal Weiss and Commissioner Gordon, Tsai, and Bontrager.
Thank you, Chair. Just a couple things. I, too, want to give great appreciation to the work that staff have been kind of teeing us up and informing us as to what's going on. And a special thank you to Commissioner Chambers. I saw her presentation and was just very appreciative of you standing up for us. And I would also like to offer that, you know, it's a time for all hands on deck. So if there's additional opportunities where any one of the commissioners can be present, please let us know. As far as, you know, near and dear to my heart, of course, is student mental health, but anything around FSPs, you know, and our little ones, you know, our programs at the county offices of ed are also programming for the littles. So I think we would absolutely stand with everybody here. So we continue to advocate for this to be a priority. So I would ask that you continue to keep us informed, and not just here, but throughout this process. I think we do need to very much stand together on this. So, and I do have a question. There's been a couple references to a team within the commission who have been working around issues like this and staff wellness. Leasing plants, I think everybody kind of went, what, 18,000? And I get it, it's a state contract and that's how stuff like that works. I would just ask that, you know, that team's representative of all levels across all departments, just because I think it's just critically important that all voices are there. And I'm wondering, where plants is one way, are we asking all staff what would be best for their wellness? So was there a survey that went out? Did the team decide on plants, or was that like asking everybody? You know, was there a list of things? Because I don't want just a few making decisions for all, right? That wouldn't feel right. So.
Yeah, I plan to bring that committee back. We have an internal committee it's the Mental Health Wellness Committee, and it's internal staff, and they make recommendations. And so this was one of the recommendations that was given to Lauren Quintero, our HR our deputy director, or assistant deputy director. And so I will have that committee regroup, and then we can bring forward some recommendations from that committee.
Perfect. And then I just want to add one more thing. So as you all know, we created the Working Well report, where we identified the workplace mental health standards. Mm-hmm. And as I am implementing them at the County Office of Ed in San Diego, you know, we have a new executive director. Mm-hmm. And I think that as we stabilize, I'm not saying tomorrow, but as we stabilize, if that came out of the report through this commission, I think it would be very important for this commission to adopt the workplace mental health standards. And so I would volunteer to be on that and kind of walk through lessons learned, since I'm already midway doing it. And so I really hope that we consider that we model that which we want to see in the world. I'm not trying to be Gandhi, but you know what I'm saying. So I would very much hope that we can start to do something like that here in the commission with our staff. So,
I also volunteer.
well, we would have to ask the chair if that's something that we can. So just want to put that out there. Thank you so much.
Thanks. Thank you very much, Commissioner Madrigal-Weiss. So that opened up like a can of worms. There's a lot there. So I want to address those comments, particularly connected to the opening comments that Vice Chair Rolette said about the staff town hall. And I want to put a pin in that as we talk about the budget first, and then talk about that, because there are specific next steps, particularly building on the ED search committee and moving into a workforce optimization committee that we would then connect to our goals for Brenda's performance, right? Like, let's really think about how we're approaching the tools we have, and we have a new executive director. How do we hold her accountable? How do we provide that support and the commitment to what you said about staff engagement and the engagement of staff of every level, 100%. So let's talk about that right after this budget item. I have Commissioner Gordon, Commissioner Sy, and Commissioner Bontrager. Oh, and Commissioner Fairweather. Go ahead.
Yes, thank you. I'll volunteer for the committee as well. Actually, I was pretty shocked at these proposed cuts. And I think all of us should have a copy of whatever it is that was anticipated we would be able to do as a commission financially in terms of our work across our set of responsibilities that will not be possible to do in the coming year and subsequent years. Because my concern is the agreements that grew out of Proposition 1, I think, have been dismantled in large part by these actions, because as Prop 1 unfolded and I was keeping people I work with up to date on what would be the residual authority of the commission and areas such as school mental health, and I think this abrogates a lot of those agreements. So I would like to see everyone on the commission get a list of the things that we will not be able to do, but we're anticipating we could move forward with, because a lot of us are in contact with people in the legislature or in the government, and I just like to make sure that all of us are able to weigh in and help out if there's testimony needed, but also that individually we have a clear understanding of what was in Prop 1, what the expectation was for what the commission would be able to do under the new regime. So I'd just like to make that request and volunteer for the committee as well.
Absolutely.
Thank you, Commissioner Gordon. Norma, that was something that hopefully you can follow up on.
Yes, absolutely.
Great. Next is Commissioner Sy, then Bontrager, Fairweather, and Bear.
Thank you, Chair. Certainly agree with the comments about the May revised budget. This state has made a lot of investments in behavioral health, and so this is different than that. And so I think staying aligned in terms of our voice will be helpful. Something else that I think will be helpful is ensuring that this commission is investing in what the spirit of the BHSA is, which is mental health and substance use. And I think, Norma, when you presented on things like empath units, right, I would encourage all of us to try to think through that integrated behavioral health lens, mental health and substance use. When I think about a lot of the programs that are funded through BHSA, the amount of infrastructure, clinical upgrades, operational upgrades, fiscal investments to add substance use to mental health services is actually, I think, much less substantial than many people would think. And I think that this is an opportunity for us as a commission to be very tangibly investing in both. I also think that strategically, when we invest in both, it aligns with Prop 1 and it protects those investments and that there are more stakeholders involved. And so I just want that, this comment, relates to the budget. I think it also relates to every decision this commission makes moving forward. Thank you.
Thank you. Thanks, Commissioner Sy. Appreciate that challenge. Next, Bontrager, Commissioner Bontrager. Your best. Okay. Commissioner Fairweather.
Yeah, just for clarification, it seems like we're talking about two things. One is the budget revise, which is removing funds from different programs, and then, but the elimination of the Mental Health Wellness Act funds and the fact that that has impact going, into future years, it seems to me like it's, if that's a part of the changes that Prop 1 put in place, I'm just asking for a little clarification. And then also, what can be done about it? I'm particularly concerned about the loss of funds for older Californians, and, others as well. So excuse my, I'm new to the commission, and this, it's very complex.
Yeah, no, it's not, the funding is not related to Prop 1. It's the grant funds are ongoing funds that the commission received. We've been receiving these funds for since 2014. And so this reduction isn't related to Proposition 1. This reduction is related to the budget deficit and the May revise proposed eliminating these funds from the commission's budget.
And is this specific, I mean, the revenue for all of the mental health BHSA work, is it a reduction in that specific revenue, or is it general fund?
No, it's just, it's part of the, sorry, how did I write it?
Do you want me to help, Norma?
Yeah, go ahead.
So it's basically Behavioral Health Services Act funds.
Yeah.
So we have the $20 million Mental Health Wellness BHSF, Behavioral Health Services Act funding that, is an ongoing annual allocation. And then starting next year, we get the bump up for 5 years of the additional $20 million from the Prop 1 for the Innovation Services Fund. And then starting in 2031, or after, if nothing happened, if everything stayed the same, we would still have Mental Health Wellness Act funds. But what this is proposing to do is get rid of the $20 million Mental Health Wellness Act funds, so that by the time those innovation funds would end in 2031, we wouldn't have any grant, I'm sorry, Sandra, we wouldn't have any grant funding thereafter. So. Or it would be subject to the annual budget process, so then we would have to every year ask for additional funds.
The Innovation Fund is a little bit different than the Mental Health Wellness Act fund was ongoing, but there's contingency language in the budget that funding has to be available in the budget for the Innovation Public-Private Partnership, and it's only for the 5 years.
And so the Mental Health Wellness Act funds have a little bit more flexibility to them. And so based on the commission's priorities, then the commission can set priorities on what the Mental Health Wellness Act funds would fund in the out years, so, if it were to be retained. But if it's eliminated, then there's nothing. We won't have anything.
And that question of its elimination is this budget battle.
It's an immediate. Clear as mud.
I say so an immediate impact that has a short-term impact of the $60 million and the 3 $20 million grants that Norma presented on, which is the 0 to 5, the FSP, and the peer respite. So that's the immediate impact of these grants that we're just about ready to, on the cusp of launching. And then in the out years, that's the long-term impact.
Thank you. Commissioner Bear, Burnick, Rolette, and Chambers. Commissioner Bear, please.
Sorry about that. First of all, Norma, thanks for your report. And maybe it was an oversight as a new commissioner. I can't be saying that too long because I'm almost at 5 months, but can we see these kind of reports ahead of time? Like those expenditures are important to see, but as a commissioner, one of the most meaningful ways I believe I can drive impact on this commission is looking at strategic partnerships. One of the items that stuck out was the sales force of $143,000, and looking at intentional connections between those companies and kind of filling that gap right now, and how we can look at between the agency and private, nonprofit, community-based partnerships, because these are things that I think I can add to the commission.
That would be wonderful. And part of the creation of the budget committee is to look at, to analyze expenses that we have at the commission. And so I would love to have that support.
Okay, we can have a side conversation.
Okay, I'll call you.
Thank you, Commissioner Bear. Commissioner Burnick.
Yes, I was just going to add, similar to what Pam just said, I think any way that we can be of help in terms of other resources. Pam has better contacts than any of us probably, but I think any way we can help in terms of bringing in additional resources, I'd volunteer, and I think that's an important role that our commission can play.
Thank you. We'd love that.
Thank you. Commissioner or Vice Chair Rolette, and then Commissioner Chambers.
First, I'd like to thank Commissioner Bear for volunteering to be a part of the Budget Committee. We accept that your enthusiastic support, and we will, and that is how I will be recruiting you for the Budget Committee. So thank you so much for that. I also want for commissioners to make the correlation between Prop 1, the Mental Health Wellness Fund, and FSPs. As you know, our local mayor was an outspoken proponent of FSPs as a model of integrated care for people with substance use disorders and mental health disorders. And what mental health wellness does in terms of studying the effectiveness of FSP services in really identifying, and I think it is the commission's role to identify what the best standard of FSP care is, or certainly be a participant in that conversation, and the implications associated with removing that fund and the commission's ability to add value to FSP services. And so again, it is all working together for the good of the people of the state of California. We have to remember that. That's a part of Prop 1. It may not be directly affecting Prop 1 allocations, but it does affect the services. And we are the entity that ensures, again, from my perspective, that the people in the state of California have the best services possible. So advocacy is important. Thank you.
Thank you, Vice Chair. Commissioner Chambers, please.
I don't know how I can go after that. It's like that was a sermon, but like all these things do work together for good. And I also want to thank the commission staff and the leadership for asking me to come to Sacramento this Monday and Tuesday to testify on behalf, like I noted, of the people of color that consistently have had the budgets balanced on their back. And I will consistently say that. I know the state is bad, everything is all bad, but typically we suffer the most. And I'm just going to say it. And to what the Commissioner Rolette was saying, like as a practitioner of this for the last 20 years in developing these programs, all these programs are critical to Prop 1 and to the sustainability, the effectiveness, and the efficacy, and making sure that other entities outside of a condensed department is implementing this. I'm not here, I am implementing almost every program as a nonprofit, so this is real to me. I'm on the ground right now. I'm implementing Prop 1 and all the services, and I see a major concern if the commission is not able to supplement and support and uplift Prop 1, particularly with the substance use and mental health. I think there needs to be a lot of conversations around how do we integrate mental health and substance use? Like, as I noted in the Senate and Assembly, I have a homeless niece right now in Riverside County that's in the Tate FSP. and has been calling me every day. I'm coordinating her stuff. I'm talking to her case managers. I mean, it's this, I mean, I don't, and the system is already impacted. So I'm living this stuff every day. The peer respites everyone doesn't need to go to a hospital. You know what I'm saying? We really need to realize that as Californians. Like, some people do need to go to a hospital, but everybody does not need to go to a hospital. And people need to be appropriately put into placements. Like, my niece has a mental health condition. She's been put in substance use facilities and have worse outcomes. So if we do not address how we integrate this, we're making people sicker. And I think that if we can allyship with the department, with the legislator, I mean, they've made major investments with the CARE Act, major investments in other things that's a priority. Like, all these things align with how to support the administration. So my call to action for every commissioner here and the executive director is to, in a strengths-based, collaborative way, engage the legislator, engage everybody in the next couple of weeks on the urgency and the need to consistently keep these programs to support the governor's Prop 1 initiative. But I would really like to see a plan. Like, what is the executive director and other commissioners going to do in the next couple of weeks to engage legislators, their partners, any public? I mean, if you're a CEO of a company, how many people are you going to go tell that mothers with kids 0 through 5? Because I know every birthing person in here has almost lost their mind at some point. Let's just keep it real. Maybe not. But maternal health is real, and we're really one of the main states that are doing this and making the investments. And that's once again in alignment with CalAIM and the extension of the doula benefit. So all this stuff is in alignment, and I would really hope that everybody on this commission that's sitting here can tell a friend, tell a neighbor, tell another CEO, tell a legislator that this work is important and in this department, not just in those other departments. Thank you.
Thank you, Commissioner Chambers. Deeply appreciate those comments. I heard a call to action there. Kendra, as our main liaison with the legislature, even a set of talking points that commissioners can receive highlighting these requests and the urgency of now would be deeply appreciated. So thank you for that. Please, Sheriff.
Thank you, Madam Chair. Three things that I'd like to just bring out, one for clarification and comment. The first one is we didn't get the materials on this budget presentation in our packets. So can we make sure that we do receive those? I'd also like to receive your.
I didn't get one either.
It's in there? Oh, it wasn't in there? Okay, we didn't get it until just a moment ago. But in addition to that, I'd like to see, Norma, your script that you had for us, because there's a lot of detail in there that's not on the slides that I think is important. So those two things, I think, are resources for commissioners. A question for clarification on the expenditures, the $400,000 for the software. This is evaluation software for FSPs, but I suppose the question is, if the FSPs are, at this point at least, earmarked to be cut, why would we purchase the evaluation software? Is that for other FSPs that are not in this budget cut?
So the 400,000, that is for a contract with UCSF for evaluating the FSP programs as required under Welfare and Institution Code. And so it's a requirement for the commission to evaluate FSP programs. And so this is for the evaluation, not software.
But is this a prospective contract?
It's an.
Or I think, are you asking Commissioner Brown how that's relating to the FSP?
To the FSCs that are
work
on
that
the
would be
chopping
cut
block.
as the $20 million for the Mental Health Wellness Act? Okay,
Correct.
yeah, there's separate things. So there's a requirement for the FSP evaluation, which is what the software is for, and the FSP contract, the project for the $20 million for the Mental Health Wellness Act is for the performance-based, to support counties with performance-based contracting as they're ramping up for Prop 1 implementation. So they're two different things, two different efforts. Does that help?
Yes, yeah, so we're going to be relying on the individuals from UCSF to assist with that evaluation as required. So that's the interagency agreement for 400,000.
All right, thank you. And then I also agree with what was said, that if Keandra can put together some talking points for the commissioners, and I'd encourage the commissioners, we all know some legislators personally, and I think it would be good to get some letters to them, some phone calls to them, and I suppose we could even discuss, should we be sending a letter, not just to the committees, but to every legislator from the commission, and then maybe follow-up phone calls for those that we know, or something like that, because I think it's important for those who are not on the committee to understand the importance of these programs and the consequences of what, are going to happen if this cut is made the way it's proposed.
I agree, and it's Rachel. She'll put together the talking points.
Oh, wait, what?
You said Keandra will put them together, but I can't, so you.
Everybody keeps confusing me and Keandra.
No, but-
Like,
Oh.
I'm Rachel.
Keandra did, that was going to be my last comment, was to thank her, but correct me if I'm wrong, but you've asked Kendra to do the talking points. I said Keandra instead of Kendra, I'm sorry. Got too many Myras, Kendras. And then that's really right. But lastly, also had a chat with Commissioner Chambers and heard about what she went through along with Brenda. And I thank you both for carrying the torch the last few days.
Thank you, Sheriff. Commissioner Gordon.
Thank you, Chair. And I just wanted to come back to the issue that I mentioned earlier. I think when something goes on a statewide ballot and representations are made, and I had many, many conversations with people about, well, what will be the residual responsibilities of the commission? And that was an evolving negotiation. And what I drew from it was, just in shorthand, that beefing up the FSPs would be one clear mission of the commission, and incorporating substance abuse into the strategies the state uses. Just yesterday morning, I had a conversation with our county health director. We have 50 clinicians posted under Medi-Cal in our schools to do some pilots around how do we incorporate substance abuse into those services. It's very tricky, but we have some places that have evolved. So those are the kinds of things that are real out there, and I'd just like to be clear with people. If this is not going to be funded, okay, let's be clear. Let's be straight about it. But I think we do have to push. I think we do have to push back.
Absolutely.
Thank you, Commissioner Gordon.
To follow up on what some of the other commissioners said, for one thing, Commissioner Gordon, if any of those people you talk to are still in a decision-making position, because some of them are gone, I'd like to know who they are, not like publicly, but so that we can hold them accountable, but I'm not sure a lot of them are still in decision-making authority positions. Secondly, in the information that's provided to the commissioners and to the legislature, it would be helpful if you would spell out specifically, I know with regard to the the first five, the 0 to 5, there are specific projects in counties. It would be really helpful to spell out what counties they're in, and it would be really helpful to spell out what legislative district they're in as well.
Will do. Thank you for that guidance. That's an important call to action. Well, thank you very much, commissioners, for that discussion. I want to open it up for public comment on this item.
We currently have one in-room comment from Michael.
Hello, my name is Michael, and I want to give a story of my personal experience not having peer respite funding. As 2019, my first psychiatric hold, we jumped to, I'm at acute mental health hospital. It's bedtime. I go to the nurse, first day I get there. I go to the nurse, I ask for something to help me sleep, just a Benadryl, something like that. Every 20, 30 minutes, a few hours go by, doctor hasn't ordered anything. The nurse tells me, you're having an emergency, tells me to go to my room, lie down, face down on my bed, as 5 or 10 people hold me down to give me, pardon the terminology, butt juice, Haldol, Gladol, Benadryl. All I was doing was asking for something to help me sleep, not asking for medicine to be shoved muscularly into my body. Peer respite funding, in my opinion, is very important. Thank you.
Thank you, Michael.
Thank you, Michael. Our next comments are virtual. We have 2 of them. Our first comment is from Dr. Isrule. Your line is open.
Hello, good morning, commissioners. My name is Dr. Isratullah Mohammed, and I'm offering this comment in response to your call for alignment, your call for equity, and also your call for action. I want to speak to the intersection of equity infrastructure and workforce safety, an area of the Bureau Care to Custody Cemetery pipeline uniquely identified. The Bureau Care to Custody Cemetery pipeline is a systems equity model I developed to identify preventable harm points across public behavioral health systems, including workforce exclusion, trauma neglect, and procedural opacity. My April 10 and my April 24 public comments documented how structural improvements now visible in ARISE, postvention, and access tracking protocols were shaped by frameworks I submitted during periods of medical leave without inclusion or acknowledgement. This pattern, involving extracting solutions from vulnerable contributors while excluding them from decision-making, undermines equity, safety, and trust. It's not a model of transformation, it's institutionalized erasure. The Bureau Care to Custody Cemetery pipeline is already working. It offers measurable strategies grounded in clinical experience and community-informed systems analysis. But it cannot be ethically used unless it is applied with transparency, fidelity, and formal engagement. Today's meeting underscores the urgency of now. I'm asking the Commission, will reform be extractive, or will this moment become a turning point towards accountable public leadership? Thank you for your time and continued oversight.
Thank you.
Thank you. Our next public comment is from Steve. Your line is open. Steve, it looks like you're still muted.
Can you hear me okay now?
Yes, we can.
All right. You'd think after all these years. My name is Steve McNally. I'm a family member. My son has schizophrenia. All his family relationships are restored. He's been through many of the programs offered at the county level, and our county does in Orange County offer a lot. I'm on a local board, but my comments will be my own. I would just ask that you extend your influence to the rest of us. We all know legislators, and if the talking points come from family members who have access to legislators as well as the most influential group in the state, I think it closes the loop. 2, it's very easy to connect you to the Behavioral Planning Council and to the local boards and commissions that will give you 1,000 people to carry the message, assuming we all want to carry the same message. As a family member, it's so hard to watch California because we spend the most, but we don't like really focus on data and outcomes. As your previous executive director says, data was all around us, but nobody really wants to look at it. One of the concerns I have is I don't think we've leveraged our assets in a way that people understand it. And one area is all of the CalAIM and all the funding that's gotten pulled out of county mental health and put in other areas. So the schools have their budgets. CalAIM has their budgets. If you go to the open data portal, you can see the enhanced care management counts by county. And I just think I would ask for honesty of where we really are. It hurts me when I see agencies, state agencies, act as if politicians, that when it's announced, it's all working perfectly, and then they never follow up, and they make it seem like we're not deserving of seeing the information. And when you limit the amount of people that you can hear from, which is what I see in the state, your ability to get the inexpensive free process improvement type improvements done easily. So one big thing that could be done is empower the families to become healthy as a prevention strategy, since prevention is gone away for the most part. And to the commissioner's discussion about substance use disorder, we could all see it coming. Just because we added the word substance use disorder to the MHSA and called it BHSA, we didn't add any money. We didn't add any resources. And they're two different animals. Animal's not the right word. They're two different arenas. So again, I just ask that you consider sharing your influence and look downward and upward, not just upward, because I think looking upward has been where this commission has been, to the detriment of family members. Thank you.
Thank you, Steve. That was our last public comment.
Thank you, Mariani. And thank you, commissioners and members of the public, for that robust discussion. Now that public comment has closed, I would entertain the motion that the commission approves the fiscal year 24-25 expenditure plan and associated contracts.
Do we have a motion?
I'll move it.
Thank you.
Second.
Thank you, Commissioner Robinson. We have a motion and a second. Are there any additional questions or comments from commissioners? I do want to reiterate the call for regular communication as things develop. I heard that from multiple commissioners. So really making sure that this commission is kept abreast of the moving conversations and the negotiations in the budget. The next few weeks are incredibly busy. We have two commissioner representatives here with us that we're fortunate to have, but we want to ensure that the responsibility of the staff is not unappreciated. So Kendra, we're looking at you. Thanks in advance for the regular communications that will enable this commission to have the information that they need to be involved. Commissioner Bunch, please.
I just clarifying, do we need to specifically take out the 18,000 or that's just assumed? Or do we need to change the proposal to take
No,
it out?
what we would do is make a notation, it's been captured in the minutes, to say that the expenditure plan, with the exception of the 18,000, will and associated contracts. Is that, Roulette, as the move?
It's acceptable.
Great. Robinson, that it? Okay. I can move forward with the vote.
Great, thank you.
Again, to the commissioners joining us online, I'm asking you right now to unmute yourselves so that I can have a visual and an audio representation of your vote. Commissioner Baer,
Yes, yes.
Commissioner Bernick,
Yes.
Commissioner Bontrager,
Aye.
Commissioner Brown,
Aye.
Commissioner Bunch, Commissioner Callan,
Aye.
Commissioner Carnevale, Commissioner Chambers, Commissioner Contreras, Commissioner Designee Swartz, Commissioner Cross,
Aye.
Commissioner Fairweather, Commissioner Fernandez,
Aye.
Commissioner Gordon,
Aye.
Commissioner Designee Pomano, Commissioner Larson,
Aye.
Commissioner Madrigal Weiss, Commissioner Mitchell, Commissioner Robinson,
Aye.
Commissioner Southard, Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilks,
Aye.
Commissioner, Vice Chair Roulette,
Aye.
Chair Alvarez.
Aye.
Motion passes.
Thank you so much. And now we are going to hit reverse and go to agenda item 5. I am so sorry. In my excitement to be back, I skipped a very important item, which is our advocacy spotlight. So huge appreciation for your patience with my confusion. We're going to be moving on to the portion of our agenda where we have the opportunity to hear from our contracted advocacy organizations. These are organizations that work with us to give us their updates on providing the advocacy that's necessary to move the state forward on behalf of many of our most vulnerable, most marginalized, most underserved communities. We have a number of contracts with a variety of population-specific entities, everything from consumers to racial and ethnic communities, LGBTQ communities, K through 12, immigrants and refugees, transition-age youth, and as we'll hear from today, veterans. All of these populations experience unique behavioral health challenges that are rooted in systemic, cultural, economic, and social barriers. And so hearing directly from them not only gives us a better understanding of the work that they're doing, but frankly, the collective responsibility that we have to do better as California. So for this month's Advocacy Spotlight, I'd like to welcome representatives from the California Association of Veteran Service Agencies. We look forward to having you share with us the exciting advocacy work that's doing with our veteran community. So please, Robert and Michael, welcome.
Thank you. Thank you. So I'll just pick it off here, and feel like Mrs. Lincoln, how'd you like the play after that news? But my name is Michael Blecker, and I'm the a senior advisor for Swords to Plowshares, but I'm also serving as president of the California Association of Veteran Service Providers. And there's Mr. Robert Story. Robert, you want to?
Good morning, commissioners, and thank you for having us here. Appreciate your time. So my name is Robert Story. I've been a therapist for over 30 years, and I currently am the executive director of US Vets, one of the 7 sites in California and Los Angeles. And then I also oversee the site in Orange County. So I'll share a little bit about that. Thank you for having us.
Very good. So thank you. And so CAVSA, and I'm a Vietnam combat veteran, and have been working at Swords for many years. So CAVSA is a consortium of 6 nonprofits. Here's our slide, who we are. Go there, I'm sorry. And those are the member agencies. You're going to start with Nation's Finest that are in Sacramento and also in Santa Rosa and other Northern California rural areas. Swords were in San Francisco and Oakland. US Vets, which is in LA, Orange County, I believe in Long Beach. Veterans Village of San Diego. New Directions, which also is in LA, and California Vets Assistance Foundation, which is in Bakersfield. So we're all sort of, community-based 501c3 nonprofits and been doing this work for years. We're like deep in our communities. And I think I'd like to say, certainly in San Francisco and Oakland, when vets on the street say, who's the real organization, who's doing the good work, Swords to Plowshares comes up, just as the other organizations. So we've been doing this work for many years and just discovering the issues that come up, and it's like veterans helping veterans in our case, and certainly veterans who have a lived experience on the street. So that's been our main issue. So we serve veterans who have various issues around the 2 twin issues of mental health and substance abuse. And especially we're seeing a lot of senior vets, and there's all these range of issues that start with, depression and being on the street that advances all your other chronic, conditions. Most veterans who are 50 really have the health profile of somebody who's 70, 75, and they have these advanced health conditions. So we're seeing that. Substance use, like I said, pain, just basically pain, lots of depression, that kind of thing. And they include, justice involved vets, women vets, vets of color, those in rural areas, and of course, we cut our teeth in homelessness and veterans who are in extreme poverty and are underserved. So that's who we are, and that's who we serve. In California, 65% of veterans are over 55. And as I mentioned, they have accelerated health conditions, issues around PTSD and pulmonary issues and pain, as I mentioned, all those advanced conditions that you typically have. but they also have the mental health issues. And the mental health, especially those who are underserved, whether they're older veterans or women veterans who have something like twice the rate of depression as other vets, who screen positive for PTSD. A lot of women vets, especially for those who are homeless, have experienced military sexual trauma, and those who experience military sexual trauma are twice as likely to experience homelessness. So these are extreme veterans who are in extreme poverty, and that's been our focus, and that's been kind of a street deal. We have peer counselors, folks with lived experience who are helping our vets navigate out of the system. We work very closely with this community-based system of care. Of course, you're all well aware of that with what the counties provide. And we have to know what's going on and how our vets can get in, how they can get into the VA, et cetera. So our work is, involves, this wraparound care. We actually build housing. I think CAVSA itself has taken the VHHP program, if you're aware of that, Veterans Housing and Homeless Provision, and created permanent supportive housing out of that. And those houses are filled with veterans who were previously homeless. So they have these serious profiles. So what we have to do is more than just wellness checks. We have to really work with those folks on the quality of life issues. And we do that, quote, wraparound care. And essentially, we're just trying to provide them the attention they need. Recently, we've been able to get one of the governor's initiatives called the Veterans Self-Reliance Program, but it's essentially around those who are seniors who need more individual attention. And we've learned, again, no surprises, by giving folks attention, helping them with their transportation, helping them with their shopping, their food services, being involved with their issues on a daily basis, it makes a big difference. And we've had some really incredible, really success with that program, which we testified with Cal Vet at a hearing recently. Our advocacy, we work to elevate vets at the local agencies in the state through reports, recommendations. I think we have an annual report that goes out, and so forth. So I'm trying to talk as fast as I can here. So essentially, we really function as we're out in the field, and we function as a super low barrier kind of program. Very welcoming. We have to get vets inside, and once we do that, we sort of work with them as best we can. Have very little paperwork, bureaucracy, provide the wraparound care we can. We help them with issues around their benefit claims with the VA. Too many veterans have lost out from those benefits. They've never gotten the benefits they deserve, whether that's income assistance or even eligibility to VA health care. But it takes some doing. It takes being out there. It takes having that rapport, being able to work closely with vets, being able to offer them something, and then you start, these layers come down. This is all familiar work, but so much of it is really mental health issues, resistance, treatment resistance, what have you. And that's, we really provide that. So our year one highlights, are in the report. I think we did a lobby day, and, thanks to the Behavioral Health, now it's Behavioral Health Service Commission Oversight Act, we've been able to really sort of activate ourselves at the advocacy level and coordinate that advocacy. So we had the annual report we released. We did suicide prevention and awareness and virtual summits that Robert will talk about more. We do the stand downs, which is like you may have heard about this, sort of an intervention where you create sort of a military base camp. We've been doing it for many years, but it's we take literally a football field and created like a base camp of tents, and over the course of days, we literally try to, those who are on the streets, work with them. They form their own networks, and it's like a 2 or 3 day function, and it's been, remarkable how we've been able to get vets back into the system of care. And we've also had listening sessions, an advocacy toolkit, and recently provided information at the Assembly and Military Veterans Affairs Committee. There I am in the corner in case you know, you want me to sign off on that, I can give you a printed copy of that. So that's sort of the nature of what we've been doing with that, those cycles of funds. We've had 3-year funding. This is, I think, the beginning of our second year. We had a previous 3-year cycle as well. So 2 of the features of that, one is we call combat to community, which is really to like inform first responders of what it means to be in the military. I mean, I was in Vietnam, so that seems like ancient times, but we've had almost ongoing war since 9/11. And so that has meant taking reservists who never expected to go to war, being in war, multiple deployments, the issues around all those invisible wounds of war, trauma, you know, explosive devices, PTSD, the toxic quality of that war, you know, those environmental toxics of those, you know, the burn pits, and you're putting veterans in, you're putting young people, men and women, into that situation repeatedly. And we don't even know what the impact that's going to have because it's so new. But we know that the war, you know, the legacies of war do not go away. It has, you know, impact far, far beyond the battlefield. That we know. And so that means mental health. That means we need to care for these veterans. We have to make sure their needs are met so, you know, they can go on with decent lives. So some of the combat to community includes things like, you know, what was the experience like driving in Iraq and Afghanistan? It was like a little bit different than driving in this. I mean, I know there's defensive driving and even non-defensive driving, but combat driving is kind of a different story. So you're driving, and that's what so many vets ended up doing, driving these roads or explosive device, trying to even park in a parking lot. Not like an easy thing, thinking about that. Those are triggers, see? Those are tendencies, those are issues that weigh on our young people today. And so the idea is like, how do you sort of take the rest of the community? So many of us, well, only 1% really bore the burden of that war, right? Really. And their families. How do you take that experience and how do you make sure the country and their communities and their neighbors understand what they just went through, right? So we can deal with crises that come up. And you know, not to mention the sheer moral injury of war. You know, when you go through a war and you think about some of those soldiers who look back and did we really make things much better in Iraq or Afghanistan, and how that weighs on them. Anyway, we do this combat to community. It's just a way of broadening the issue of raising awareness, getting more resources to bear on the problems. And again, it's mental health, it's substance use, it's depression, it's all those things that prevent people from living their lives. Another big issue has been suicide prevention. And Robert, I want you to, maybe you could take us through that.
Thank you, Michael. Just from a different standpoint, I came to US Vets 10 years ago. I was the director for the Suicide Prevention Center for Los Angeles and Orange County. While being there for 3 years, I started to understand there was a statistic that I had no idea about as a civilian, that veterans were dying twice as often as their civilian counterparts. That women veterans were 8 times more likely to die than their civilian counterparts. This really surprised and shocked me both. So when I saw the opening at US Vets, I came over to US Vets 10 years ago. The particular interesting, different thing about my site is it isn't necessarily about taking homeless and getting them into temporary and putting wraparound services. The other 6 sites we have in the LA Orange County area do that. My site is specifically prevention and early intervention. What about those veterans he was just mentioning that come home? Who's taking care of them to make sure they don't travel down that same road? So we provide education, mental health support, a specific program for women veterans, because I learned, as some of you may already know, if you're a woman veteran and you walk into the VA, it doesn't always feel like the most friendly, welcoming place. So we developed a program several years back. We've developed a vet-to-peer program where we took some of our more marginalized vets and we taught them how to be peers. There aren't enough therapists in California. These people were amazing. We graduated 2 years of classes for 240 veterans, and we placed them in jobs. So these things were incredible. The suicide prevention thing, of course, I brought to US Vets a little before it started really becoming well known. So your support and the advocacy, I do want you to leave and hope you know you not only make a difference with the work you do, but you save lives in some cases. Because of your advocacy, we joined with CalVet, that's me and one of the veterans you're going to hear from in just a minute. And we created this event once a year on the virtual platform of CalVet, which reaches over 90,000 veterans across the state of California. Nothing I could do, thanks to the pandemic, or thought about doing in person, although I've done in-person workshops and seminars as well. We also did another one with the LGBTQ community, and I thought, well, they're going to come right out for this. They didn't come right out. The reason they didn't come right out is they weren't treated, a lot of them, very well in the military. So I had to go back and work harder to reach that community. But we are working with them in Orange County. There are several of us working together with marginalized African American, Latinx, Pacific Islanders, and LGBTQ, as well as us. And we're coming together creating events. So it's a phenomenal level of advocacy that's taking place. And each year we have people with lived experience, people who've survived an attempt, or people who've lost someone. I am a suicide loss survivor, and I didn't recognize when I would go to events and start talking about suicide that right next to me was a veteran who'd lost somebody. Next to him was another veteran. Next to her was a veteran who had an attempt. You know, the issue became poignantly clear, and so I started really taking the advocacy support and creating these opportunities. So that's just one of the things that we've been working on that I'm very proud of, that we'll continue to do. And I want to thank you again for that support. Next slide. Some of the other things that we've done is you just heard about the stand downs. I don't know if you know a stand down, where Michael mentioned you create this community and you provide everything from haircuts to groceries and services, from dental to medical to mental health. Well, the other thing we do, I'm in downtown Los Angeles in Patriotic Hall, and in Orange County we're in the Tierney Center. We have legal intertwined with our work. There are veterans that still don't have an honorable discharge that need an upgrade. There are veterans with something on their record that'll prevent them from housing or a job. So we provide that legal support at these events as well. So we outreach. It's a bridge, just like some of the other veterans that didn't come running into the conference that I did. We built this amazing Women Veterans Program, and we had 5,000 hits. It was to provide free mental health, and nobody came in for mental health. I thought, well, what's the problem here? Well, women veterans didn't trust that somebody just popping up a website, you know, was going to be able to satisfy their needs. So events like this brings women and men and marginalized communities together and allows us to do the advocacy and also to teach them about advocacy that they need to do. Next slide. In addition, we were up here just recently, and that's always a privilege to be up here. We released our annual report, which you can find on the CAVSA website. I also brought 4 veterans from 4 different agencies with me who had lived experience of either substance abuse, mental health issues, attempts, or surviving suicide loss. And they testified at this as well, or they shared their experience and their hope. All 4 of these veterans at one time were homeless, one of them in this particular area. And one of them was in and out of jail several times, and now all 4 of them work for us and are the most amazing peer advocates because they're teaching their brothers and sisters what they need to know. Next slide. You've heard about the advocacy toolkit. It seems like that might be something easy to do. Veterans are reluctant to ask for help and often reluctant to share about the things that they need to do to get the help that they want. So this particular kit teaches veterans, and I share this as well, how to tell your story. It's cathartic to tell your story, but sometimes it's not as cathartic as it is important for the audience to hear you and know what you have to share. So they are motivated not only by some of the trauma and the grief, but also the hope, and that there is an opportunity then to do that. Also teaches them how to intertwine or interact with the communities they're in, to learn the Board of Supervisors aren't so scary. I've been invited to mayor's lunches as a result of their advocacy that I never would have made it into. The veterans that we have 4 of them hired, and one, again, you're going to hear, that really are promoting the support and the advocacy that you all have provided. So this particular toolkit is doing an immense amount to create an army of people advocating. Next slide. I think we're almost done here. This also was another event where we came up to testify for the Veteran Affairs Committee just on the importance. As the landscape changed, and y'all are aware of the landscaping change on the federal level, you know, California is pretty amazing, just to remind everybody not to forget the veterans, that things may be pulled back in some of our housing, may be threatened, some of the services we provide. but we're here today as a result of some of the support. I believe that's the last slide we have. So I just want to take a few minutes, I think it's less than about 3 minutes, to share a video by a gentleman by the name of Juan Garcia, who was a combat vet in Iraq and Afghanistan, previously homeless, had lost everything, and he'll tell you a little bit about himself and some of the work he was able to advocate to create. If somebody can cue that up. And if you can't cue it up, I'll tell you about it.
Juan Garcia, retired Army 82nd Airborne, Initial Invasion Combat Veteran. I'm also the U.S. Vets Orange County Veteran Peer Outreach Program Coordinator. My reintegration wasn't the best. When I got out of the military, one of the things that I had to deal with was mental health challenges, suicidal ideation, depression, isolation, and I've actually lost about 80% of a lot of my combat buddies to either suicide or to death in combat. What ended up happening is that when I got out of the military, the first thing that happened to me was that I was dealing with a lot of stress and post-traumatic stress. After that, I went ahead and enrolled into school. I had somebody actually give me some guidance, some peer support, and walk me through the motions of how to be able to reintegrate back into civilian life. And that was a key component for my reintegration success. I enrolled into USC, I received my master's degree, and that's when I started doing my internship with US Vets. Once I started with US Vets, I rekindled this purpose in my life, and I was able to see something that really just drove me, and it made me feel like I was giving back and helping out those that didn't have nobody to support them. Fast forward a few years later, now I work with the county. I'm also the Veterans Military Family Collaborative Health and Wellness Chair. The integral part to the success of the program and my integration is going to be our team, our veteran peer team that has lived experiences. They are the main thing that connects veterans together in reintegration, in really identifying the challenges, the red flags, and the warning signs, so that we can be able to assist our other veterans through those lived experiences. What we do in the community is we provide trainings on suicide awareness, prevention. We also create events out in the community that are mental health focused, but not really mental health focused, like art shows, car shows, maybe even trainings that just bring community together. For example, one of them that's really important to me is Women Veterans Warrior Wellness Makeover and Mingle, where women veterans come together, the males, which is us who facilitate this, step out of the room and let these women just connect and build community. They get their hair done, their makeup done, and they actually are able to just really solidify relationships. So working together in collaboration with community partners that are veteran-led and non-veteran-led is the essential component to our success at the end of the day. But most importantly, the backbone is the team that we have. That team with those lived experiences that can now, of course, advocate on behalf of other veterans. Lastly, what I want to say is that despite all of my challenges in my life, I was able to really find my purpose. I got remarried, I adopted 2 amazing children. I now have a place and a purpose here at US Vets Orange County. But most importantly, I found myself. And that is something that you can't find without having peer support or other veterans to be able to walk you through the motions. So the success story begins with trials and tribulations, challenges, and here we are today. So thank you so much for your time. US Vets Orange County, Juan Garcia.
Juan's really unique in the sense that we didn't have a U.S. Vets Orange County, but we had Juan's program and advocacy, and Juan grew it into a one-stop service center for veterans and continues to advocate. And he's put on over 20 events. He's joined with Orange County for vets, and they've created this elaborate event. Plus, he's worked with all these other organizations. And he hired 3 veterans, and his team is rather miraculous. So I just want to tell you all thank you. I want to remind you, and I think Michael does as well, that we did have Juan's program called the Veteran Peer Outreach Program, which is going to sunset June 30th as a result of some of the funding that has shifted. 80% of my budget initially was raised by private foundations and endowments. I worked really hard with the Orange County Steering Committee to advocate and get them to cover. They covered that, and they covered another program called Outside the Wire, where we have over 18 campuses now between LA and Orange County, where we have counselors as well as interns embedded right in the Veteran Resource Center. So it mitigates the access to mental health. You don't have to call, you don't have to wait, you can go between classes. I heard from someone I hired that once saved his life. So the program also is sunsetting Now, we do have a state program that's picking up. And the second year, we have to raise 25% and then 50% and eventually sustain it on our own. So I just want you to keep in mind as you work with counties and making sure that you advocate that veterans are on the docket somewhere, because both of those programs, as a result of the shift in money from Proposition 1, are now defunded. I've had the Outside the Wire program for over 11 years, and the Veteran Peer Outreach program we created together with Orange County about 3 years ago. So again, thank you for your time and having us here this morning, and really appreciate your support. Michael?
I'd like to leave a little time for Q&A, but I do want to echo that is the struggle vets have had at the county mental health level to get recognized. They just assume that the VA takes care of all these problems, even if a vet has less than honorable discharge or has eligibility issues. So we're pretty invisible at the county mental health. We've struggled to get recognition, but I think the data shows that very little vets receive any of the Prop 63 dollars over the many years it's been in place. And so I think there's a need to, because Prop 1 was really a big, prominent, vets played a prominent role in getting that passed. And I think that somehow there needs to be, at the county levels, we need to identify how many vets you're serving, a report card, so to speak, because they will not do it otherwise. But I'm open for...
Any questions or any thoughts?
Thank you so much, Michael and Robert. This is such a wonderful opportunity to really better understand what our advocacy partners are doing. That was enlightening and that was moving. And you really called us into the experience of veterans and the contributions and the challenges that they're facing. So just deep appreciation for your presentation and for being with us today. I want to open it up for comments, reflections, questions from our commissioners. Commissioner Sy, please.
Thank you. Really inspiring presentation. Just a quick data-related question on the the suicide numbers for veterans. Because I'm familiar with kind of the medical examiner process for deaths. Is there a possibility that these are undercounts, or is there a lot of confidence that all of the numbers are attached to veteran status?
Thank you. Yeah, no, I appreciate that. That's a very wise question. I'm co-chairing the Governor's Challenge here in California for suicide prevention with Roberto Herrera from CalVet. And one of the studies we're doing is exactly what you're talking about, Commissioner. We know that it's underreported. We know that different counties report that information differently. They don't ask sometimes, or they'll ask if they've served, and sometimes their relatives don't understand. So we are now commissioning a study with USC and Cal State Long Beach to go across and work with the medical examiners to see if we can find a common way to have that information reported, because we know it's unreported. Veterans make up more than 15% of the suicides. So we do work on gun safety or managing your firearms as well as having lived experience. But you're correct. The need is still so great. And just lastly, I'll tell you the story about this veteran that came in because he'd been in mental health on our campus, and then because of mental health, he heard about our employment program. And I work in an office with cubes, so I was overhearing the interview for him. This guy was working on his second master's. Was it incredible? I heard his leadership skills, his presence. He couldn't find a job anywhere. So we hired him. I walked around and said, you got to get this guy. He worked with us only to find out when it came time to really do some of the suicide prevention work. He'd lost his best friend, and he himself was contemplating it at the time. So a year later, after being with us, he was able to find a really much better paying job than I could afford, but a complete success story. He had his first child and is doing very well. So thank you for that question.
Thank you. Commissioner Robinson.
Yeah, great presentation, and thank you both for your service to the country. And just before you get to my question, I'm having a flashback moment here. I spent my career, a big part of my career in the VA as a psychologist, and in the late 90s, I was a reviewer for a program in the VA called the Homeless Grant and Per Diem Program. And I seem to recall reviewing, I don't know, do you ever get a grant from?
Sure did, yeah.
Yeah, I think it's one, yeah, I recall the name. And so fantastic program even back then. And it's one of the, I think, great things that the VA did. And it's also sad in some ways to hear, I know we've made a lot of progress in some ways, but it's sad to hear some of the same issues from when I was still in the VA, and that we continue with. But my question is this. It's about trust, and how do we improve as an industry in gaining the trust of veterans? I know, in working even specifically with homeless veterans, it's a long road to gain their trust. But in your experience, what can we do to better open up veterans to trusting entities so that we can start having conversations about providing behavioral health services?
Yeah, I mean, I would say there's a lot of, cultural competency, like how to, talk to a vet, right? Or if you recognize the service, you don't ask how many people did you kill. You ask things like, did you serve? What was that like? You sort of have some basis for that someone really thinks that you have an interest in with their well-being. Some of it's just, natural, but I think there are some features of the competency of having folks who understand that experience a little bit. These are veterans who, they were issued a buddy. You had somebody on your left, you somebody on your right, they're gone. And that was 24/7. So they're a little lost, when you initially transition out. And those relationships aren't the same. So folks are, there's just understanding what it means to serve. It's a whole different culture. You're under the Uniform Code of Military Justice. I mean, there's, you have to be super hyper alert. You have to get your mission accomplished. And then you come back and, there's no kind of a feeling of which level of responsibility or accountability or where am I and who do I, the people really feel a little lost by it. And of course, alcohol and drug use, I mean, the military is the alcohol is plentiful. We used to get cigarettes all the time, and we get supplied out in the field, we get a free pack of cigarettes. So, I mean, all that stuff is, the military does that, and then boom, you're out. And there's very little transition when you get out, So I think it's just understanding the culture, what it means to serve in the military can go a long way.
Thank you. Commissioner Bunch and Commissioner Fairweather.
I just want to thank you both for what you do. As with Commissioner Robinson, I've worked with veterans, not in the late 90s, more recently. And the fact that we're still experiencing the same kind of roadblocks is really disheartening. And I appreciate that you guys also partnered with legal entities that can help, because I've worked with so many veterans, particularly in the justice system, who have not been able to get the benefits that they should because of stupid misdemeanors or felonies that they got directly because of the drug use or substance use that they started while they were in the military as ways of coping. So I appreciate everything that you guys do and would love to have your information if you serve all of LA County.
Thank you, yeah.
Absolutely, thank you for
Thank
that,
you.
appreciate that.
Yeah, I mean, there's a whole
Thank
history
you.
of vets denied their adequate due process before the VA. And, black vets were denied. Their rates of getting PTSD are far lower, right? Far lower. And compared to even, Caucasian vets. But they didn't have access to lawyers, for years. You couldn't pay a lawyer more than $10 to work on your claim. So you had to go to these, these untrained lawyers to help you through this, a very complex system to establish that you have an issue and that issue is tied back to the military. And, that's where, we ended up at Swords. We ended up suing the VA multiple times to get recognized. And we finally did in 1977, first group to be recognized. But far too many folks never got their claims for PTSD or any other multiple, the service connection, aggravated. I mean, you think of the PACT Act, you think of these burn pits and the implication. It took 20 years for those, and that's only because the president's son was exposed to the burn pits. But you think of the implication of being next to those football fields where they're just burning everything,
Right.
jet fuel and what have you. So being in the military, whether even in combat or not, is a very dangerous occupation, in every which way, especially for one's mental health.
Thank you. Commissioner Fairweather and then Commissioner Madrigal-Weiss, and then we'll open it up for public comment.
Thank you. And as the veteran advocate seat on this commission, I know these gentlemen. I've worked with them for many years. I just want to say, one, for the PTSD, the rates of PTSD among African Americans and others are the same. It was the rates of actually getting the disability claims and the access to the care. And then to your comment, Commissioner Robinson, you know, people just don't understand the culture that it is, you know, a person who's very young, you know, joins, is in an entirely different culture, different laws, different rules. They're broken down and built back up. They have limited freedoms. They operate under different laws. If they are subject to trauma at the workplace, well, their workplace is their home, and they do not have the ability to walk away. You know, and I remember doing a presentation, and someone asked me just that, well, if it's so bad, why don't people just leave? Oh, it's a little problematic. You know, but just the level of not understanding. And the curriculum that Michael mentioned, the combat community, you know, is tailored for different cohorts are going to have interactions with veterans, whether they be first responders, educators, clinicians, medical providers, to bridge that gap, to give that sort of background, to put on the radar that, you know, think about, is this person, this client who's walking into your agency, are they a veteran? Are they in a veteran's family? Because it's just not, you know, everybody's busy, and it's a real minority of people. So you can see that I'm passionate about it, and, you know, if you have any questions. Oh, one more thing. Those programs that were mentioned that the governor has funded, those are pilots. The VSSR, which is for the older veterans, and the CVHI, which is for mental health, and those are pilots. The funding is going to end, and then nothing. Counties have not funded veteran services through their own MHSA offices. It's very much an uphill battle. And then there's also just a real misunderstanding with the fact that Orange County has pulled back the money from Juan's program with the peers is, I think, and I may be wrong, but the thought was that that was prevention and innovation, and that they were no longer allowed to do that, or intervene, I'm not sure. And, you know, you can, that's a cramped reading of the way the new rules are, and those sorts of programs should be continued to be funded, whether it's for veterans or others. But the counties are sort of getting into a defensive crouch, and I think that, you know, they do have the freedom to do some of those preventative programs. Thank you, and thank you.
Thank you, Commissioner Fairweather. Commissioner Madrigal-Weiss, please.
Thank you. I just wanted to thank you for your presentation, your service then and now. As a daughter of a career Air Force personnel, my dad was in the Air Force my whole lifetime. And then I had two sisters join, one Air Force and one Navy. My dad will say just to piss him off. And, you know, I will tell you, it's also, it's not just the active personnel, it's the family too. And it is a completely different culture. It is a culture of secrecy. It is a culture of toughing things out. It is, and it impacts the whole dynamic. And my sister went off to Desert Storm. The sister I sent away on that plane is not the person who came back. And because of the secrecy, because of worrying about advancement, because you don't talk about those things. And I know she lost people during that. I know she saw people die in front of her. But you come back to this because of the nature of how it's built. And so we want them to serve and do what they're supposed to do, but we don't want to hear about the trauma that's caused. And so it's, I guess I want to say, as we support in the aftermath, we also have to be thinking about the prevention, because we can't have both. They are opposite of each other. And for those, you know, as I live in San Diego County, and I see so many of our vets on the street, and it is heartbreaking. And yet we ask them to be there to serve for us. And so I want us all to think about that when we're advocating, because we must advocate, and we also must think about what we're asking of them and think about prevention, because it's so important. So I just want to say thank you for your service. And one more thing, the other part of the culture is also around, so many functions are around alcohol. So much of deadening the hurt is around substance use disorders, and that's how a lot of this is built up. So I will go back to prevention. So let's think about that as we talk about this. And thank you for mentioning the fact that county behavioral health doesn't necessarily count. So I know what I can do, right? That you said that. So I know what I can do as soon as tomorrow when I go back and I talk to my county behavioral health departments, because if it's not counted, it doesn't exist, and we have to do better. So I appreciate that. Thank you so much.
Thank you, and thank you for sharing about your
Thank
family.
you.
Appreciate that.
Yeah.
Sheriff, please.
Thank you, Madam Chair. Thank you, gentlemen, both for your service. Thank you for what you do with this great association, bringing these groups together. I'm the sheriff in Santa Barbara County, and we have some great programs there that I'd like to just bring to your attention if you're not aware of already. But we have a stand down. It'll be on October the 25th this year.
Great.
And do a great job, and it would be great to have you there. And you might pick up another member. We have an outfit called Echo Group, Band of Brothers, that does great work, very similar to what was described. And they're there to reach out, and we interface with them when we have a veteran in jail that's got troubles, and put them together with this group of people, and they do wonderful work.
Amazing.
The other thing is, I'm so pleased to hear you mention the firearms issue and managing firearms. Right after your presentation, I believe, we're going to have a presentation on a study that we've done on the intersection between firearms and mental health. And one of the findings was just what you said, that the veterans' suicide rate is much higher than the regular rate. And some of the solutions center around storage of firearms during times of crisis and other things that we'd love you to be a part of as well. So.
Yeah, thank you for sharing that. 70% of the vets that die by firearms. And the reason women veterans are dying is because they have access to more lethal means. Actually, women attempt more often 4 times than men, but women veterans tend to die because of the lethal means and the access to firearms.
Right.
So Juan, who you saw, also teaches and shares those kind of workshops. So appreciate your work up there. It's great to hear that. Thank you.
Yeah.
Thank you. Before public comment, I'm saving the best for last, Commissioner Chambers, because I skipped you. I'm so sorry.
Because I'll be talking. I got lived experience in everything. Literally, that's crazy. That's what my family says. But I just, literally. But I would love to connect with you. I represent the consumers and family members seat. I'm a peer. I run a peer-run organization. I advocate for peers with substance use, mental health, veterans, LGBTQ. I think I see opportunity day now, like tomorrow, like for us to bridge our movements together. Like everything I heard is like everything, like, I mean, we have vets. I mean, I feel like we're almost all the same, like, because we're lived experience. But I think so much is not known about the power and the value of the lived experience in county and commercial managed care. And I think if we can synergize our advocacy efforts, because there is a whole set of people fighting for this right now, because as you see with these cuts, they can send you, like we could be talking about a veterans peer respite, and that is possible. You know what I'm saying? That would be the best. And I would love to allyship with you all and fight. I'm in LA County. I'd love to come visit Juan and see, but I think that there's some immediate things that we can start working on, advocacy, and even projects that we could work on together.
Well, I love hearing that. Thank you very much. I'll drop some business cards so you can find me.
Yeah. I mean, as a community-based system, you're really relying on your staff and your staff who has lived experience and have rapport, and they make all the difference in the world, And then if you have some clinical support to support them, but that lived experience, and they become and then how do we get our vets, our houses? How do we get mentors in some of these houses? They can help the brothers and sisters there as caregivers. I mean, that could be, But, it's also triggering. They need support. They can't throw them in there. But the idea of veterans helping their fellow veterans. I mean, that's why we have that vet community center. We have a vet community center where we transport vets in our housing programs, because these public hotels, there's no room to even have community. So we move them to a place where there's this welcoming space, and they can talk to one another, they can learn how to use a goddamn iPhone, because I'm telling you,
Thanks.
that system's going to be upgraded tonight.
If you listen to Juan, there was one main thing he talked about that's a tenet in suicide prevention, and he said, I found my purpose. There was a homeless guy we picked up once. The reason he came in finally from his drug use was because we asked him to hand out flyers. One day he said, I found purpose again. And so he ended up coming in and now becoming an outreach worker. Thank you for that. I appreciate that.
That's how we have the peer training program.
Yeah.
Hey, like literally people are coming from DCFS, coming from the jails. We give them a chance to just do one thing, learn something, and whole lives have changed. And yeah, I do also want to talk to you about the county, because yeah, with Prop 1 and the changes in prevention and early intervention, like that's why we need the MHSA. This is why we need the commission. Like
Yes.
I just want people to know that like the county mental health, which is not against the counties, like that is a system that is set up for itself and to sustain. Commission money is literally injecting millions of dollars into investments that other people cannot do on their own. The counties have so much pressure now with Prop 1 being implemented, and so it's not gonna get easier for them to address these gaps in services. So how do we build allyship, ensure that this money stays, and that we can advocate for people with lived experience across all demographics and issues?
Perfect.
Thank
Thank you.
you.
Well put.
No, it's all good. I think, emphasizing that both and, it's not an either or situation is really important. So thank you, Commissioner Chambers. We're not done yet, gentlemen. If we could please open it up for public comment, Amariani.
We do not have any public comment in the room, but we do have a virtual public comment. We have two of them. The first is from Steve.
Hello, my name's Steve McNally. I'm from Orange County. Yes, Juan Garcia, I'm glad you got to see the video. He's an amazing individual.
Steve, if you're speaking, we are not able to hear you.
Oh. Now? Oh. Can you hear me now? Hello? Hello? Oh, wow.
Steve, we can hear you on
says
Zoom, but
turn up
we're
the
working on
volume.
the room audio.
Oh, okay. Well, for the Zoomers, Juan Garcia is a terrific guy.
We just
And
can't
as
hear him.
and as we all know, individuals make a difference.
Oh, there we go. Steve, we can hear you now. Please start over.
I never heard that before. I may take that out of context someday. Hi, my name is Steve McNally. I'm a family member for Orange County. I was just saying I was glad to see Juan Garcia's video. He is an amazing and terrific guy. I think it echoes the importance of the peer community. It also echoes the importance of cultural competency, both of which were rooted since 2004 in MHSA, but seems to keep getting pushed further and further aside, as with AB 96 becoming a 2-year bill now. And it's also about leveraging funds, as I mentioned earlier. One of the things that we did find in our county was that I think the VA, and the gentleman there can confirm this now or later at some point, was that the VA doesn't really cover the children. And so we had a program that was an award-winning program that also got canceled due to BHSA restrictions and even earlier, where we asked everyone just to put, if you are involved with the military or been involved with the military, do you have children? So we could identify who is really lost and has to be on the safety net potentially. And then the VA, it's very difficult to figure out who actually would qualify in the county as a veteran versus just as whatever their age group is and what their situation is maybe as an older adult. Because the VA, one thing that had come up in one meeting was, and this is the simple resource thing of just the details, was they do a lot of trying to get you connected at the beginning and that's not necessarily the time that you're interested in getting connected. And then maybe 5 years down the road, maybe reconnecting to people and they're maybe a little bit more connected. And we also have Chase Wickersham on our board who does a lot of veteran stuff, and I'm sure you guys are very familiar with him. And the key is trying to leverage what lane people can pull from. And I think if the state could do a better job of all these siloed funding arenas, they silo you all, but they also silo us as advocates and family members. It's almost impossible for someone who has a family member whose family member is symptomatic to ever know how to get through the system, much less their parents when they're overwhelmed. And it's not that hard to navigate once you've done it once or twice. Then it becomes a capacity issue. So uh, anyway, I do appreciate you letting me speak. Um, they do a lot of great work. It's just a matter of finding how do we leverage all the money that's in disparate hands from overlapping, and then also filling the needs and understanding where those needs are. Because a lot of times people just continue to create a program because they don't know another program exists. And since I'm not going to probably do another public comment, I was amiss to say that congratulations, you guys got an incredible new executive director, and I have a fan club for her, 92627. Thank you.
Thank you, Steve. Our next public comment is from Laurel.
Good morning. I'm Laurel Ben-Hamida, and for the veterans who may have just arrived, I am with Mass Social Services Foundation in Sacramento and REMCO.
Excellent.
I want to thank you for your service. Today you're in Sacramento, which is the home of more Afghans than anywhere else in the United States, Syrians and Iraqis as well, many of whom came to the U.S. as special immigrant visa holders. They worked as interpreters and in other ways with your veterans. And so I'm going to pass what I know they would say, thank the veterans who have stepped up to help them and protect them from being deported.
Thank you for sharing that. That's a very pertinent issue, and appreciate your sharing that.
Thank you, Laurel. That was our last public comment.
Thank you, Mariani. Again, thank you so much for your presentation. Thank you for your service, and thank you for your ongoing partnership with the commission in this important work. We look forward to continuing to work with you.
Thank you, commissioners.
Okay. Next on the agenda is the impacts of firearm violence report that Commissioner Brown just referenced. The commission will receive and consider adoption of the policy report, Stopping the Hurt, Preventing the Harms of Firearm Violence Through Public Behavioral Health. We're going to hear a presentation from research scientist Courtney Ackerman, who has spent many hours in partnership with both Commissioners Brown and Commissioner Bunch to develop this report for the commission. So huge thanks to the both of you for the work that you've been doing to move this important report forward, and as well as your leadership, Courtney. So please go ahead.
Thank you. Good morning, commissioners. For those of you who don't know me, again, I'm Courtney Ackerman. I'm a research scientist with the Research and Evaluation and Programs team here at the commission. I have been the staff lead on the Impacts of Firearm Violence project, and as the chair mentioned, I've been guided by Commissioners Bunch and Brown, so thank you very much for your leadership and your guidance over this project. I've been asked to keep this presentation to 10 minutes, which is going to be very tough considering it was 2.5 long years of work, but I will do my very best. But I apologize if it feels a little bit rushed and disjointed. It is a little bit. So I'm going to skip ahead. I'm going to skip the background. I think you already know that firearm violence is a big problem. I think you already know that over 3,000 people die every year in California from firearm violence, and that it has a huge economic toll on all of us, as well as huge physical damage, mental damage, emotional damage, and even spiritual damage. I'm also going to skip talking about the project process, but I really recommend that you go to the final report where we detail all of the really intensive community engagement that we did to work with multiple populations across California that are impacted. But I will stop here and say that our guiding question for this project was on the intersection between firearm violence and mental and behavioral health. Mental illness is often blamed for firearm violence, particularly after a mass shooting. But this project looked at what is the real intersection between the two, and further, depending on the nature of that relationship, what role can behavioral health play in reducing firearm violence? There are just two little bits of key context that I think are important before we get to the findings and recommendations. So first, there is a relationship between firearm violence and behavioral health challenges, as we found. But it's not a simple cause and effect relationship. It's bidirectional, meaning that one affects and influences the other, along with a host of shared risk and protective factors, which we'll get to later. Second, risk for violence is contextual, meaning it's based on circumstances and situations rather than unchangeable personal characteristics. And second, it's dynamic, meaning that it changes over time as circumstances and situations change. All of that is to say that violence is not inevitable, and it is preventable. Throughout this presentation, there are several quotes from experts that we engaged with over this project. I'd love to highlight them, but I'm going to cut them since we don't have a ton of time. But I'd love it if you have time to look back over those quotes because they really add some important texture to this presentation. All right, with that, I'm going to move to the findings and recommendations. First, the project found that while firearm violence is a persistent threat to behavioral health, California is not yet treating it that way. There's a behavioral health disconnect. California has made historic investments to behavioral health in recent years, including the Children and Youth Behavioral Health Initiative, the BHSA, and the Behavioral Health Continuum Infrastructure Program, all of which work to improve behavioral health for Californians. However, there is a gap. These initiatives make virtually no mention of violence as a related outcome. Healing from firearm violence is not only essential for recovery from the direct harms, it's also important for addressing other associated challenges to well-being. In addition, it's essential for the prevention of new harms, and the importance of that can be understood within this framework, the cycle of trauma and violence. I'm not going to go through it in detail, but there is a well-established chain of events that lead to continued pain and suffering that starts with someone being exposed to trauma, which leads to changes in mind and body that can lead to changes in thinking, feeling, and behaving. These lead to an inability to thrive and struggles to get needs met. This can lead to a greater risk of violence, suicide, or a combination of both. And then finally, people, places, and communities that are exposed to this ongoing violence can unconsciously become part of this self-perpetuating trauma and violence cycle. This cycle is not to be understood as inescapable. Many people with trauma in their background never go on to perpetrate violence, and with proper support and healing, people can lift out of this cycle. But on a population level, the cycle will continue unless there are coordinated intervention efforts. And that leads us to our first recommendation. So our recommendation to address finding one is this. California must establish trauma-informed violence prevention as a public behavioral health priority. To interrupt the cycle, we need behavioral health to recognize the harms of firearm violence and prioritize it in our behavioral health initiatives. This would look like acknowledging it as both a factor increasing risk for behavioral health challenges as well as a potential outcome of unmet behavioral health needs. It would also mean implementing firearm violence prevention that is trauma-informed and person-centered. Finally, it would also require measuring firearm violence as part of the implementation of these initiatives. And moving on to finding 2. For our second finding, we learned that California faces challenges for effective firearm violence prevention that stem from misconceptions, cultural tensions, and fear. These constitute major barriers to addressing firearm violence together. The lack of awareness about firearm violence and its precursors and associated harms, misconceptions, and myths about who is involved in firearm violence and where it happens, distrust between communities like law enforcement, highly disadvantaged communities, and gun owners all coalesce to hamper understanding and connection. A focus on firearm access limitations alone is also a barrier to addressing violence. While access limitations are effective and California already has many in place, There are far more opportunities to prevent, intervene, and promote healing that are less politically fraught. So with this understanding, we come to recommendation 2. California must deploy a public engagement and awareness initiative to regain the trust and build relationships with firearm-owning communities and other communities that are most impacted by violence. This means designing solutions with meaningful community involvement from start to finish, in awareness and education campaigns, in the development of policies and strategies, and in their implementation. It also means fostering community-based and community-driven solutions to firearm violence. The communities most impacted are the ones with the subject matter expertise to design effective solutions. I think it was timely that we heard from veterans organization right before this, because that's one of the communities that is most impacted, and that's one of the communities that has the subject matter expertise. We need their involvement and involvement from populations like them to design solutions that are actually going to be effective. All Californians who have a significant stake in firearm violence and its associated negative outcomes must be included in the solution. Nothing about us without us refers to all Californians, including gun owners. And finally, this brings us to our final finding. California's public investments have not been coordinated effectively to address the underlying causes of violence and other public health concerns. There are a host of upstream drivers of violence, and efforts to address them are offered piecemeal instead of in one cohesive strategy. For example, assistance for housing, employment, health, mental and behavioral health, and other supports are generally offered separately rather than through person-centered packages. And as mentioned earlier, behavioral health supports are generally not integrated into firearm violence prevention initiatives, although violence intervention specialists can tell you just how vital they are for people at risk of involvement in violence. In addition, there are very few long-term recovery-oriented services and supports available to survivors of firearm violence. The need for coordination of resources is clear when you consider, I think I skipped too far. The need for coordination of resources is clear when you consider the shared risk and protective factors, as I mentioned earlier. The very same factors are significant for both involvement in firearm violence and the development of behavioral health challenges. When these risk factors are addressed and protective factors bolstered, the outlook is more positive across a range of possible downstream problems, including violence and behavioral health disorders. And this understanding underpins our third recommendation. California must develop a unified strategy with an appointed leader to guide a public health approach to firearm violence prevention that integrates data, resources, and partners from across sectors. California's investments into its citizens' health, safety, and well-being outpaces that of most other states, but problems in public health and well-being persist. These problems persist in part because the available funding has largely been designed and deployed one at a time to address the downstream problems one by one, rather than adopting a unified approach to addressing upstream factors. To create such a unified approach, California needs a statewide strategy that is, 1, integrated, meaning it is built into and across California's systems; 2, collaborative, drawing engagement from multiple sectors, agencies, and areas of expertise; 3, trauma-informed, built on an understanding of the cycle of trauma and violence; 4, using a public health approach of defining the problem, collecting and analyzing data, and implementing and testing new practices methodically. It also needs to be directed by appointed leadership who can champion the work, and it must be accompanied by the infrastructure that will allow for the meaningful cross-system collaboration, data collection, and thoughtful implementation that is required. Firearm violence is preventable, as are the negative physical and mental health outcomes associated with it. With dedicated investment from across the state, the harmful ripple effects of firearm violence can be interrupted, and California's communities can heal and thrive. And with that, I'll conclude my presentation so we can have time for commissioner discussion.
Thank you, Courtney. Let's start with Commissioner Bunch.
Thank you. So first, while I understand the constraints of our time in this commission, I do want to say that I'm really sad that this 2 years of work and education was cut down to only 10 minutes, particularly given that we took this on following the Uvalde shootings. And at that time, I remember the chair saying, no more thoughts and prayers, I want action. This was our action, and we got to hear about it in 10 minutes. So I just want to put that out there because Courtney has done such an amazing job in the last 2 years. I've been with this commission since 2018, and I personally feel like this is the thing that I've been the most proud to be a part of. I feel like that what we've seen, what we've learned, the people that we've had the opportunity to talk to, it's all been really amazing, and I'm just sad that we didn't get more of a time to hear about it. But I wanted to personally thank you, Courtney, for the work that you've done on it, and I really hope you know how sincerely I think you just did an amazing job, and I hope you feel appreciated. And this was, obviously I want to vote to adopt it, but I also just want to thank you for the work that you did on it.
Thanks, Commissioner Bunch. I appreciate that feedback. And actually, we were just having a side conversation about the need to create space for these reports that are requirements and reflect our commitment to these issues, and also not give short shrift to the incredible staff work that goes into creating them. And at the same time, the work doesn't stop with this report. Like, the importance of continuing this commitment is where do we integrate these recommendations and the opportunity the commission has to lead. And one of the things that was so impactful was the work you leaned in on partnership, connecting with the Department of Public Health, connecting with the Attorney General's office. So finding ways where this commission can stay relevant in this work is really where the work begins. So I want to, again, make sure that we're not stopping with this report and exploring the opportunities in the commission's priorities moving forward to integrate the incredible efforts that have happened these last couple of years. Commissioner Brown, please.
Thank you, Madam Chair. I just, first of all, I want to say it was an honor to vice chair this committee and to work with two people that just really poured themselves into this, and I really appreciate it. First, I just want to express my profound thanks and appreciation for Courtney and the tremendous job that she did. She did the heavy lifting on this project. She, I'm sure was so bleary-eyed looking through that report over the last couple of years, and it's amazing that it came out in the format that it did, but I really think she did a wonderful job, and I think it really is a credit to you, and appreciate so much your work. I also want to give high marks to her for her speed presentation today, which is remarkable given the volume of work and research that went into this project. I also want to thank the chair of this committee, Keandra Bunch, not only for her work, with the committee, but for her efforts to really take an open-minded approach to this. And we very early on decided, we stated that what we really wanted to see for this was a practical report that would come out that could be used to save lives without the politics of gun control and the divisiveness that brings. And I really think that you did a great job of molding all of that together. We traveled across the state. We talked to people in very disparate communities, very, very different types of approaches to the problem of gun violence. And I think that we came up with some great sidebar kind of stories about what's in progress and what people are doing, and things that can be replicated, but more importantly, things that can be embraced no matter where you are on the political spectrum. We may have arguments about the Second Amendment and gun control, but nobody really has an argument about wanting to save lives, to prevent suicides, to prevent accidental shootings that maim and kill children. These types of things are really achievable if we all move past the politics and recognize that guns, like it or not, are here to stay. They are part of our culture, they are part of our history, and they're going to be part of our future. And we need to do what we can to make the people who own guns recognize the responsibility that's required that goes along with that, the safe storage and the safe handling of those weapons. And I think many, many lives can be saved. And my hope is that this report will be a tool that can be used by people for many years in the future. So well done.
Commissioner Fairweather, Commissioner Cross. Oh, and Vice Chair Rolette.
Thank you for this report, and I did read the whole thing on the train. It's a big interest of mine, and prior to working with veterans, I worked for the Trauma Foundation and gun violence. Two things. One, in reference to your comments, I know the VA had a partnership with the Shooting Sports Foundation, and that was very effective, especially in rural communities, and the buddy work of like, hey, when you're feeling a certain way, let me take your fire, your guns, your rifles and everything, and when you're ready, I'll give them back. So yes, do it, like finding the creative ways and speaking the language. The other is about, so sort of like concretely moving forward, with these recommendations, and again, I'm new, like, what are the types of action steps that now it just begins? What you said the work is just beginning, so what does that really mean in terms of opportunity?
Thank you. Sorry, I couldn't remember where I was at in line. So I work for a youth collab, and they work collectively with the Department of Public Health and OHI on the Take Space to Pause campaign. It's a public awareness and destigmatization campaign. There's 13 of us, ages 14 to 25, and we have firsthand experience with mental health illnesses. So for your recommendation number 2, I think that it would be extremely important, having a public awareness campaign about firearms and including people who have firsthand experience. You can have the youth involved as well, but I definitely think, honestly, yeah, hit all the age groups. I'm kind of thinking about it. Social media is like the best place to put this stuff out if you want to hit the youth. I think that, I'm sorry, and it just came in my mind because now I'm all excited about it. Yeah, no, just, kind of putting feelers out there about each age group and different communities. We work with underserved communities as well, LGBTQ plus, just as impacted youth. That's just a couple of them. But I definitely think that, adding some effort into that, and I'll back you for it, because I think it's important to have those type of campaigns. But I just wanted to let you know that there is campaigns out there for public awareness, education, and just, destigmatization, making it real to know that people commit suicide with firearms. That's extremely important. And in those situations where suicide is involved, they tell you to enter the environment and make sure that all of the life-harming stuff is gone. If there's chemicals in reach, if there's guns in reach, medications in reach, they tell you to make sure you get that stuff out of the room if you're with somebody who is contemplating or thinking of committing suicide. So firearms, big one. I say get them out of the room, because it's definitely, it's a severe harm for anybody, all age groups, and even the people that they're surrounded with. That's a big safety issue. So education for the public, that builds trust as well, letting them know that hey, we hear you, and we care about what it is that you're saying. So yeah, that's just something I noticed, and I think it would be very beneficial. Thank you, Commissioner Cross. Vice Chair Rolette, and then Commissioner Madrigal-Weiss.
Again, I wanted to thank the committee chair and vice chair for your work and leadership on behalf of the commission. I've been on the commission 4 years now, and certainly have heard a lot about this and support the work and the passion associated with the work. I also, as Commissioner Cross just said, have the unique privilege of being a mentor for a young man who was involved in an incident involving a gun, and understand the importance of advocacy, and have made it my life's mission to continue to do that work, especially in specific communities of color, because the incidents of gun violence appear to be higher in this particular community, where there's social determinants present that are adverse And so, again, I completely not only agree, but embrace what you do, and as a commissioner, do the work as a volunteer to ensure that people make better decisions regarding their usage of guns. And then lastly, Courtney, this is for you. I have been in your unique position where years of work have been distilled down to a 10-minute presentation, albeit a brilliant presentation, Courtney. Now, please hear that. And in fact, I leaned over to Commissioner Bontrager and I said, this is California. Finding 3. California's public investments have not been coordinated. You should be that person that says that, because that's the problem. We have leadership that makes lots of investments, but are they coordinated, and do we have the outcomes and the key performance indicators that show us and demonstrate to us what's working and what's not working? Courtney, I heard you loud and clear. And Commissioner Bontrager said, you can say that about everything. You said that. Yeah, it's true. This was a very powerful presentation. Thank you.
May
Commissioner
1st.
Madrigal-Weiss.
I just want to echo all the praise you're getting. You did an amazing job. And I think that when we first started this journey, it was driven by passion and emotion, and we just couldn't handle it one more time. So you really opened yourself up to it. We didn't know where we were going to go, and you heard, you listened to, the experts, the people, the community. And I read this, brilliantly put together, and really reflects the people and the professionals equally well. And that's hard to do, and you did it. So I can't thank you enough for what you delivered. Just really proud with you, really proud with you. So I want to say that. And I want to thank Commissioners Brown and Commissioner Bunch for walking the path with you so closely. I think it's just done well. And I know I'm really excited because I'm like, oh, I know who we have to get in front of and start sharing this. And so I would offer that once it's adopted, that we do come up with a strategy as to where we share this. So to what other commissioners have said, like, we've read it, great, but this is where the staff and the team come together and really start to develop, like, here's the strategy to get the report out there. So for those that it's the first report out, just know that we'll develop a strategy with the team, and the chair will do that, and just, of course, with the commissioners involved. But I think, I don't think something like this has been out, and at least not recently, so let's do that, because I think it'll be really powerful to do. So thank you again, Courtney. Brilliant job.
Thank you, Commissioner. Seeing no more questions and comments from commissioners, I'd like to open it up for, just kidding. Commissioner Romano.
I was late. The portion on the price Californians pay, is there a little bit more information that you could provide? I think there's like 2 numbers here. I think there's the direct cost, which you had indicated is $6.5 billion per year. And then the overall cost, I think, is $37 billion each year. Can you just give us a little bit more context on what those numbers mean?
Yeah, I don't have the numbers in front of me, but the smaller number refers to things like criminal justice costs, court costs, law enforcement costs, things that are directly attributable to firearm violence, to incidents of violence. That larger number refers to things like work loss, loss of productivity, and harms to well-being for not only the people that are directly impacted, people that are wounded, but also their family members, their loved ones, their peers, and then also first responders, healthcare providers, and community members that are impacted. If you think about when a mass shooting takes place, people don't get right back to work the next day. It's days, sometimes it's weeks before people can get back to work and get back to living their normal lives. So it considers those sorts of costs.
Thank you. Mariani, could you open it up for public comment, please?
Yes. We do not have any public comment in the room. We have one public comment online from Dr. Israele. Your line is open.
All right, thank you again, commissioners. The commission's current report on firearm violence references the very architecture I've spent the last decade developing, an integrated trauma-informed public health framework designed to prevent institutional harm and systemic displacement. On April 10, 2025, I formally introduced the Bureau Care to Custody Cemetery Pipeline, now part of your public record, as a diagnostic tool to track how structural implementation becomes fragmented and leads to not only loss of care, but to increased risk of incarceration, suicide, and violence. What I respectfully urge today is not only alignment, but integrity. As I listen to today's discussion about budgets, grant disbursements, and system alignment, I'm reminded that the most urgent numbers in our system are not on spreadsheets. They're not reflected in invoices, time cards, or minutes. They're measured in lives. A child in Los Angeles County mental health system died by suicide this year. So did a county employee on county grounds. Both preventable, both unacknowledged today. So I ask with humility, but also with moral clarity, what is the cost of a child's life under county care? What is the cost of a worker's death by suicide in a county workplace facility? What is the cost of sidelining those who offer tools to prevent that harm? There's a difference between adoption and implementation, between performance and accountability. The Bureau Care to Custody Cemetery Pipeline is already informing the systems you oversee. The system's equity cannot be built through silent appropriation. It requires authorship integrity, ethical alignment, and structural courage. This is not just about policy, it's about public trust and lives on the line. Thank you for your time. I trust this comment will be reflected in the public record.
Thank you. No, that was our last public comment.
Thank you so much. Now that the public comment has closed, I would entertain the motion that the commission adopt the Impacts of Firearm Violence Project Report.
So moved.
Thank you, Commissioner Bunch. Thank you, Sheriff. We have a motion and a second. Are there any additional questions or comments from commissioners? Seeing none, Sandra, will you please take the roll?
Commissioner, again, reminder to all of the commissioners joining us online to please unmute your lines at this time so that I can get a verbal vote. Commissioner Bear.
Yes.
Commissioner Burnick. Commissioner Bontrager.
Aye.
Commissioner Brown. Commissioner Bunch.
Aye.
Commissioner Callan.
Aye.
Commissioner Carnevale. Commissioner Chambers. Commissioner Contreras. Commissioner Designee Swartz. Commissioner Cross.
Aye.
Commissioner Fairweather.
Aye.
Commissioner Fernandez. Commissioner Gordon.
Aye.
Commissioner Designee Pulmano. Commissioner Larson.
Aye.
Commissioner Madrigal Weiss.
Aye.
Commissioner Mitchell. Commissioner Mitchell. Commissioner Robinson. Commissioner Southard. Commissioner Thomas Beckett.
Aye.
Commissioner Sy.
Aye.
Commissioner Wilks.
Aye.
Vice Chair Roulette.
Aye.
Chair Alvarez.
Aye.
The motion passes.
Thank you so much. Thank you, Courtney. Okay. We are moving on to agenda item number 9. The next few hours will be dedicated to a discussion around our Innovation Partnership Fund and the opportunity in front of the Commission to consider public, private, and nonprofit partnerships. Today's session is offering us a continued opportunity to learn what the best approach. I'm going to use this gavel. Ladies, let's go. I have a gavel. This is new for me. The reason why I would really love for us all to focus on this conversation is that this is one of those unique opportunities for the commission to contribute to the behavioral health landscape. Much of the reflections that we've had over the last couple of meetings have been, what can this commission do to move California's commitment forward to improving the behavioral health of our state? This is one of those unique opportunities. We've had tremendous leadership with Commissioner Carnevale. Now is the time to really pivot and ensure that all of us are engaged at the deepest level possible to maximize this opportunity. So I'm just emphasizing that for our new commissioners, for our existing commissioners, come on board. As Commissioner Carnevale has stressed to us, we really must change the way we've been doing things because we have not been able to deliver on the results that individuals, families, and communities deserve. With Prop 1, with the Behavioral Health Services Act, the Commission has an opportunity to act with the urgency and boldness, connecting across sectors and communities to reimagine how we engage and serve people. So this session is going to include a facilitated discussion hosted by Marco Mij, Managing Director at Sellers Dorsey, to help prioritize potential concepts for further exploration as part of the upcoming Innovation Partnership Fund grant. Marco's very familiar to many folks in the room, and I'll give him his proper introduction when we pivot to that part of the conversation. But part of this discussion today is to really challenge us to think what we can be doing differently. The first part of our agenda is a panel that's really going to ground us in what those opportunities might look like. So let's remind ourselves what got us here. Over the last year, we've explored the potential use of the Innovation Partnership Fund as presented by Commissioner Carnevale at the February Commission meeting. At the same time, at that meeting, we heard loud and clear from the public the community's call to action for the Commission to have a clear process grounded in transparency and accountability. In response, this Commission issued a call for concepts to welcome broad input around how we can help shape priority areas and the overall process moving forward. Together, these efforts reflect our commitment to co-creation, transparency, and continuous refinement as we move toward launching that fund in 2026. To support this work, the Commission's Program Advisory Committee will help iterate key issues and develop a draft framework for the fund. The goal of that framework is to share that framework publicly, to continue to engage with our external partners, and to have this facilitated opportunity from Marco as we move this conversation forward. Right now, we will hear an important panel discussion featuring two distinguished leaders who are shaping that cross-sector collaboration in our state. This first panel will explore successful models of public, private, and nonprofit partnerships, highlight what's working in practice, and really share lessons learned from the field. This is part of our learning journey of what this commission might be able to engage in moving forward. So with us, we have Marisela Rodriguez, who is a senior advisor for civic engagement and strategic partnerships with the Office of Governor Gavin Newsom, and Kate Anderson, who is the director of the Center for Strategic Partnerships in Los Angeles County. Marisela is here in person with us, and Kate is joining us virtually from Los Angeles. So let's start with Marisela. Thank you for being with us.
Thank you so much. I can start again. So thank you so much, Chair, and to the Commission for inviting me to come today and share some background, insights, and best practices. I just want to note that my experience is primarily focused on philanthropy, and so that's what my background that I'll be sharing today is going to focus on. But first, I just want to also just thank the Commission for the work that they're doing, and again, an appreciation for allowing me some time today to share some insights. First, just sharing some background that you probably already know, but think it's worth just reiterating. Just partnerships play a key role in advancing priorities of the state and helping to improve communities and the lives of Californians. They allow two sectors to leverage each other's strengths and have a tangible impact on the most critical issues of our time. I would like to just note that public-private partnerships and the experience that we've had have allowed us to do a couple things: research best practices and develop proof points, identify gaps and needs, support planning process, including engaging and convening trusted intermediaries and community members, pilot and incubate, scale, strengthen capacity of local public intermediaries and the nonprofit sector. I'd encourage you to look at public-private partnerships as an opportunity to be creative and innovative and go beyond the delivery of core government services and look for opportunities to explore new innovations in those services that can be scaled to improve those services. Public-private partnerships are best when there is alignment of interest, opportunities for co-creation, and strong relationships grounded in trust. The governor's office, just as background, has dedicated capacity, including my role as senior advisor, as well as agency liaisons that we have currently 10 across various agencies. This has helped us build our muscle as well as support cross-agency collaboration. And just some notes in terms of what approximately we have to date. We've had about 107 total number of partnerships, $402 billion in total philanthropic funding, matched by $13.6 billion total public funding. Happy to share more on that if folks are interested. The governor's office has collaboratively engaged philanthropy to leverage their subject matter expertise and relationships with community organizations to shape and strengthen public-private partnerships and ensure successful implementation. Public-private partnerships create innovative, high-impact solutions that no sector can achieve alone. Philanthropy and government have periodic meetings to share and strengthen relationships, share information, and I would just encourage this to be a practice that you embed as the work that you do, and can offer a number of different examples that we do. We have cross-sector calls, convenings. We also convene by subject matter. And again, we really focus on the cross-agency collaboration within the administration. I want to note just a couple of different types of models that the state has applied. We have aligned funding. Government encourages further, this is where government encourages further philanthropic investment towards existing aligned priorities, and funders and government inform each other of their work. We also have pooled funding, where government and philanthropy build a joint vehicle for strategic private investment and engage an intermediary to disseminate funds and learnings. As an example of a pooled funding partnership, we have the work that we did in partnership with Sierra Health Foundation, where we launched the Community Economic Mobilization Initiative to assist CBOs via capacity building grants and technical assistance to build their capacity to access and implement historic federal and state investments. And I have a number of examples, but I'm just going to share, and hopefully maybe during discussion can share more examples, because we also have the Master Plan for Career Education. There's a number of examples that I can provide. But I did want to share a couple of best practices. And I've mentioned this a little bit already in my remarks, but invest in relationships, maintain active and consistent touch points with state and philanthropic leaders, and a broad range of stakeholders. Define roles. Very important to define clear roles, responsibilities, and stakes for all involved. Center and communicate impact. Design partnerships in collaboration and in response to community needs. Coordinate on priorities. Coordinate to more effectively execute public programs, identify partnership opportunities, and maximize public and private investments for communities. Connect the dots. Identify areas of cross-sectoral alignment across issue areas and translate them into opportunities for collaboration. Secure early wins and drive for long-term impact. And work towards sustainability. Leverage investments to also center equity. Just a couple of other notes is, to focus on outcomes, and as part of that, would also focus on the work that you're doing in collaboration with philanthropy and with other stakeholders, and look at how effectively key stakeholders are coordinating, how effectively funder prospects have been engaged, and the outcomes of these engagements. I'll go ahead and stop there because I do have a number of examples, but happy to share more in detail as we go through the conversation portion.
Thank you, Marisela. I'm going to transition to Kate, please.
Hi, everyone. My name is Kate Anderson. I am the director for the Center for Strategic Partnerships. Thank you so much. Oh, good. Thank you so much for inviting me here today. I am sad that I can't be there with you in person, and it is so weird to see myself on that big screen over there. And I want to share also that I have invited our center's health equity director, Olivia Sellis, to join me. And so what I will do is give the overview of the Center for Strategic Partnerships, and then, if I may, I will turn it over to Olivia to share a little bit more about innovations. And Olivia is particularly well positioned to talk about the innovations at the cross sector with the Behavioral Health Act, because Olivia spent 14 years working at Department of Mental Health. So I just want to start by thanking you for engaging on this listening session and this tour. And you have a tremendous opportunity with this fund to, as Chair, you described it, to reimagine what behavioral health could be across the state of California. We in the Center for Strategic Partnerships have been around for a little over 9 years. We are embarking on almost having our 10th year anniversary. And we exist to build cross-sector collaborations that transform systems to benefit kids and families. And honestly, that is exactly what you could do with your fund. I think it will be really, really strong if you do it in cross-sector collaboration. And even if you don't, I think you have an opportunity to learn from how others have innovated and use your fund for those innovations, because I have a feeling that your fund may be able to act a little bit in the way that philanthropy acts, and to help counties to be able to innovate. So we in the center have come to realize that the place for sustainable change really is the government, and it's counties on the ground getting the work done. But as all of you, I undoubtedly know, the funding for these services, the funding to support our communities is often so restrained that it is hard for our bureaucrats, and I say that lovingly as one myself, it's hard for our bureaucrats to think creatively. And that's really what the outside funding that the center has been able to bring in has helped our county do. It has helped us to realize our best selves. So I'm going to do two things. One, I'm just going to describe our structure and how we work a little bit, and then I will give one example, and then if I might, I will turn it over to my colleague, Olivia. And apologies if you guys can hear the horns in the background. There's a strike happening here at the Hall of Administration. So if you hear some noise, that's what it is. So this Center for Strategic Partnership is half housed in the County of Los Angeles and then half housed in philanthropy. So I myself am a government employee funded 100% by our county. We work with 12 county department partners, DMH, of course, being one of them and being one of our most innovative, but don't tell our other 11 departments that. And then we are half housed in philanthropy through our fiscal sponsor and strategic partner, Southern California Grantmakers. And what we do, and Maricela described it beautifully, and Maricela, I loved how you sort of boiled it down to here the best practices. We do a lot of exactly what Maricela described. We bring our partners together to co-create systems transformations. Philanthropy is able to bring those catalytic dollars in that can help government act differently when their dollars are constrained. And philanthropy is also the way that we do this here in the County of LA. Philanthropy is also a thought partner. We do not just raise dollars and bring proposals to our friends in philanthropy. We very much bring them into the room to say, here's a problem we want to solve. Will you help us solve it together? So one example that I go to a lot that demonstrates the strength of both of those sectors honestly goes back many, many years and does involve the state. And it involves a set of services called home visiting. So I was sitting with our the head of our Department of Public Social Services one day, honestly, around when I had started. And I said, Ms. Spiller, what are your priorities? What would you like to do? And she said, Kate, too many of my families on public assistance, become Philip's families. At the time, the head of Department of Children and Family Services was Philip Browning. She said, I wish we could stop that from happening. And I said, well, there's no silver bullet to that. But I know that there is a set of services called home visiting where a trained professional works with a family on a voluntary basis, and it is served in other jurisdictions to strengthen families and help keep them together. And let me step back and say, I was able to do that because part of what we do in the center, and I know that you will do as well, is have a listening ear on. And so as I walked into that room with Ms. Spiller, I happened to know that our First Five Commission was very interested in finding sustainable funding, and they too have at least more flexible dollars than the government did. And so I went back to First Five LA and said, DPSS, Department of Public Social Services, is interested in exploring home visiting. We spent 6 to 9 months. These partnerships take time and a lot of effort and a lot of rolling up your sleeves and elbow grease. We spend the next 6 to 9 months developing, honestly, a deal where Department of Public Social Services couldn't commit to funding home visiting, but they were able to commit to exploring sustainable funding if it works. And that's a model that I would very much encourage you to explore as well as you're working with counties. One-time dollars don't change systems. They don't transform how we do things. But one-time dollars used catalytically in partnership with the entity that is able to sustainably fund it, that's what transforms how families are. That's what transforms communities. And that's exactly what happened here. DPSS couldn't commit to the funding, but they could commit to exploring the funding if the pilot was successful. And First Five LA was willing to accept that. They couldn't commit to long-term funding, but they could commit to, I think it was 2 years of funding for 50 women on public social services, 50 women on CalWORKs in Region 5, which is South Los Angeles. And there's a longer story to this. I'm going to tell the shorter version of it. The shorter version of the story is that before the pilot was even halfway through, folks from First Five LA and folks from Department of Public Social Services, this will again tell you how long ago this was, flew up to Sacramento, and Jerry Brown put it in the budget, $50 million that first year for the entire state of California. And it has stayed a budget item, and it has grown over the years. So the entire state of California, of course, including Los Angeles County, now benefits from that funding, where folks on public social services have access to this tremendous resource of home visiting, which we know from studies helps to keep families together, also helps to keep kids out of our juvenile justice system, helps parents get into training and workforce. It has other tremendous benefits. That is one of literally 24 examples that we could give about how we, through cross-sector collaboration and listening and using our supporting philanthropy to invest its funding in innovations, has helped to transform systems in LA. And let me turn it over to my colleague, Olivia, for a few examples.
Sure. Hello, everyone. Thank you for having us here today. I want to acknowledge that I work for Dr. Southard, he and I put together the first mental health services plan that was submitted to the state back in 2004. And so very familiar with how it's evolved. I now work with the Center for Strategic Partnerships after having spent many years in government, and really do on the ground brokering of what actually realizes some of the projects. So what I wanted to share with you today was some ways that we've used philanthropic dollars to really get some initiatives off the ground. So we, here in Los Angeles County, we supported the Incubation Academy, which was a way of bringing on what we call our super grassroots organizations to to participate in the service delivery because we know that they are the trusted messengers in community. And so for one example, I can say one organization needed sexual abuse insurance before they could accept a contract, but they didn't have the funds. And so we were able to pull philanthropic dollars to pay for them so that they could actually participate in the contracting process. Other times, government dollars are not allowed for infrastructure such as billing mechanisms. And so we've used philanthropic dollars to augment what the county was able to set out. Another opportunity that came to mind was actually the Pritzker Center supported the infrastructure so that children involved in the child welfare system could get neurofeedback. We found that a lot of children in child welfare were done with talk therapy, and so neurofeedback was a pilot that we ran that was very successful, but the government BCFS did not have the infrastructure to create the processes and the approvals that they needed by the court so that children under the jurisdiction of child welfare could get access to neurofeedback. So we partnered with Pritzker, and Pritzker helped us create that infrastructure so that kids could get access to those services. Yeah, another one that we talk about is the fiscal intermediary. We have during COVID, the center pooled a lot of different philanthropic organizations came together and pulled some funds and then getting it out into the community really rapidly so that prevention services could be activated in communities. So we mobilized thousands of community health worker promotoras to assist the county in combating COVID. And so there are these, we like to say in LA County that philanthropy is a secret sauce that contributes to really knitting the different continuum cross-sector services that really create the best outcomes for children and families. And so those are just some of the few examples that through the innovations, there might be opportunities in working with philanthropy, leveraging philanthropy, looking to them for ongoing funding, potentially if they're funding ongoing services with community, which many of our philanthropic partners do. Building on their infrastructure, and then also helping advocate for different system changes. So I'm open to question and discussions.
Thank you both so much for your presentation and for educating us about much of the exciting work that's happening in Los Angeles County. I'd like to open it up to commissioners to ask questions and share any reflections on this panel. I see Commissioner Fairweather, Commissioner Larson. Okay, Commissioner Fairweather, please.
Okay, and I apologize that this is my second meeting, so I wasn't as familiar with the run-up to this. The model is a model that, as someone who's worked in private non-for-profit community-based organization has practiced for years. Philanthropy doesn't fund ongoing services, but we can get grants to do pilots, we can do capacity building, we can do things like that. They'll fund for, a few years or maybe a cycle. The longest ever I experienced was the 10-year violence prevention initiative that the California Foundation did 1 million years ago. I can see where this is maybe hasn't been used so much for funding county-based services. So I guess my confusion here is, where does the sustainable funding come in when, I guess it's just a matter of advocacy to say, well, this pilot has worked for 3 years, so legislature throw down the funds. The other thing that I just want to, hang a flag on is, and I'm not that familiar with it, but I did read through these concepts, which I guess there was an RFP. I don't really understand. But I very much agree with the letter from the nonprofit groups, that is to prioritize funding for nonprofits, public agencies, and tribal organizations. I don't really see where the for-profit sector belongs in this other than as subcontractors and vendors. That's all.
Thank you, Commissioner Fairweather. Commissioner Larson.
Thank you for your presentation. I think I'm going to play the new card like Commissioner Bear did earlier. I know we can't do it too much longer, but I'm still a little fuzzy on what we're trying to accomplish with the innovation partnership. And so that's the lens that I'm going to provide my comments around. I'm a little unclear if our goal of this innovation partnership is to ensure that we have public-private partnerships for any of the projects we choose to fund or support, which makes sense in light of the fact that our budget may very well be cut in half. We probably should be trying to leverage as much as we can in terms of private support for any of the projects we're pursuing. I also notice in many of the concepts that were in our packets that they're duplicative of things that are already happening at the statewide level, and so I would hate for us to duplicate efforts when resources are shrinking. And I think the last thing I would say is just that before we decide on funding any projects, I would encourage us to have a agreed upon rubric for making those decisions where all of the commissioners kind of understand how we will be making those decisions and how we will weight different types of proposals.
Thank you for those comments, Commissioner Larson. You actually previewed the next portion of this portion of the agenda, which is to engage in a facilitated discussion around many of those exact questions. And not to say that this couple of hours is going to solve the problem and get us everything we need, but it's helping move that conversation forward to provide our commissioners clarity around expectation setting for this opportunity. So thank you for that. Questions or comments for Marisela? Oh, I see Commissioner Bear, or for Kate or Olivia. Commissioner Bear, please.
I don't want to be repetitive, piggybacking on Commissioner Larson, but we all see the increasing demand and the rising complexity of our needs, and we need to really reach out to all of our community, both public and private, to really require them to be in this with us, and the infrastructure, with the health outcome of our kids, of the youth. So, I mean, this is really super important to me as I sit on this commission.
Thank you, Commissioner Bear. One of the questions that came up, and I heard it in Commissioner Larson, Commissioner Fairweather's, is, much of the presentation from both Marisela and Kate and Olivia really spoke to the power of collaboration between government or county government, state government, and philanthropy. And so Kate, Olivia, Marisela, can you talk a little bit about what have been some of the hesitations with moving beyond philanthropy and looking at venture capitalists, looking at private industry? One of our commissioners who's not here today, but who's a huge champion for bringing in that perspective and that we will continue to learn from, is Commissioner Carnevale. So I'm channeling him. Like, what have been some of the questions or challenges in pursuing those types of opportunities? And where would you caution or encourage us to explore more? Kate, I see your hand. Marisela, you okay with Kate? Okay. You're mute, though. And you seem really... Oh, I think she needs to be unmuted.
Oh, wonderful. Thank you. And I apologize. I transitioned to my phone. And so I think that was the reason that the mute changed. I wanted to, and thank you for the question. I wanted to address Commissioner Fairweather's question and then also kind of describe what I think is a big key to true innovation. So Commissioner Fairweather, if I'm getting your name right, you asked where the sustainability comes from. You know, you noted that philanthropy is often in it for the short term, and then where does the sustainable funding come from? And you kind of used out loud, is it just through advocacy? You present a pilot and then you advocate. And the answer for us here in the center in the County of LA is no. But the trick is, and I think that this is really, really important, you have the government partner there at the beginning. So I would encourage you guys, as you are contemplating your fund, I do believe that bringing in philanthropy and cross-sector partnerships can be absolutely additive. And one thing that you could take from what we've done here in the center and simply just adopt it and apply it is that as you are seeking innovations with the counties of the state of California, that you are funding innovations that they themselves are interested in making. So you could have in an alternate world had First 5 LA work with CalWorks recipients and then knocked on DPSS's door and say, look, see how much we did for your CalWorks participants. And I don't believe it would have been nearly as successful as what we did, which was having DPSS interested in this innovation from the very beginning. And if you've met one of our initiatives, you've met one of our initiatives, which is to say they're all different, but the common component in each of them is two to tango, which is to say that the county has always been interested in each of those innovations. And again, hasn't been able to commit to, okay, here's where we know we're going to get the funding from, but at the very least, they have committed to, we want to innovate like this. We have ideas about where this innovation is going to come from. And not all of them have succeeded. Not all of them have resulted in transformational change, but most of them have.
I'll maybe add to that and then address your question. And I would just, agree with what you're saying. And I think there's different ways to look at public-private partnerships. Like I think sustainability is always, sort of a goal. And, how you get there may be like a journey. And I think that's why I wanted to raise just some of the different like examples, because in some cases we needed to do some research first and like identify like what are the gaps and needs, or we wanted to test something. I think to get to systems change, sometimes you need to go through that process and then see what the opportunities are, bring other folks to the table. That it's government philanthropy, but then you bring in other stakeholders into the conversation so that you can make a greater impact beyond government and beyond philanthropy. And so I think an example I would bring to that would be just what we did with the Master Plan for Career Education, where we're looking at how do we look at changing and connecting the way that our education system and our workforce systems can improve outcomes for diverse students, and with the outcome being allowing them to find quality jobs. And it's been a process there where we did start with convening and engaging folks like Wested and BCG to help us get to community, assess needs, get stakeholder engagement from across different sectors of like, how do we do this? Like, what should we envision that could ultimately create the strategy that was put out publicly, and then begin the process of doing some regional coordination to begin to transform those systems. And then the state is, to Kate's point, the state has been sort of who initiated, this work and is committed to this work. And so as much as there is state investment, there's also an investment that isn't always necessarily from a dollars perspective, but also like, how do people want to change the way the work that they do, whether it's creating access, removing barriers, transforming their system. So I just would also just want to encourage you to look at, those outcome pieces that maybe are not always necessarily going to lead or to an ask related to funding, but you're really trying to do something that will showcase and prove that things need to change and this is how it can change, and then take those learnings to advance your work. So I would say the Master Plan for Career Education is a great example. And we have some more local work that happens. You know, there's great work that's happening in Imperial Valley with Imperial Valley Civic Ecosystem Initiative, where at this point, you know, the state has done the work to facilitate that local infrastructure of convening and engaging, and brought in other philanthropic partners like the Latino Community Foundation, and really building the capacity of the community for them to do the work that they need to do there to improve outcomes. And so, you know, I have a number of different like examples. You know, another one that I you know, just because I was more closely involved with this one, was during the COVID-19 pandemic, where you know, there are a number of different ways that we partnered with philanthropy there and across different sectors. But one key issue that we were looking at was how do we reach communities, especially those who are hard to reach, those who have hesitancy or concerns around getting vaccinated, and knowing where to go and how to get help. And that was also another partnership that we had with PHI and Sierra Health Foundation and a number of other partners that resulted in hundreds of community-based organizations serving as trusted messengers to reach communities, that resulted in a number of different like outcomes in terms of like vaccination rates, et cetera. But at the same time, you know, the work that the state was building around community outreach was being informed by this work, and it also resulted in the creation of a new office, which is the Office of Community Partnerships and Strategic Communications, which went on to do other work related to extreme heat outreach and awareness, and water conservation, mental health services for youth. And so, you know, there's a number of different ways to approach the work beyond just looking at the dollars, and looking at how we can transform systems and bringing the other sectors into play. And in terms of your question, you know, I don't necessarily think there's hesitation to go outside philanthropy. And I imagine that there is some work that's happening across the state related to that. It's just not been my lane and my background. And so, you know, I'm happy to do any kind of follow-up if there's more questions around that. So I wouldn't want to frame it as hesitation. It just has not been my lane.
Other questions or comments from commissioners? Oh, Commissioner Wilks, Commissioner Sy. Did I hear you? No. Commissioner Wilks, please.
From this information, will there be an action?
Not today. Today is information only. But post this panel is the more facilitated discussion around some of the questions that Commissioner Larson raised, that will then lead to additional conversations with stakeholders and community, as well as this commission through the program committee, that will then come back with a framework for our innovation fund, so that this entire commission is bought in to how we're utilizing those resources in the future to make impact.
Okay.
Commissioner Sy, and then Commissioner Gordon.
You actually addressed my question. Thank you.
Great. Commissioner Gordon.
This is not so much a question as there are other innovations that are going on around the schoolwork, for example. There's a huge investment currently, which is time limited, in what are called community schools. So there's money in the billions that's been allocated to actually thousands of schools at this point, to try out approaches to providing different kinds of services, either in collaboration with the schools or by the schools. I think you were talking about the K-16 partnerships in terms of some of the work-based learning. But anyway, I think part of our mission ought to be to consider what happens when those funds run out, if good ideas have been tested and potentially warrant continuation. How are we going to envision continuing that good work that was tested during the community schools experiment? And I'm sure there are other examples like that we ought to be taking a look at.
Thank you, Commissioner Gordon. I appreciate your leadership in bringing in these different perspectives. Completely agree with you. Any other questions or comments for our first two panelists? Okay, well, I think a lot of these questions came up in the discussion that we're going to continue with our facilitator. Marisela, I would invite you to stay and be part of this conversation, but I also recognize you're very busy. Same with you, Kate and Olivia. But we would love to continue to engage in this conversation as we do our best to chart the path forward for this opportunity. Next, I'd like to welcome Marco Mij, Managing Director at Sellers Dorsey, who's a California health policy expert, having served many years in the state government. Just to connect the dots, when we had our budget presentation, we presented the contracts. One of the contracts that we moved forward was engaging Marco in this work to have a third-party facilitator engage us in this conversation. Based on feedback from this commission and the public, the need to have a more concentrated conversation that brings in commissioner perspective and responds to the public was what was brought up time and time again. So this is our effort to do just that. Marco's probably familiar to many of you in this room. He most recently served as Undersecretary at California Health and Human Services Agency under the Secretary, Dr. Mark Galley. In that role, he served as Chief of Staff and helped navigate both his and the governor's bold agenda, including the transformation of the California behavioral health system. He's well known for his collaborative spirit, as evidenced in the process around the Master Plan for Aging and in his cross-departmental coordination around immigrant communities, particularly around the first Trump administration, and more. We're excited to have his partnership. Today, he's going to facilitate this dialogue with commissioners around the Prop 1 Innovation Partnership Fund. And as I mentioned earlier, it's through this dialogue that we want to work on aligning ourselves around the goals, the values, and really the guiding principles and priorities for this fund. Again, we issued that call for concepts. We have had multiple conversations and presentations, and now we want to move it forward, given that we have an incredible program committee that is 8 members large now, that we want to build on their great work, or at least start that great work. And we have no shortage of great ideas from the commissioners around this table. So with those ideas, with the ideas from the public and that call for concepts, how can we ensure we're rowing in that same direction? Marco, no pressure, but you're going to help us get there.
Well,
so I invite you to
thanks.
begin this dialogue.
Yeah, thanks so much. Do you all want to stand up for just a second to get a break? I think you probably have been sitting for a while. So maybe stand up while I introduce myself, stretch yourselves. And I think the slides will come up in just a second. I know you've been sitting for quite a bit of time. Yes, stretch it out. By way, and I'm a little bit of a walker, so I'm not going to sit because I think it's just not who I am, and I want to also engage each of you in a conversation. But just before we get started, to give you a little bit of background about myself, on the professional side, I had the opportunity to work for 2 different governors, 2 different secretaries. I also had the privilege to work at the federal level, both for the Bush administration and the Obama administration at the U.S. Department of Health and Human Services. So have had both federal and state experience. I also come to this room and to this conversation with my own lived experience, just like many of you have. I immigrated to this country when I was 11 years old. I came from a war-torn country, which is the former Yugoslavia. My parents and I went into hiding for a period of time, and we fled and went into Hungary and Germany, and then were able to luckily come to the United States. And so I come to this conversation because I know what childhood trauma looks like. I've experienced it myself. I know what a high ACE score looks like because I have a high ACE score, and I know what it means to live with anxiety and PTSD because I do that every single day. I also come to this room as a father of a 2-year-old and a 7-year-old, and I'm trying to constantly think about what early intervention and prevention work can my wife and I do to support their resilience. What can we do to support their ability to navigate? How do we destigmatize the conversation with them about mental health so that they can openly talk to us about it? And I also come to this room as a son of 2 older adults who are very isolated and are dealing with their own mental health issues as a result. So each of you have your own lived experiences. Those who are joining us via the Zoom have their own lived experiences, and I'm excited to be in this room with you to lift up those lived experiences as much as we possibly can. So I'm really excited for that. Let's see, how do we go this way? Before I actually get started on this, I want to just build off of Commissioner or the Chairwoman's comments. The idea of my facilitation here is really to think about the skeleton of what the Innovation Fund looks like. What are the processes? What are the pillars? How do you think about it? It's less about like what actually are you going to fund? That's going to be your all's job to figure out. My job today is really to begin to get you into a conversation to think about what should you be thinking about as you design this so that the Program Advisory Committee can dig into it and then come back to you all in the fall to say, these are the parameters of how we're going to use the $100 million to be able to really show impact. So that's the goal of my facilitated conversation. And there's going to be a lot of participation by you all via some technology pieces and then a lot of conversation. So please be prepared to engage, and then we'll obviously engage in public comment. But before we do that, this is my favorite poem by a woman named Mickey Scoppy Jones, and it's entitled, and this is a picture of her, it's entitled An Invitation to a Brave Space. And I want to start with this because I think it's important to have honest and open conversations about these things. And so I want to read this poem to you, and I hope that this resonates with you all as we go through this journey today and in the weeks to come. The poem goes something like this: together we will create a brave space because there's no such thing as a safe space. We exist in the real world, we all carry scars, and we all have caused wounds. In this space, we seek to turn down the volume of the outside world. We amplify voices that fight to be heard elsewhere. We call each other to more truth and love. We have the right to start somewhere and continue to grow. We have the responsibility to examine what we think we know. She continues on to say, we will not be perfect. The space will not be perfect. It will not always be what we wish it to be, but it will be our brave space together. And we will work on it side by side. So I hope that this anchors not only this conversation, but future conversations that you all have to really think about how do you maximize and strategically think about the $100 million that you have to be able to tag along the prior conversation around blending and braiding resources to be able to strategically move in the right direction. Now, our conversation today isn't this beginning. It is part of a learning journey, as the chairwoman said. And I have had the privilege of kind of looking back at the videos of your conversations in prior meetings, and I've also listened very closely to the public comment period. And so I just wanted to reflect a little bit about what I've heard from those conversations to level set us before we dive into rolling up our sleeves and having conversations about the different pieces. So the themes that have arisen to me that I think are really important to anchor this conversation is that I heard loud and clear that we need to think about how we center this work around community. The community really needs to be at the core of what we do. I also heard a lot of conversation around outcomes. We need to be able to prove that we're actually delivering meaningful results and that we have the ability to demonstrate what those results look like. I also heard a lot about transparency, and transparency leads to trust, and trust builds further community. And so trying to figure out how do you continue to create transparency about this process. I heard a lot of conversation around ensuring that we build by and not just for individuals in the community. So how do we actually roll up our sleeves with folks who have lived experience, who are on the ground, bring people to the table that may not look like us, may not be in the same socioeconomic status as us, to be able to kind of innovate with us. There's also a lot of conversation around what does innovation actually mean? And I think that's important because what innovation means to me, as someone who's spent most of my time in the public sector, may look very different to somebody who's been in the private sector for a really long time. And I think being on the same page around what that looks like. There's a need to bring peers into this conversation and really think about what role do peers play in kind of thinking through that. There was a bit of conversation around access to treatments. We know that there are treatments that work, but how do we innovate to get people access to those treatments and not just focus on research or thinking about the new treatments that can come to life? And I think this is a really important piece as well. We need to think about how do we integrate systems. I heard a lot about integrating systems. This is not only about behavioral health, mental health, and substance use disorders, but how do we think about physical health? How do we think about the social determinants of health that we constantly are talking about? How do we think about innovations that scale or funds that you use to fund projects that actually can scale and are capable of scaling? And then there was a really rich conversation just a moment ago around sustainability. So you invest one-time dollars, but then what happens? So you create something that is really powerful and has a big effect. I don't think the solution always is just to run to the legislature and ask for more money. It's also about trying to figure out how do we blend and braid those dollars on the ground to be able to meaningfully sustain that work moving forward. And actually, I think private sector has a big role to play in this, as well as philanthropy. So I think the point that the chairwoman alluded to earlier, we need to be data-driven. I often would say when I was at HHS, we're data-rich but information poor. We collect a lot of data because it makes us feel so good, but we do nothing with it. And so I hope that you don't become data-rich and information poor. Collect the data in a way that enables you to think about it. I heard a lot about language access. This is really true to my parents. English is their second language, and getting access to services in their native language is really difficult, but this is important. Urgency, the idea that we can't just sit. In a prior commission hearing, one of the commissioners said, you know, I walked by the prior building and we walked over people who are on the street, and yet this is we're not moving with enough urgency. And I think that that is so important for you to be able to think about. The urgency is so important. Technology has obviously a really important play. Like, what role does technology play? And I think you need to contemplate that. And then accessibility. We need to think about diverse groups of people to make this as most accessible to them as possible. So to me, these are the things that I heard and I read in the prior conversations that you all have had. And I hope that this somewhat is reflective, or you see pieces of what you saw in that conversation. So I want to spend just a moment thinking about what our goals for the next hour and a half look like, really. And to me, they're fourfold. One, I want to think about what are your goals and values that you want to anchor the Innovation Fund in? What is important to you as a commission to think about in terms of how you set this up? And I think that's going to be really important so that there's clarity for the staff, for your stakeholders, to your partners around what it is that you're trying to get at. Second, I think we need to determine what impact do you want to have. 5 years from now, what do you want to be able to say you were able to accomplish at the individual level, at the community level, and at the system level? 3, I think you need to have a heart-to-heart with yourselves around what does the structure of this fund look like? How do you want to set it up? Are you going to invest in seed projects? Are you going to create catalytic prizes to help innovation on the ground? There are ways in which you set up the fund that enables you to kind of think about this. And then finally, there are a host of questions that that I'm going to put forward today that you need to think about. We're not going to solve these questions today, but think about this as kind of our repository of questions that we will build on even after today to be able to do this. So these are the goals of what we're trying to get to today. So with that, what we're going to do is kind of have 10-minute sprints in conversation around a set of pillars that I think are important for you to consider as you build out this fund. And so these sprints are going to be anchored in the following kind of areas: a clarifying vision and goals, the defining of investment pillars, the things that you want to think about investing in, the structure of your fund and the types of supports you're going to fund, the governance that you're going to put around that fund and the decision-making you're going to put about it, the capacity building that you're going to look to do or the TA you're going to provide to get more players to the table, the data, the metrics, and the outcomes, because we shouldn't think about the data, metrics, and outcomes after we launch this. We need to think about it now so that we can actually think about the collection pieces so that we can show 5 years from now or 3 years from now what value we're bringing. We need to think about the financial sustainability and the policy change that this is going to result in. And finally, in government, we do a really poor job of telling the story of what we do. And so here, I think you need to think about what is your communications and storytelling strategy look like so that you can be able to tell a different story about how these funds actually have been looked at. So I came up with these with the idea that it provokes conversation. It doesn't have to be focused on this. We can add more things to it over time. The Program Advisory Committee obviously will dig deep into these areas, but this will just start the conversation today. Does that sound okay to everybody? Okay. All right. So let's start with the first one, which is really about the vision and goals. And to me, I would urge you all to think about what is your North Star in terms of how you think about this. So to me, I decided to put some framing ideas on paper just for fun and to see what reaction you all might have from these. So to me, one could be, our goal would be to catalyze bold, community-driven innovations in behavioral health. Another could be, we want to expand equitable access, engagement, and outcomes for underserved populations, and especially youth and older adults. Another could be supporting the new transformational models that integrate lived experience, cultural relevancy, and system redesign. So these are just ideas to start, jogging your thinking. We're going to do a little bit of a Menti survey here, and I don't know what is happening. Can whoever is running can you just click on the close and see if it pops open? Oh. Okay, it's okay. What you do in the Menti survey, and we won't have it on here, but maybe if you open up your phones, and if you can you can either take a screenshot of this and it'll take you to the Menti survey, or you can go to menti.com on your phone, and I'll come around and show you all. And there is an access code, and I will repeat the access code because it's not loading on this particular piece. Perfect. So fill out the survey, and I wish we could have it live because I wanted to show you all where you all fit into this. Yes, that's perfect. So the access code, just type in the access code at the top, and I'll come around and show you, and just fill out the survey. And here you're gonna see from strongly agree to strongly disagree. I want you to kind of be on the continuum of where you are. And unfortunately, I'm sad that we're not able to show it to you in live. It was designed to be live on there. But you will kind of begin to see where we all, and those of you who are in the public, online, or here in the room, feel free to do the same thing. Feel free to use the Mentimeter and engage in that conversation. So that will give us a sense of confidentially, where do you all feel in terms of what that looks like? And so what I want to spend the next 10 minutes on is a series of questions and then get your guys' feedback on. So the discussion prompts here are, what overarching outcomes should this fund aim to achieve? What gaps or inequities are you trying to close? And what do you want, or how do you want to describe success in 5 years from now? So we're going to spend maybe 10 minutes of you all telling me what you think we really need to focus in on. So maybe the chair can help me in kind of navigating, but if you have comments in this, I'd love to get your sense of where you feel like we need to be in terms of the overarching vision on this particular piece. Any thoughts?
Commissioners, any reflections? Yes, please, Commissioner Larson.
Thank you so much. It's nice to see you in this new role and have you here with us. Your presentation's been very thoughtful so far, and I really appreciate your style, so thank you for that. I think what's coming up for me, and I think I mentioned it actually in my very first meeting, is I feel like we need a new strategic plan, which I'm sure all of the original commissioners probably are going to groan at because it's relatively new, but our current strategic plan was created before Prop 1 passed, before we doubled our size, before we had a new executive director, before we were facing a 50% budget cut. So it feels, and it's a little bit, it feels like we're trying to do everything all at once for everyone. So that's how I'm approaching this conversation. I do feel like within Prop 1, we have new charges, responsibilities, and our strategic plan doesn't reflect that. And as we decide on investments, I think we should absolutely be couching those in what our responsibilities are under Prop 1.
Thank you. Yeah, I agree. Great way to facilitate our thinking on this. And I do agree. I'm kind of a sandwich commissioner. I'm the most senior of the new, but not as senior as all of the other commissioners. But I do agree. There's just been so much change recently. BH Connect. I mean, there's CalAIM. I mean, there's so many things that I think would ideally be incorporated into what the vision of this commission is. To the first question, what overarching outcomes should this fund aim to achieve? In my mind, and we talk about, not wanting to duplicate things a lot. In my mind, behavioral health in California, we have aspects of the system that are already baked, so to speak, right? We have Medi-Cal reimbursable services. Those have expanded with CalAIM and will expand further with BH Connect and transitional rent and all these opportunities, CYBHI. To me, the purpose of this funding, one of the purposes in my mind might be everything that's outside of that. Those are the opportunities to really kind of expand beyond the current horizons and kind of experiment in thoughtful, strategic ways to see if those are sustainable, scalable, and ultimately drive the improved systems that we're looking for.
So what I'm hearing you say, and I think Commissioner Larson really is like anchoring it in not only the things that you are charged with, but really thinking about not replicating what Medicaid or BH Connect or CalAIM are doing, really wrapping around those in a much more strategic way. Okay, got it. All right, Commissioner Gordon, you were next, and then Commissioner Fairweather.
Fernandez.
Oh, sorry. I'm so bad at this. See, this is why you have this job.
I got you.
Thank you. Commissioner Gordon.
Yeah, I'd really like to see us focus, number one, on access.
Okay.
Access for those that don't have it or have obstacles to getting access. And secondly, have us focus much more on prevention than treatment. Get to the problems, get to the issues as early as possible. Use whatever means that's most effective. And I'm a school person, so we have a school in every underserved neighborhood in California, and sometimes more than one. So
my 7-year-old has learned at school that if he's frustrated, that he just needs to sit and breathe. And the other day, I was so frustrated because Zoom wasn't working. The squirrel had chewed up the wire. My daughter had a fever, and you could tell I was just really frustrated. And he said, "Daddy, just sit and breathe." And I thought, that's what we need to be focusing in on. Okay, Commissioner Fernandez.
Thank you.
Oh, sorry, Fairweather. See, okay.
Deferring to one another. I guess this is sort of connected with what you said, Commissioner Tsai, is that there are all these systems, actually it's connected with yours too, CalAIM, CalBHS, all this stuff.
The acronym SOUP.
Yes.
Yes.
Which in many ways, to me, actually interferes with access because it fractures and polarizes the communities of need and the individuals. Like, do you fit in there? Are you eligible for this? And I don't know, how this could be addressed. I mean, if I could wave a magic wand, it would be just tear the whole thing down and just give everybody health care. But that said, you know, I think that, so how does, I don't want this money spent just on process. I want it on real, actual services. But also recognizing and somehow addressing, you know, the fact that the system as it stands is not accessible for so many.
So I hear you talking about the bifurcation and the various doors people have to go through. There's no single door that somebody has to go through. They have to go through 10 different doors. And then really being able to kind of enable that in a different way and thinking through how you not only allow people to go through that door, but more importantly, how they get services once they enter that door is what I'm hearing you say. Okay. Okay, who was next? Okay.
Thank you. I appreciate the way you've set the stage here today. In response to the first question about the overarching outcome, having read through some of these concept analyses, I think that part of my challenge continues to be that the header on the page says Commission for Behavioral Health. The first sentence of the concept will say that it addresses behavioral health, and then the entire content of the preceding paragraph discusses mental health issues. And in terms of the gap or inequity that we're trying to close, it seems as though our sort of charge of duty here is to figure out how to implement Prop 1 effectively. And the gap or inequity continues to be that substance use disorder is not at parity with mental health.
Yep, okay.
And to Commissioner Larson's point, that I don't know how we can effectively carry out this charge if the strategic plan continues to guide us and focus on goals that are mental health specific and centric.
Got it. So you're talking really about how do we integrate the substance use disorder component and lift that up in a different way. Okay, Myra, so I don't get in trouble with you. Who's next?
Bontrager and then Madrigal Weiss.
And Commissioner Schwartz is also on the list.
Okay.
Yeah, I appreciate this. I guess I want to just express a fear.
Okay.
You know, my understanding of innovation occurs when you're trying to solve a problem. My fear is the problem we're trying to solve is how do we spend this money? And we're getting caught up in process, transparency, government procurement, engagement, et cetera, which is all important stuff. But what is the fundamental problem we're trying to innovate to solve? It isn't how we spend this money. It is what problem are we going to identify that we're going to innovate to solve? And I don't want to get lost in the process, because that is our problem to us right now, is how do we spend this appropriately and that we can justify and pass as a giggle test. However, what is the fundamental behavioral health problem we're trying to solve? And I hope that's our guidance.
I think that's a really important point. And in Pillar 2, we talk about, or in the second piece that we're going to get to in a moment, we're going to talk about what pillars do you really want to invest in? What problem are you looking to really solve in? And I think this isn't an or, this is an and. If you don't have a good process in the way in which you administer the dollars, your ability to actually get to a point where you can have an outcome on that pillar will fall apart because people aren't going to have trust in the system. And so I think there's an ability to kind of try to figure out how to navigate both of those together. Okay, who is?
Madrigal Weiss and then Schwartz. One Chambers.
I just want to say, I think the things that are really sticking with me are what Commissioner Tsai said and what Commissioner Gordon said. I think also work with schools, but also have family members who are experiencing behavioral health issues. And so access and prevention, critically important. And also agree that, words matter. And even as a commission, our documents haven't caught up, our webpage hasn't caught up. So it's when we're intentional about, and behavioral health. I mean, so our charge and our reality have not caught up even in our documents. So how do we, I think we need to start there too, so that we are all on the same page with it. And to what Commissioner Bontrager said, exactly, we all need to get to, it's not just about how we're spending the money. What do we really want to
spend
innovate?
the money on?
Yeah,
Yep, gotcha.
and I don't know that I think we need to, so I look forward to
Yeah,
as
absolutely,
we design
absolutely.
that, yeah.
Commissioner Swartz.
Hi, Marco. It's nice
Hi.
to unexpectedly run into you in this context. What I want to say might be a little at odds with what some of the others have said, but I think we need to focus on what is innovation. The genesis of this pot of funds for the commission is that a feeling that when the counties were responsible for spending innovation dollars, their proposals weren't really innovative. And so I feel like, and I would like to point out that when you look up the definition of innovation, it's a little different than transformation. It's not the same. And so I feel like we need to spend more time on what is innovation? What does it mean? And I can tell from the response that we got from the RFI that there's a misunderstanding among the stakeholders. So I feel like if we don't get a little more clear about what innovation is, there's going to be a lot of disappointment and maybe even anger amongst the stakeholder community that their projects weren't funded out of this pot.
Thank you for that.
So helpful,
Yeah.
coming from the perspective.
Commissioner
Commissioner
Oh,
Chambers,
Chambers.
and then
I agree with especially the last comment, because that's where the community is really afraid. Since I'm on the ground, I'm talking to them, like they are afraid about these funds and probably will be disappointed if, to your point. And so, I mean, that's why I'm like, we can continue to keep the mental health wellness funds and fight for that. But then I also wanted to talk about like the list of programs. Like, as someone that's been developing all those programs, all that we listed in those things, that is our mental health system, I believe. So how, if we, I don't want to come at the point of like saying like, oh, let's not do something duplicative. Because, I mean, that stuff that's already there is not even doing, it doesn't even, it's not sustaining itself in general, though. And then as Prop 1 moves, a lot of that stuff is going to be focused really on like some specific things. So a lot of like, I don't think we're going to be doing anything completely duplicative, but I think any of the programs that we discuss can be enhanced, improved. But I don't know if that's innovations. And another thing, a lot of the community was really concerned that this money is going to go to private corporations and not go down to the commission. So I would like to see us building our existing system programs that we have, and it's also contingent upon Medi-Cal, which I'm implementing Medi-Cal right now in all these new programs, and there's major gaps in just doing much of this work. So if there are other entities that can supplement, fund, and enhance and improve the provisions of service, then I would see it as like partnering together and uplifting it, not just being duplicative. Yeah, and I think we need to have a serious conversation with like as stakeholders about mental health and substance use. A lot of providers, they know that it's important, but a lot of people are afraid that people are going to consistently be put in inappropriate settings. Like my niece this weekend was put in a rehab and she lost her mind because she doesn't have a substance use issue. She has a mental health condition, right? So yeah, I think we need to even invest in that. Like, I think that's a major investment.
So what I'm hearing you say is that on the conversation around duplication, this is more about making sure that even in instances where the project or the innovation might have some funding that is already there, this could potentially be a way to blend and braid more resources to make it realize more. Right.
That's been awarded. For an example, a peer organization
Right.
just got awarded the bond money. They do not have the other 10% to go up
Right.
and get, let's say, to make the investment to get the loan that's going to be paid. Other big corporations
Do. I hear you. Okay.
Oh.
Okay. Got it.
Sorry, we were having a dialogue.
Very passionate.
Thank
Okay.
you,
who was
Commissioner
next?
Chambers.
Commissioner Mitchell?
Commissioner Mitchell,
Okay. And then we'll,
And then Commissioner
Romano, and then we'll move on.
and then Vice Chair Rowlett.
I think, and again, I'm just one of many voices, and my voice is stuck Over those people, I continue to step over.
That was you, yes, yes.
And to Commissioner Bontrager's point regarding not so much the projects, but what are we trying to accomplish? We keep, year after year, and I probably am just tired of hearing myself, so you guys are probably tired of hearing me too. The problem is bigger. Folks are still broken. They're becoming more broken. We talk policy, more programs, more innovation, more technology. Poor keep getting poorer. Disenfranchised communities continue to be left behind. I think Commissioner Chambers used the term, on the backs of poor people, there goes systems. And so what are we really trying to accomplish? So I think prevention is wonderful. Because then I'm not stepping over 10 people this week, maybe 5, because prevention kept 5 of them off of the ground. And then access, those 5 that I kept off the ground, were they able to get services when they need it, whatever
Right.
that is, whether
Right.
it's addiction or mental health.
Right.
And then when I talk about what's already out there, monies that have been spent on programs and innovation, what are the results? Why are we still having these conversations that are just making me, it makes me want to curse. So I don't even know what to say anymore, because I'm just frustrated with those who have far less than me. And I don't think I have much. But it's like, what are we doing to measure what is working, what has worked? Can we duplicate that, make that work since it worked, again and again?
Yep.
So that's where innovation, you're talking $100 million. I'm just so angry because we just seem to keep missing that. We hire directors, administrators, folks with lived experience, and I think all of that is so important, but we're forgetting the people who are actually in the street. How do we get there to prevent that, to
From
give
happening.
access? It's just all of that.
Yeah, I hear
So
you.
just beg my pardon.
No, this is a brave space, so we're creating a brave space. Okay, Commissioner Polmano.
I do agree with Commissioner Schwartz and everybody else on their comments. One thing that I'm really interested in, and I say this in this context, the funding is for 5 years, it's 100 million, and let's put 20 million a year in context, that's not really a lot. And my idea is probably about to suck up all the money, but when we talk about outcome, we need to talk about data. Because when we are done in that 5 years, and you go to the legislature and knock on heaven's door or budget's door and say, we need money, what would people like me, what would the people that our members will ask is, what success did you achieve with these grants that you awarded? And really, outcome equals data. And I know, Marco, we have been, we have a history on health information exchange, data exchange.
Yes, we do.
But let's put that in context. If different entities, whether it's county, commercial plan, Medicaid, have access to the behavioral health data of our population, and I know it will be expensive, we integrate treatment, we know where people are at any given moment. Now, I know we can't even get there on regular medical care, but maybe that's my North Star.
Yeah.
It's eventually, we have some data that, speaks to all of us, that helps us to really deliver all the things that our commissioners have spoken of.
Yeah, no, I totally agree. And so I think this all is really helpful in terms of thinking through how we blend one more, sorry.
One more. Vice Chair
Sorry.
Rolette.
Yes,
One more. Oh, and then Commissioner Wilks, and then that's it.
okay.
So I'm a big distraction. My distraction is very simple. Who defines what innovation is in our state, in the reality? Who defines it? And what I experience is that the people who give the money get to define what innovation is. And even the recent budget decisions influence that. And I don't believe that is the way to do that. And so I want us to really make a point. We are going to define innovation for the state of California. And that our collaborative process is the ideal mechanism to achieve that outcome. And that we got to say that. And then if there's pushback about that, it has a lot broader implication than just innovation. Because ideally, that's what the commission, I think, should be doing.
Perfect. Commissioner Wilks.
All right. So I had to write this down. It's on my heart. When I look at all these questions, just straight shot, in 5 years, I envision youth navigating the ills of our world, especially those who are alone. Not benefiting from any of these systems, which goes to the access to have the brightest of futures. Being new here, to hear the budget cuts, to see what everybody around the table is enduring, to be present, be mindful, and think about the future in the context of $100 million. I think about how peer respite is unfortunately on a chopping block. And then I also think about the systems in which I've worked to advocate for and also been a part of, the youth homelessness prevention centers. Where, again, we have too many young people and some of them children. And when we think about the context of a brain doesn't finish developing until 28, but you add trauma, it's even more. And so with that, I think about the children, I think about the youth, and considering our budget, I hear you, Karen, when it comes to Commissioner Larson, when it comes to, we are literally looking at, what, 60 million about to be cut? And we're talking about 100 million? And then we're going off of older strategic plans. I mean, I'm here, and this is really going to tell what we about.
I appreciate that. I want to move to the next piece. So I think this conversation will help the Program Advisory Committee think about the what. And in the Bentimeter, you could see many of you strongly agreed with many of these. So it means that there is a need for a combination of these. So we need to think through how we merge these things together, right, to your point. So the next part of the conversation is really thinking about what is that concrete thing that you want to think about? And I don't want to spend too much time here because we could suck up the entirety of the conversation into this, but I just want to give you a flavor for how you could potentially think about the pillars. So to me, potential pillars, these are just purely examples. You could think about, we talked about this a little bit, you can think about access expansion. Maybe that is something that you really want to prioritize and focus on. Maybe it's about community-defined practices, really thinking about center cultural rooted and non-clinical models in a different way. Maybe you want to think about the systems level and what you want to think about there. Maybe it's about delivery reform. Maybe it's about payment reform. Maybe it's about workforce investments. You can think about peer-led innovations, right? You can think about cross-sector solutions and partnerships, things that where somebody comes to the table and says, give us $1 million, we're going to bring 5 million from here, 5 million from here, and 2 million from here, and this is what we're going to do. So here you have an opportunity, to your point earlier, to kind of begin to say, what is it that we're really going to put our money towards? And so I think it's important to spend a little bit of time just thinking through, not today necessarily, but as we continue to have the conversation around what is it, once we define innovation, what then within that parameter are we actually going to look to focus in on? Because we can boil the ocean, or we can say we're going to invest our money in X and Y. And we're really going to think about innovations in X and Y. And that's for you all to kind of think through and figure out, like, what is that pillar that you really want to focus in on? So bear with me again, and this time maybe it's working, but it's going to be up here. Go through to your Benti again, and here, to me, it's type in the word that the pillar or the area that you want to see the most focus in on. So is that workforce? Is that peer-led efforts? Is that respite? Like, what is it that you really want to hone in on? So just take this Benti. Oh, it should be pillars. It should be on. It should allow you to type in a word. No? Okay, here. Let me try it. Yep. Yep. You'll get a new one after you hit submit on the prior one. You got it? Okay. Okay. Okay, great. So just a few seconds, and then it'll pop up on this screen down here as you begin submitting things. I'm testing your technology capabilities. All right, so we've got mental health, workforce, CDIPS, peer, a lot of preventions. So here you can see, I wish it was up at the top, but here you can see what you all are beginning to show. So this, I think, is just going to continue to help us think through how we get to the various pieces. Here, let me show you. It's not showing up on the big screen. It's showing, because it's not synced up. So this is what people are submitting and what's popping up.
Well, can you read some of it out?
Yep. Prevention, peers, art making, SUDS, lived experience, meaningful outcomes, system change. And we'll delve into this in the Program Advisory Committee into a little bit more detail. So I want to then kind of, in this pillar, I want to kind of think through what are the key questions that you all need to contemplate. So which pillars are most urgent or underfunded today that could have an impact with new funding, right? Should the commission reserve a portion of the funding for specific pillars or specific things? So are you thinking about youth, and maybe you reserve a portion around youth? Maybe it's older adults and you reserve a certain portion of older adults. And then how does the commission ensure innovation reflects both risk-taking and relevance at the same time? And this is a conundrum that we often deal with, because sometimes we don't have all the evidence and we need to take risks to build the evidence. And then how do we also ensure that we have relevance? So these are kind of the prompts in terms of conversation that we need to be thinking. So I'll pause here for just a few minutes, and then we'll go into the next area of conversation. But what points of reflection do you have, or do you all have, in terms of this particular part of the conversation? Commissioner Larson?
I'm on. Commissioner Larson.
Thanks. As I kind of looked through the potential pillars that you had on the prior slide, one of the cross-cutting things that really came up for me was around workforce, because we all know we can't do anything, regardless of what your perspective is around this table, without a robust workforce that we don't have. I think the other piece of that is that there are some opportunities within the workforce pillar around innovation, around public-private partnerships and technology and incorporating peers and in the private sector, for example. And so I think just kind of want to uplift that, because without a workforce in all of its beauty and diversity, we can't achieve any of the outcomes we're all striving for.
Great. Commissioner Alvarez?
Okay, just want to make sure, okay. So one thing I'm holding is, there's been a lot of conversations here about the complexity of the many factors that go into our behavioral health challenges, right? It's not only the system, but it's economic security, it's housing insecurity, it's all of the immigration status, right? Like racism, right? There's all of these factors that, frankly, we're not even gonna be able to do that on our own. So I'm holding this like, what are we contributing to? And something that comes up time and time again is like navigation. What happens when my child has a crisis? And do I know how to get the services? Or an unhoused person, like just navigating these behemoth of systems is a challenge. And could we measure, did we make a difference in the 5 years? Just on that, because we're not going to tackle racism in 5 years. We're unlikely to tackle economic inequality in 5 years. Those are going to contribute. But what can we do in collaboration with our partners, our agencies, and private industry, philanthropy, to move the needle? So I don't know if I just...
No, and this kind of piggybacks to your point earlier, which is that door. Is there a single door, or are there 20 doors that you have to go through? And I think that's kind of what you're getting to a little bit, is what I'm hearing. Plus, not only the door, but someone can have a paved path to that door, and someone has to go climbing mountains to get to that door. And that is a very different thing, which is what you're talking about in terms of the equity component to get to that door.
And I want to call attention to the people that have far more expertise than I do, but there's also this challenge of, are you better off in Medi-Cal versus private coverage? Are you better off in private? There are strong opinions on both sides, right? And that's very problematic, right? That specialty mental health versus prevention, that also has something to play into this. And I'm very curious. Again, the commission is our sphere of influence and impact. How do we measure our progress there?
Great. Commissioner Fairweather.
So one thing with regard to the access and all the programs is, for example, we launched and we're the process evaluator for a statewide pilot. The veterans who are enrolled in that pilot, many of them they don't know that they're enrolled in it, and they can't be expected to, because they have extremely high acuity and some cognitive issues. And it doesn't matter to them what line item on our budget or what bill in the legislature. It matters to them that they have someone to talk to. And so if the other side of that equation could be simplified as well, so that we don't just kill ourselves with bureaucracy. But I also want to go back again to, what is this idea of innovation? So you talked about workforce. Workforce is really tough. We have a hard time hiring people, and we have nonprofit salaries. Wonderful idea. So, but what would be defined in that category as innovation? On the one hand, you could just fund 1 million scholarships or supervision for, people getting certification. Is that innovative? I don't know. Is that effective? Probably. So I still am stuck on innovation.
So I'm going to go to Commissioner Gordon, and then we have one
And then
online.
Bernick.
We have one online to get to.
I had a thought on the workforce, and we've been working with HCI also on this. We created about 3 years ago a pipeline for developing behavioral health workers. And we start in the junior year of high school. And we have a summer program where there are 12 sessions, and we orient young people to the work associated with becoming, working in behavioral health. and they get $1,000 for attending the 12 sessions. So long story short, what we discovered in trying to design this pipeline is one of the biggest obstacles is there is no financial support along the way for young people who are interested. It's not scholarships, it's about living expenses. So we have a process where every role, starting with if you graduate high school, we have a peer mentor role where you come back to your high school and work there, but you get a stipend. Then as you go through community college, you're always getting a stipend for the roles that you're playing, up to and including when you're doing your final 3,000 hours or whatever. So we have now about 180 people in this pipeline. They may not all go into behavioral health. They may not all work for us or in the county, but it seemed to be something that
Driving people into
is
it.
attractive to young people.
I love that. Okay, we're going to go online, and we have a commissioner online.
Commissioner Bernick?
Yes, just very briefly, I'm impressed. I'm listening to discussion, and I think you're bringing up all the key issues, which are impacts. How do we measure impacts? How do we define innovation and so forth? I would just say three things. One, on the workforce component that Karen brought up, and Dave mentioned, there's the one side of workforce, which is preparing people for careers, whether it's peer support or community healthcare worker, or social or case manager. But there's the other side that, Mari, I'm most interested, which is how do we better, or how do we increase the employment levels of Californians with significant mental health and behavioral challenges? So I hope we'll continue, or we'll have that as one component of workforce. How do we get people into jobs with significant? How do we support them? How do we expand employment? But the other side, Margaret, you can hear that each of us brings different perspectives, different emphases in terms of early intervention, in terms of emergency services, just some of the it's really across the board. So I think that's the challenge. All of us have particular orientations, particular issues we're interested in. How with as was pointed out, 20 million a year is not that much, but it can go far if it's leveraged. So I think I'm a member of the program committee and look forward to with Gary and Maura trying to balance these.
Appreciate that feedback. Appreciate that feedback. It looks like we have another commissioner online that has a
Commissioner Callan, please.
Yeah.
Hi, I just wanted to say thank you for all the work you've done, and this is just relief having this discussion. I like the idea of pillars, and I like what Commissioner Larson said about the strategic plan, and I like the idea of having ongoing data. And I think the innovative product should have a data component to it that's a requirement to get the funding. Because I think a lot of the problems that we have is the ongoing care once people go through a system, what happens then? And having data will help us get to that next level. I like the idea of we have so many, like the last commissioner said, we have so many people that have different focuses. It would be nice to say we're going to have 5 different focuses and have a schedule on which we do one at a time and organize it, because then I'll have less of the whack-a-mole feel that sometimes I feel being newer on this commission. Well, the Prop 1's coming in and everything's hitting at the same time. But I think I like the idea of doing a few and going deep, sort of thing, and getting the biggest return on investment.
Thank you.
Great, thank you. And we have 2 in line, Commissioner Polomano and then Commissioner Chambers.
I'll be quick. I know that workforce is a big issue. One thing I'd like to raise is, let's not duplicate what Beach Connect would do, which is 1.9 billion, I think, and, invest the limited dollars that we have. So I just wanted to note that.
Great. Okay, Commissioner Chambers.
Commissioner Chambers.
Sorry, yeah, I agree on not duplicating, but I think that the broader thing is if this commission, Cal HHS and DHCS can sit together and help define this role, and if we look at it it could be much bigger if we look at us more like as an umbrella agency where we help to fill in the gaps, raise standards, and give the counties technical assistance and guidance. I think that would be really good because, like, I know, and as a policy administrator or whatever I am, I know that it takes time for policy to be evaluated. So I know that there's BH Connect, there's Prop 1, so we have time to see if it's going to work. So how do we, in the midst of policy implementation, like fill in the gap because we don't know if it's going to be completely successful or not, or what's, like, even in duplication of services, because, like, for me, as I implement enhanced care management right now, which is a new benefit, and CHW, it is so restricted under that BH, like, it is the most, like, as a nonprofit, and like the braiding and the thing, I'm having to cut other services to focus on this very rigid, which is, I'm gonna try, but that is gonna take away the full provision of my scope of behavioral health treatment in general. So I think looking at it like not as completely duplicative, but what is the stress that going to a Medi-Cal adherent system going to do to this whole system of care while we're implementing is something I'd like us to be on the forefront and helping support the administration and be an advocate. I don't know if that makes sense.
No, it's almost like the super glue, like figuring out how you connect the dots. Like, how do you bring those dots closer together in a more intentional way? All right, so the
Marco,
oh, yes,
Commissioner
ma'am.
Wilkes.
Sorry. Commissioner Wilkes.
Love the idea of the workforce. We need more. And if we think about the trajectory of what are supposed to be promised dollars, there can be that upfront funding to cover the cost that, of course, Medi-Cal reimburses for.
I love that.
Thanks for that. Commissioner Tsai, please.
Oh, I'm sorry, Commissioner Tsai. See, I'm just too eager to get going. Gosh.
Just to, in some of the planning conversations we've had around the Programs Advisory Committee, we've talked about, that it might be helpful to establish pillars. So this is certainly helpful to hear from the group. Some of the things that we've talked about, workforce, integration of mental health and substance use, and youth, just as kind of foundational focus areas. It's not finalized, obviously, that's all up for discussion, but it's good to hear that some of that seems to overlap with the discussion.
Love that. Okay, Commissioner Gordon.
Just one other thing with respect to something that could be tried out. So since we don't want children to be starving, we provide school meals. We provide free meals in schools. Okay, but we don't make young people fill out a form saying where do they live and we go by the poverty level of the school as a whole. So if it's beyond 70% or whatever, everybody gets fed. What if we tried the same thing? Obviously, people would lose their minds. Some people would lose their mind. What if we tried that in terms of behavioral health services?
Right, you're providing, if there's a level, everybody needs the service.
You would be eligible by virtue of going to that school and just give it 4 or 5 years, see what happens.
I love that analogy. That's a great analogy. Thank you for sharing that.
That is fantastic. I love it.
That's innovation.
Yeah, and also it's like, on the back end, give the services on the back end. You can have this whole bureaucratic, pay no attention to the man behind the curtain who's actually figuring out where to build stuff to. One very quick, easy question, I hope, is I'm looking on the website. I don't see if there was an RFI for this, like if that
It wasn't an RFI, and Sandra and others can correct me if I'm wrong. It was really like a loose idea of getting people to submit concepts. So it was not even to a level of an RFI, but Sandra can give the legal
This
terminology.
seems all over the place.
Yes, it was more to help kick off our like what are the ideas out there? Like what's the universe of what the community is saying? By no means was this an RFP, RFI, like nothing formal. It was just an informal collection of ideas to help kick us off over here to see like, wow, they are really all over the place, right? Or, you know, it seems to be a lot more interest in X, Y, and Z. You know, it was more just to get a lay of the land.
No, you go ahead.
Are Carnivale's ideas also incorporated into this?
I want to say yes.
It's the Institute for Sustainable Finance.
Correct.
Thank you.
Okay, so I'm going to move us along. The next part of the conversation is really thinking about what does the fund structure look like and what type of fiscal support would you provide to organizations. So here it's really thinking about how are you deploying and leveraging who you're ultimately looking to fund. So the ideas here are, could you think about grant tiers? Can you think about planning grants? Can you think about piloting grants? Can you think about scaling? These are just ideas. These are just examples. I'm just throwing them out. Second is really thinking about size and duration, right? Is it $250,000 for a pilot and $5 million for a scaling grant? Those are the types of things you're going to have to ultimately think about. Who is eligible? There was a point earlier made. Is it CBOs, counties, tribal governments, collaboratives, et cetera? And then what is the flexibility of the funding? Are you allowing it to go into administrative pieces? Are you allowing it to do some of these? So these are the types of things you all will have to contemplate. And I don't want to spend too much time on this here and now, but I want to get the juices going to begin to have you think about how do you set this up? Because this is going to be important. After you actually determine what innovation is, what the pillars are, your grantees are going to need to understand, like, what am I walking into? What am I actually applying? And you need to put some parameters around that. And so here's just an example that I decided to make up for fun. What if you decided to do seed grants of $100,000 to $500,000 for early stage ideas, small community-based organizations who could do this? Then what if you had a level of growth grants that are $500,000 to $1.5 million that are for proven models looking to expand or replicate? And then what if you did a challenge prize? What if you thought about, let's have an open competition at schools, at universities, to think about what should we be doing differently about older adult isolation or youth suicide prevention, right? And then could you think about catalyst investments? These are true public-private partnerships that blend and braid dollars with philanthropy and maybe the private sector. This is purely an example. This is designed to just get your creative mind. This was me thinking in the middle of the night, like, how could you potentially do this? I hope that this gives you some thought for ideas around what this looks like. We're going to skip this mentee because I just want to be cognizant of time. And then here are the ideas of the conversation. Should you include different tracks for readiness, like early stage to scaling? How do you make funding accessible to smaller community-led groups? Like, are you going to be able to bring non-traditional partners to the table who maybe don't have grant writers who can actually write really fancy proposals to be able to do that? And should you think about fiscal intermediaries or collaboratives where they're looking at a regional level to be able to think about? These are just, again, ideas for you to begin to think about. So I'll pause there. What points of reflection do you have here in terms of the structure as we're beginning to think about the structure? Commissioner Polomano.
I don't know if this is even feasible because I don't really have any experience delivering services, but I'd like to establish actually a certain percentage that goes to administrative spend and also to patient spend. And how do we categorize those? This is like your MLR, right? For health plans.
I was just going to say, you want us to calculate an MLR?
Right. But I wouldn't want to call it MLR, but we are all concerned about, we want to make sure that most of the dollars are going to services. Then
MLR in the medical world is called the medical loss ratio, and it was designed under the Obama administration's Affordable Care Act to say that insurers should only spend a certain amount of money on administrative costs, and the rest of the money really should be on patient costs.
So that's, I don't know if it's, like I said, if it's feasible. Yep.
And Myra had a hand in building that out. That was great feedback. Okay, other point, Commissioner Wilkes.
Just curious, could we get feedback from folks at the Sierra Health Foundation who have pulled off 3 different segments of giving out funding? One, I think there is an innovative track, there is a capacity track, and then there is a standard track, and just see what feedback they have.
Love that.
in response
And I
to
think
these
other,
questions.
if you have ideas of other philanthropies or organizations that have done stuff like this, I think it'd be great to have some conversations with them to understand what works and what doesn't work in that environment.
Commissioner Fairweather, and then Chair Alvarez.
And then Commissioner Fernandez also.
Oh,
was on the
Commissioner
list.
Fernandez before me.
Oh, I'm sorry. I guess I'm on the legislative and external whatever committee, but and not on the programs. But I have done both sides of this grant making and also grant getting. So in terms of things like admin, you must have admin. You have admin here, you know, in this organization, and also to think about admin, a lot of people think, oh, that's a waste, but that can also include things like education, professional development. So, you know, don't think it's just like, you know, overhead or what, you know, they're spending too much on toilet paper or plants for that matter. Someone could get mad at that. You know, there's a lot more to it. That's all.
Great.
Commissioner Fernandez?
Thank you. When BHSIP rolled out, the LAO's office, you know, sort of did this evaluation thereafter. Oops. And they looked at the 2 questions specifically that you have prompted here, and there was a distinct disparity in terms of how smaller organizations were able to access dollars for these 2 particular reasons. So in response to the second question about how do you do it, I'm not exactly sure, except for saying that I think we need to lead by principles and say that we must make funding accessible to those smaller community-led groups. I'm not exactly sure the emphasis you place on that, but I think it needs to become restrictive in nature. Again, sort of reviewing the analyses. You see these big names, oftentimes like multi-billion-dollar health systems that are applying for these funds. And in terms of the tracks for readiness levels, I guess it goes back to that LAO report. It's so hard for a small organization to come in and demonstrate readiness, because that means that you must have sort of premeditated and made investments early on to demonstrate that you're good to go. And you have to have grant writers, a whole team of things. So I would just sort of lead by principle in saying like the funds need to be most accessible for those types of funds.
I've also been thinking a little bit on your, I'm going to just pull your piece apart a little bit, like could you play a matchmaking game too? Maybe you see a very small organization with the mid-sized organization. Is there things that you could do to bring them together, and mentorship programs to be able to pull them together? Are there opportunities in that type of environment? When I was at the state, when we had crisis around hospitals closing, one of the things we did was we realized that revenue, smaller hospitals had a really hard time with regards to revenue cycle, whereas big hospitals had the ability to do revenue cycle really quickly. So we created a mentoring program. A hospital who was not in the same market, we paired up with a hospital who was struggling to say, how do you actually learn from each other and leverage each other? And I wonder if there's an opportunity to think about something like that too. I like that. Okay, Myra, I need help. Oh, you're next, and then
Okay, sorry. A couple of thoughts, and I'm trying to channel Commissioner Carnevale, who would push us to think about beyond philanthropy and beyond the public sector.
Yes.
And a lot of us I'm not familiar with that. I don't know what that looks like, right? We all have our misperceptions, right? I'm just being really honest, and questions. And so I think part of this opportunity is maybe to learn, what does that effective partnership look like, right? Is there a Shark Tank for behavioral health innovations, right? In essence, that's what we might be doing here. So I just want to challenge us.
So, I mean, to your point, and I think Commissioner Robinson, where you're going to, is there a way to leverage private equity funds to be able to accelerate? So maybe you pair up private equity with these dollars to be able to move it, but you probably, we haven't heard from you, so maybe you should use your own words to think through.
You said it well.
Okay.
No, I think we do need to think about, opportunities like venture capital to bring in actors from maybe the private sector who have ideas that are, innovative to, to help us solve what we're trying to do. I mean, and that also ties, initiatives like that help with sustainability.
Yes.
When you have
Yes.
people who are thinking that way, they think about how does my business last past a grant cycle? How does it sustain itself? So I think bringing in actors like that is important. In my organization, we do that. We have a venture capital arm, and we very routinely look for startups that are privately funded. Some are even nonprofits, but we look at that level to try to bring in people who are hungry and trying to break into a market.
Love that. Okay, Commissioner Sai.
I support Chair Alvarez's proposal for a Shark Tank version. A couple comments. One is going back to your idea around the tiering. When I think about how to get money out effectively, I like the tiering model. I mean, we've done that in LA with respect to the only value-based payments system in the publicly funded behavioral health system in California. And the reason why the tiering works is similar to what Commissioner Fernandez was saying. It allows us to better target varied agencies at different stages of development and maturation versus a kind of one-size-fits-all. To Commissioner Robinson's comment, certainly value bringing in different sectors and different ways of thinking. What I would say is if we move forward with that, private sector, venture capitalists, et cetera, I think it's important that we recognize that those sectors have different goals. And for us to center ourselves on what the goals and the mission and the values of this commission and the behavioral health systems in California are, and be it to say, so that we structure the agreements and the arrangement in a way that actually facilitates that. It allows us to tap into the good of VC and others without just making it kind of a co-equal. Because having worked with some of those partners in the past, it can be difficult to structure co-equal arrangements.
I hear you. Okay. Okay, wait. So Commissioner Polmano and then Fairweather.
Anyone else?
Go
Schwartz?
ahead. Schwartz. Okay, you go. Go ahead.
So the for-profit stuff, and I did, I think, made myself clear before, but, I mean, the power imbalance there in terms of money, not money, but also this is public money, and these are public programs. So the public needs to own them. So my concern is if you turn it into something that's a VC, well, that's an investment. That means they're going to own or be able to sell something in the future. And quite frankly, we see some horrible things happening in privately, hedge funds going into elder care and nursing care. We see terrible, terrible things happening when the profit incentive is there. And then on the other side of that ticket, if there is a way that the public can benefit from a public investment, it belongs to the public. It doesn't belong to a VC. So that's my 2 cents.
Great, thank you for that. And let's before we get into the room, just so we can have a balance with online folks, can we go to Commissioner Bear online to have her provide us with some thoughts, and then we'll come back into the room.
Hi, thank you for the robust conversation. I just want to say we need to pay attention to all the silos. From where I sit on the county of San Francisco, I'm always amazed at these great community programs that do not talk to each other. It's like, let's try to figure out a way to get them all in the same room. But I love the idea of kind of speed dating because that's what we need. We need these, we need all of this to come together rather quickly. And I know there's a lot of innovators out there that everyone has a family member that has been affected by this. And a lot of these innovation tech companies might be very helpful to us. And there's a lot of impact funds out there that can be tapped into.
So there's a need for a balance here. And I think what I'm hearing folks also say is what is the intellectual property of the public? What is the public good? How do you, and this is where smart lawyers like Sandra and others can kind of think through how you create the conditions and the terms to be able to navigate that. Okay, Commissioner Polmano, and then Commissioner Schwartz.
And then I have something.
And then,
I think on the three boxes that you had
Yes, yes.
indicated there, I think to respond to the second and third smaller community-led groups, I wonder if maybe we ought to dedicate some funding for technical assistance.
we'll get into that in just a minute. It's on my list. I appreciate that.
quiet
That's a
now.
great, no, that's perfect. That, you're already ahead of me. You're ahead of me. Commissioner Schwartz.
I was actually going to say something. Building up with Commissioner Fernandez.
Yeah.
When we did the No Place Like Home. When we did the No Place Like Home, it turned out that the small counties didn't even have staff
To do it.
to submit applications, so,
Yep.
and I might be getting too much into the weeds at
No, this is
point,
perfect. This is perfect.
But we might want to think about, it's just money for them to hire someone to submit a application.
Yeah, okay.
I think the only thing I wanted to add, Marco, particularly around the structure of the fund that gets at the hesitancy and question around private equity, but also responding to our commitment to community,
Yes.
is challenging ourselves around what does that power sharing look like with community? Are they part of our review committee? Are they part of the decision-making process, right? And I recognize many of our commissioners represent our communities. Is that enough? Like, that's been a conversation that's come up time and time again with where we're valuing community input in our programming. So that's something to consider
love
from a
that.
structure
Yeah,
perspective.
I love that. Commissioner Rolette.
Real quickly, one of the great things about No Place Like Home is that it was clearly defined what problem we were trying to solve.
Good, okay.
And that is a great example
Okay.
of what Commissioner Bontrager said earlier.
Uh-huh.
We need to make sure that we clearly identify
The problem.
what our problem is.
Yep. I love that. Okay, we're going to move to the next piece really quickly, which is governance and decision-making, and how you begin to think about both an inclusive, transparent, and an accountable kind of process. And so here are some ideas in terms of how you think about this. Obviously, you're going to utilize the Program Advisory Committee to iterate and develop the framework. I think thinking about what does your scoring criteria look like, and could you develop that scoring criteria in partnership with community to be transparent around what that looks like? Is there a way to think about equity guardrails? Could you think about a Healthy Places Index score that you provide to every application like we did during COVID to say, in Healthy Places Index quartiles 1 and 2, which are the poorest of poor neighborhoods, if that is our priority and focus, then let's put an emphasis on that and have a score to tie to it. And then, are there opportunities for feedback from community, from individuals, from people with lived experience to be able to think about those things? So governance and decision making, I think we could have an entire day conversation on, and I don't want to, veer us too much into this, but I think it's going to be really important for you to think about what criteria you're setting, how public you are about that criteria, and then how you're measuring the review processes moving forward. We're going to skip this Benti again, and really here are the three questions around, what governance model builds public trust and legitimacy? And how do you ensure meaningful community voice in the decision-making processes? So to Commissioner Alvarez's point, do you begin to think about a combination of people with lived experience outside of this room who are part of the review criteria plus the commissioners? I don't know if that's feasible, but something to think about. And then how does the commission engage with its state partners? I think to Commissioner Chambers' point earlier, how do we not duplicate or replicate, but really look to partner and fill the gaps with what Cal HHS, DHCS, HCI, and CDPH are doing in a broader way? So I think this is going to be an important piece for you all to really think about as you go there. But I'll pause there, and maybe as we pause here for additional conversation, maybe get up and stretch for a minute because you've been sitting for a minute, and see if there's any feedback on kind of what does this on the governance side really look like for people? Do people have an opinion or a thought around the governance component more broadly? Okay, so given that there's there's lots to think about here. I'm just going to move to the next, which is what folks just talked about. I think you're going to really have to think about capacity building and technical assistance. And here it's about how do you level the playing field so that emerging or community-led organizations can compete, grow, and succeed. And so this bucket really is about what Commissioner Polmano and Schwartz were talking about related to how do you do technical assistance, how do you think about technical assistance, and this could be as something as simple as looking at office hours, providing office hours to grantees or doing some of that matchmaking, thinking about fiscal sponsorship and compliance help. So really thinking about what do you do to support an organization around some of those pieces. What does evaluation and storytelling look like, and communications coaching with your grantees? What does peer learning communities and mentorship look like? So we talked about that a little bit earlier, but I think it lends itself nicely here. And really thinking about how you anchor bringing different players to the table in this particular conversation. So I want to pause here and really think about, does this resonate for folks? Is this something that is worth exploring and thinking about around how you bring different players that are non-traditional to the table and to the conversation? Any thoughts? Okay, we're going to keep going. Going to skip that. Here, really, let me set up a few questions on this one. What TA support should be built into the fund from the start? So should you expect people to go through a TA process to begin with? Should TA be a requirement as something that you do on an ongoing basis? Should TA providers be procured or a core part of the fund infrastructure? And how do you support capacity without overburdening the grantees too, right? Like too much TA can sometimes be like, okay, I get it, that's too much, right? So how do you balance those two things, I think is going to be an important thing for you all to consider as well. Does this resonate at all with folks? It does. Commissioner Fairweather.
I mean, I don't have actual answers right now, but these are all things that we need to think about. Again, I've been on both ends of this process, and technical assistance can be great and it can be overbearing. Also, I think, it seems like, again, I'm still sort of having a hard time, pinning down. It seems like these grants still are like very different. So it's like, what would even that TA be about? Is it about like, what is data collection? How do you balance data collection against, performance and the staff burnout? I mean, is it about very specific elements of what is Medi-Cal, what is Medicare, like what is it? And that depends on what the grant is.
Commissioner Schwartz.
I feel like we need TA and what's TA.
So we need to define TA like we need to define innovation.
I don't feel like I could answer that. Really. Maybe there are other commissioners that have experience with that, but.
Oh, Commissioner Cross.
That was actually my question, because I don't know what technical assistance is. Like when I hear that, I think like IT, but I don't know anything.
Yeah, that's a really good question. I think traditionally speaking, what we're talking about here is that you create a forum or a place where people who typically don't have grant writers, for example, can go to a place and ask a bunch of questions around how to apply for the grant. So say, for example, you open up the grant and then you have a TA spot where people can come and say, what do you mean by submitting these forms and how do I actually submit them? It's that type of technical, like you're providing assistance to get somebody to make the application for the grant. Does that make sense?
That's one kind.
That's one kind. That's one kind.
Yeah, it could be a lot more than that.
Yes.
There's more during the grant that has to do with education.
Yes,
or-
absolutely, absolutely. Maybe, I mean, I think your point on compliance and data.
Yeah, I mean, it can be, helping them describe how they monitor quality. It could be how they describe their financial processes. I mean, it can be, you know, and honestly, I mean, when you think about the types of organizations we might be dealing with, I think we need to be open to a very high level of technical assistance. Because we're going to have to, you know, demonstrate to taxpayers that we are good stewards
Of the money.
They're good stewards of the money.
Yep.
And this will help with that process.
That's great. Commissioner Fairweather.
The other thing I would say is that if they're to be innovative, that there has to be that sweet spot between, you know, what the deliverables are and then the opportunities for process evaluation and flexibility as they're developing it. Because there could be assumptions about what you think is going to work. You know, I mean, I like to tell stories. So this grant that I just, you know, was involved in designing and giving out is, there was an assumption that the clinicians were being a more important part of the staffing. We found out the most important part of the staffing were the peers, the service assistants, and the transportation specialists. Because those are the people that were like there every day doing stuff with people. So we changed the line items for the staffing, you know, with discussion and everything. But so if something actually
So some flexibility
is,
to move around.
and particularly because it's innovation.
Right.
You have this great idea to innovate, and then you figure out, well, we need to change directions.
Commissioner Cross.
I was just going to ask you if that's what technical assistance is. Like, is it only for grant writing where they go in and they get assistance?
No, it can be throughout the entire life cycle of the grant.
Just in,
Right.
but it's for grants.
Right.
Okay.
Right.
Okay. I've read grants. I feel like
Okay, any other thoughts on the TA and kind of how to think about the TA to build the bigger table? Okay. All right, now this is probably my favorite part because I do love this area. So I think it's going to be really important for you to set the expectations from the very beginning around what data you expect from the grantees. And then there is different types of data that you can think about. You can think about process measures, things that demonstrate like widgets. You did X, Y, and Z how many times. There are outcome measures. Someone actually got a prescription and then their A1C was lowered as a result of that prescription. That is an outcome measure. And you need to think through kind of how, on what period you collect the data and how you collect the data. So does the commission have the infrastructure to be able to, for example, ingest the information and or analyze the information in a robust way? So to me, some framing thoughts really here is about, like, are there access metrics that you can think about, the new population reach, service touch points created, et cetera. Really be deliberate about what that looks like. Engagement and outcome. So is there retention and care that you can think about, or user reported improvements that you can think about to be able to collect that information? Is there system change type of things you need to look at, like number of policies adopters or practices institutionalized? And then what does learning and feedback really look like in this environment? So I would encourage you to think about this twofold. One is, what are the metrics and the data that you're thinking about for the entirety of the program? So when you go to the legislature and you say, after 5 years, we used $100 million and we achieved X, Y, and Z as a result. That's the system level. And then you need to think about what is the granularity of the specific project and what data elements of that project for you to be able to say, this we deem successful. And that criteria needs to be developed now so that your grantees both understand and know what type of information to collect and how to collect it. And then it's going to be important for you to be vigilant about collecting that information to be able to tell that story over a period of time. Then you can say, our assumption was that these things worked, but perhaps they didn't work or they didn't have the effect that we thought it had, and these are the reasons why. And here, I've been thinking a lot about this concept of a sandbox. Like, could we think about creating a sandbox? And this is where I think it would be good to have some conversations with Cal HHS around, can you create a place with kind of the Center for Data Insights of Innovation, a partnership where you begin to ingest the data in a way to look at outcomes when it comes to the Medicaid population. So you're matching and building data sets in a much more strategic way. It also is going to be important here to have a database around successes and failures. Because sometimes all we focus in on, research papers and publications get only written about the successes, but we don't talk about necessarily the failures. And government funds a lot of things, and sometimes what we do is say, well, we don't want to emphasize the things that didn't work, but I think we should. And so here, could you create a repository of information where you can say, we tested these things and these were the outcomes that we achieved. And some of them might be good and some of them might not be that great, and that's okay, right? But creating the brave space to be able to have kind of that thinking. So maybe what we can do here is try the Benti again. And here you can go in and look at kind of what outcomes should you be thinking about measuring. So I think this is going to be where you just type in, and you can Me Too here too. You can do a +1, I think, in some of these instances. So if you go to your Benti or Menti, Benti is a whole other thing. Are we?
There we go.
Okay, hold on. Here we go. I think now it should be able to populate. Okay. Those of you who are joining us virtually, please feel free to join. If you're in the audience and you're from the public, please feel free to also tell us your opinion here. I think it'll be nice to think about it. So we've got one coming in saying user experience. What does the user experience look like? If you need help with your mentee, just raise your hand. Another is increase in utilization of services. And you could also do this on your computer. You could just type in menti.com, and then the user code is at the top of your screen, 24010821, and will take you directly to this question here. Okay, we've got a bunch of popping in. So return on investment, connection to services, sobriety measured up to 5 years, full database of all programs categorized and segmented, accessibility of services for use for those without, whether disparities of BIPOC and LGBTQ communities have been accomplished. So really great ideas around things that we need to be thinking about. Okay, so let's continue building onto the conversation here. So what's the right balance? Some questions for you to think about here. What is the right balance between the rigor and the flexibility in the metrics? I think you need to think about how do you co-develop the metrics with your grantees and the community, because you all may have an idea of what that looks like, but I think you need to field test it and think about what that looks like. And then how can you ensure evaluation or metrics uplift community knowledge? So to me, this is about the data tells one story, but the data tells only a portion of the story. So you need to couple the data with the qualitative experience of your grantee, so you're telling the totality of the picture. The data tells one portion of the story, it doesn't tell the full story. I'll pause there. Do any of these things resonate to people? I think one of the things that before I go in here, Commissioner Chambers talked a little bit about essential health benefit, not essential health benefit, why do I think, the enhanced care management benefit and community supports, right? The idea here, we also learned that smaller organizations don't have the infrastructure to collect this information or don't have the ability to really think about how you go about the collection of some of this information. So those are things that you're going to have to contemplate as well as you think about this. But I'll pause here. What are people's thoughts on kind of the data and the outcomes, which I think was a big part of the conversation? Commissioner Polmano.
This is really more of a commentary. Remember how I talked about, should we have a certain percentage of funds going to administrative versus patient services? And now I just want to make sure that we are not overburdening our providers and spending more time on data collection, which is why it is critical for us to really determine, like, what is the right information that should be collected.
Not be data rich and then information
right,
poor,
that's
just to
right.
collect
What's that
data for the
meaningful
sake of
data?
collecting data. Yep, I got you. Okay, other people, Commissioner Larson.
I am kind of like you. This is like the nerd part of me really loves this portion, and I think it's one of the portions that might be the most important because we know there's kind of a timeline on this funding. Because that's actually how we ended up with Prop 1, is that we failed to track outcomes for 20 years in the Mental Health Services Act, and I don't want to make that same mistake as we move forward. I do worry about, like, as we bring in smaller organizations or rural communities, their ability to, or even have the data infrastructure to track meaningful outcomes. And so if there's a way we can build into our process or our rubric for making these decisions, either an evaluator for all of the projects, or some way to build in the data infrastructure and supports to tracking these meaningful outcomes over
So
time.
basically, I mean, I think this is to Commissioner Palmano's point too, like maybe creating the infrastructure and standardizing it from the front set so that you know exactly how you're thinking about it. Let's go online just to build these two things out. And then Commissioner Callan has his hand raised. You're muted. Oh. We're going to unmute you.
I think it's a great idea. I think it'd be nice if the data collecting was a collaborative effort between the grantee and the commission, setting a realistic outcomes and even inspiring them, just with the goal of being after the period's over, that the goal is to be a success and be able to get more money to increase from that time over. But I think a collaborative effort from the beginning would be helpful and inspiring to them.
So setting kind of collaborating on the metrics and understanding what they can, I love that. Okay, in the room, Commissioner Roulette.
So I said in a previous commission meeting that, this is my monologue, so forgive me, that data collection under Prop 63, the end result was a dumpster fire. We got nothing. And I certainly want to underscore that point, that we cannot do that again. And that there's points of advocacy where we can position ourselves to ensure that that doesn't happen in our leadership. So one of the things that Commissioner Carnevale wrote, and I'll try to read it and I'll be succinct, he's advocating for a new system of measuring community opinions, completely new. And by that he means mental health patients and families and the general public, and that we have a system of technology that is radically responsive to change and allows the people to tell you immediately how things are going from their perspective.
I think that's an important point, definitely. Commissioner Fairweather.
One, that balance between the burden and the importance. So yes, working with them on, if there's a quarterly client wellness assessment, working with the grantees to figure out, or having an independent process evaluator who can help them do that and shorten things or make it okay. Allowing them to have things like, if you want people immediately to respond, well, who are they going to respond to? Allowing for all of the peers or the outreach people to have tablets, just physically make it easier for people to do that data collection. And then finally, really trying to, and this is, I guess it's the responsibility of the grantee of explaining to people why the data is important and trying to get that buy-in. And maybe they think, well, nothing happened today, so why would I write anything down? Because something might happen tomorrow, and then we'll figure out what was the difference between today and tomorrow. You know, so it's always rough, and, you know, also, you know, people who are out in the field and wanting to do that face-to-face work are they're not data nerds quite often, you know, so you've got, it's a real hard balance.
I think in today's environment too, it's also be truthful to the folks that you're serving about what you're doing with the data, because there's a lot of fear around immigration or other things. So I think just adding that layer. Commissioner Roulette.
I'm just going to advance what I think I'm advancing what you just said, Commissioner. So you tell me how I do it today, okay? So my healthcare provider, Kaiser, does no pressure, Commissioner Robinson, but here we go. Does a great job of soliciting. They do a great job of soliciting my opinion about customer service, my experience, did I get what I wanted. They do a great job at doing that. They don't tell me anything about what they do with all that information. I have no clue. And in fact, if they ask me, how would you like to see that information used? I'd say things like this. If I complete the survey, it will result in, and then I'd spill it out for them. But they don't do that. And that's what we're talking about.
Got it. Okay. Which is the point that you're making about.
Yes, that's Carnevale's point.
Carnevale's point. Yes.
That's Carnevale's point.
Yes,
That's how we need to think about data.
I hear you.
How did I do?
That's the consumer. So yes, and I was thinking of the person who works for the organization, who's working with the consumer. So as in terms of,
But and it's
easy. Yeah, absolutely.
It's easier. I don't mean to preoccupy this. It's easier for the organization. I work in a CBO organization for 40 years. It's easier when the consumer is invested in responding to the data collection as you are.
Because it's a richer
Because
the data,
it's richer,
Yeah.
and it means something to them, and it means something to me.
Yeah.
It means different things. It means different things to Kaiser than it does to
Sure.
me. But Kaiser never tells me why my opinion is important. So I
Commissioner
don't get that.
Robinson will talk to Greg
Yes,
Adams.
yeah.
He will talk to Greg Adams.
But they don't
as soon
tell
as
me, they tell Robinson. And that's wrong.
Okay, I want us to move, I want to be mindful of, go ahead. Yeah. So just really quickly, can we just go through, there is public comment? Or we need to get to public comment? Yeah. Okay, can we go to the slides just really quickly? Great. So the two other things just really, really fast that I want to, maybe, can someone help me advance? No, this is different. Okay. I just wanted two other things that I want to put in your mind.
Antonio, are you able to advance?
Oh, here we go. So financial sustainability and policy change, I think these are two things to really think about. So blending and braiding private and philanthropic funds, this was the setup to the conversation. I think thinking about that, connecting innovations to Medicaid reimbursement. So if you're doing this, does it lend itself to Medicaid reimbursement at the end? That is not to say that you're going to ask the state to add something to be reimbursed, but is there a existing vehicle that you can leverage? Aligning with CalAIM Prop 1 and BH Connect and other things, creating that data sandbox that we talked a little bit about, and real-time feedback. So here, really, this is about what makes innovation stick beyond that grant period? How do you actually begin to think about that? How do you think about local and system? And then what does the TA look like in this space? And then finally, really thinking about communications and storytelling. And how are you telling the story about what you're achieving so that when you go back to the legislature, when you look back 5 years from now and say, this is what we were able to do, do you need to think about funding grantees to develop storytelling community media, create an innovation portfolio website or digital hub, really thinking about hosting statewide showcases, webinars, or convenings to be able to do that, and then building the power for equity, inclusion, and dignity in care, right? So I think those are going to be important. And there's a series of questions here that we can contemplate. Next steps, and I just want to get to this before we get to public comment, this was the learning journey. You started with Commissioner Carnevale really setting up the tone and the vision for where things go. You had the call for concepts that build out these things. We had today's conversation. Next, we're going to really look to engage the Program Advisory Committee, engage community and the public outside of this room, and then think about how you consult the state, and then come back to this group for really a commission approval. And then I'll just end on this note, not for us to do the mentee, but really I've been thinking about hope a lot, and the University of Oklahoma has been doing really interesting research around the impact of hope. And the more hope we have, the better we outcome have. And so I would just ask you, as you contemplate and listen to the public comment over the course of the next little while, what is it that gives you hope? To me, my kids give me hope. Their energy and youthness is the thing that gives me hope. But for each of us, it's something different. So as you continue to have this conversation, I hope you can anchor it in that. So thank you so much for having me, and I'll turn it over to Myra.
Thank you so much, Marco. Really appreciate your facilitation and everyone's participation in this dialogue. Again, this is a continuation of a conversation we've had over the last year or so, and we'll continue to have over these next few months, and even more with the leadership of our program committee with Chair Tsai and Vice Chair Madrigal Weiss. At this point, we want to open it up for public comment, Mariani, in response to the dialogue. Please.
Okay, we currently have one in-room comment from Stacy.
Great, thank you so much.
Thank you. Good afternoon, Commissioners. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. And I'm going to try to squeeze it into 3 minutes. You know, we did recommend several times to the Commission that we don't even know what your definition of innovations is. So I'm glad some of the commissioners brought that up. And I think the community would be very they would be less frustrated if they knew the parameters of what was going on. So there won't be disappointments. We know we can't have everything, but to be honest, so far this process has not seemed transparent, and I keep seeing the word trust. Let me tell you, so far, the community does not feel trust. I'm sorry, Chair, if you're surprised, but I think you'll hear, and my folks, if you feel trust, then tell the Commission. But there are people waiting to weigh in. It seems like decisions have been made already, like what direction you're going in, and we haven't been able to weigh in. And again, not that you have to do what we say, but we don't feel like people feel lost. I feel lost, and I come to all of these meetings. So it's not, Now, I realize to be realistic, there are such a new number of commissioners, and this is very exciting, because many of you, Schwartz, Commissioner Schwartz and Commissioner Fair, and anyway, the new commissioners are bringing new, anyway, you know who you are. You are bringing voice of the community. Now, if this is how this is going to be, this reminds me of the legislature, where the legislature is supposed to be our representatives. But at least I know I have communication and access to my legislator's office. If this is how it's going to be, if all we get as the public are these little 3-minute bits, then I would ask the commissioners to at least make your names or emails, your emails or contact information public. Because if you're supposed to be our representatives, then we need to be able to talk with you. Because you said at the committee meetings, it's going to be like this, where we just get these little 3-minute bits and there's no dialogue. Okay, then at least how are you going to represent us unless we can talk with you? Like I said, there's just so much. We've been talking and chatting while you've been talking for 3 hours, and The community now gets to say. I just hope that you've seen our letter.
Thank you,
There
Stacy.
was a letter. Okay. I want my other folks to speak too. Thank you.
Thanks, Stacy. I know it's not customary to respond to public comment, but given that there is likely to be alignment with other public comment, I really want to emphasize this is the opportunity for input. And I think this dialogue demonstrates we have not made decisions. There was robust discussion around the fact that we have not made decision. So I want to emphasize that to folks on the line. If there are additional ways in which we can offer that opportunity for dialogue, by all means, give us that feedback. I did state in my opening comments in introducing Marco that his contract with the commission is intended to present those opportunities. Dialogue facilitation with the commission as well as with the public. So this actually isn't the only opportunity to engage in this conversation. I want to emphasize we hear our public. We hear you loud and clear that there needs to be more intentional commitment to dialogue. And that is what we're making available through this contract, through the investment in this contract and space. So looking forward to hearing the public comment, but want to emphasize those 2 points. No decisions have been made, and there will be concrete opportunities for public dialogue. And Sandra,
I also want to just add that the way that our committee structures, because the bulk of the meat of the conversation is now going to move to the Program Advisory Committee. And those committees, we are relaxing Robert's rules, so it'll be more of a dialogue. We're still compliant with Bagley-Keene in every respect, but like the actual limitations, each chair is going to be able to determine whether or not to have time limits to be able to facilitate the discussion. You can, again, public comment will only be limited to items on the agenda that can be dialogued, because as you all know, that if the item is not on the agenda, our commissioners are not allowed to speak on that. But so long as the public comments are addressed and prepared for in the agenda, dialogue will be encouraged, and it will be part of the way that we've structured our committee structure. So there will be robust participation back and forth. Again, the chair of each committee will still be the chair. You know, they'll have to be in charge of making sure that the meeting starts and ends on time and giving everyone ample opportunity. But I just wanted to make sure that folks understand that we are going to be relaxing Robert's Rules of Order in our committees.
Thanks, Sandra. Amariani, please.
Okay, thank you. Sorry, I had to do a count. Again, we currently have 11 public comments virtually. Our first comment is from Jerry. Your line is open.
Okay, hello again, everybody. I just want to offer a quick reminder that that $121 million that's available for community program planning process in fiscal year 21-22, we spent about $8 million of that on community program planning. And a lot of that money could be used to encourage stakeholder engagement, training, learning how to use data, publishing data. There's a lot of things that could be used or could be funded through the CPP that the counties are already paying for that would help encourage stakeholder involvement. But my comments are also focused on innovation program design elements of and the mechanics of the systems you deploy. And I first want to encourage you to incorporate a fail fast method where you're designing criteria used to evaluate and assess what isn't working more quickly so that you can enhance projects that are delivering outcomes beyond expectations, or completely drop funding for this project and put it on another project in a more timely basis. The idea of funding one project for a 5-year period really doesn't make sense in today's world when we can learn so much so quickly. Second is that I think that you need to develop a framework, and part of that framework should be a transparent and collaborative process where the CBH and counties openly and on a timely basis inform the stakeholder community, especially consumers and families, at each stage of the process by publishing the results on their website. So what's your hypothesis? What are the project ideas and anticipated outcomes? Get community feedback. Then when we adopt projects, list the challenges, the opportunities, and what revised tactics to adjust. With open and transparent practices, counties could deploy similar pilots locally more economically, and they could develop complementary pilots to help us achieve the larger objective more efficiently. And finally, although there are many laws around how these elements could be deployed, I encourage you to explore them from a client-centered perspective and identify solutions that avoid conflict but encourage informed feedback. Thank you.
Thank you. Our next public comment is from Selena. Your line is open.
Thank you so much. Selena Lou Raphael from the California Alliance of Child and Family Services. Thank you for this thoughtful discussion. I've truly appreciated the comments from all the commissioners and taking time to really define what we need to innovate and think about who gets to define what is needed. We are eager to partner with the commission to help inform and co-create ideas for the Innovation Partnership Fund. Our CBOs could really help bring in the constituents from their communities to identify their needs. For example, what youth and families identified they needed but couldn't receive because they weren't funded or adequately funded. We appreciate the desire to fill the gaps and inequities, both in population served and where we don't have funds or need funds augmented from Medi-Cal, Prop 1, BH Connect, HCI, and all these other funds mentioned today. I love the point that we needed to strategically think about what falls outside of what was currently being funded or adequately funded under all of those other initiatives. I'd like to add, for example, how the recent bond B-chip grants were awarded, and maybe we could see how much was awarded to adults rather than youth, or look at geographic gaps. On that data point, I know that DHCS plans to take a look at that with the final grant rounds, but we could also do this with innovation grants, seeing what programs are funded and where. So we could look at that as a data point and see where there's unmet needs. I know someone mentioned too that there might not be staff in some areas to really adequately put in grant applications. So maybe we could see geographically where these gaps are, or where there are gaps between youth and children's services versus adult, and ask those communities what else they could add. So I just want to say thank you for your commitment today to further the discussion, to engage the public, and most of all, those impacted in these collaborations. And we look forward to engaging in the stakeholder process. Thank you.
Thank you. Our next comment is from Steve. Your line is open.
Hello, my name's Steve McNally. I'm a family member from Orange County. First, I want to thank you all for the robust conversation. We don't get to see you all communicate so openly, and I think it's important that I'm used to seeing state meetings where 90% of the time is taken up by presentation, 10% of the time for communication. It seems like it should be flipped on its end, that you should be able to read most of the presentations that are presented so that the knowledge in the room can level set each other. I guess part of my confusion is, how can we be at year 21 and still not know what works? And how can we have a governor control a process that changes the entire funding cycle and eliminates MHSA every 3 years, the full $2 billion to the counties, by changing the funding structure, on top of taking No Place Like Home money, on top of taking other money? I guess I would ask that maybe we look at, after watching the senators and assembly people at these hearings, they're getting more and more frustrated and at trying to ask questions and getting no answers. And who's going to stand up as a group collectively and say to this executive branch, we expect you to create an agency structure that requires that people work together, that we can't have one department of HHS doing community health work or one doing peer, and then one creating 5,000 positions where people aren't really getting employed. And then they're going to be unable to build in structures. The details really do matter. And everyone likes to, we like to plan in our state. I used to say when your prior director was here that if I go into the archives of this body, I will see all the great presentations that were done before the Department of Mental Health was eliminated. And they're the same presentations that we see today. They just never got implemented. So there is a lot of stuff in the state, legislative required reports. They just don't get done. Supposed to have quarterly reporting on 5150s. The last one I've seen is in 23. So you all probably know where to find them. So what is it gonna take for someone to stand up and be patient-centric, client-centric in California and not create a mild and moderate system that looks like the mental health system, the mental health plan? ECM is just another FSP in a lot of ways. And it's just,
Steve, your time is up.
I will finish. You know, I'm not, my intention is not to be negative. It's just to try to get you all and everyone in the state to get the rest of us 40 million people engaged. Because until we change the players at the table, it's so easy to manipulate a small group of people. And it's so hard to watch that on the backs of people with serious mental illness. So thank you again for all you do. I do really appreciate your efforts. Thank you.
Thank you, Steve. Our next comment is from Joel. Your line is open.
Hey, thank you so much. Joel Baum. I use he and him pronouns. I'm with an organization called Safe Passages. We're one of the amazing collection of projects under the California Reducing Disparities Project. I want to begin by thanking the commission for having the meeting today, for holding this conversation, and for articulating a commitment to discourse and public engagement. Commissioner Chair Alvarez in particular, you have been so powerful over now several years advocating for community-defined evidence practices, for the power and strategic use of cultural humility and equitable practices, and I've greatly appreciated watching you in action. But I also do want to name that there is a serious trust gap currently in place here. As part of the CRDP, I had the great good privilege of working with dozens and dozens of community members and organizations who came up earlier this week to the Capitol to attend subcommittee hearings on both sides of the legislature, and to hear incredible stories, powerful voices calling for solutions that work. And to Steve's question, we do know what works. We know what works because we've seen it in action in the CRDP, and that has included committing to engaging with, listening to, and learning from the communities we're seeking to serve. And so I guess what I would really like to ask is that this notion of community engagement will be something that is truly adhered to, but I also want to paint a picture for you how that trust issue is getting in the way. I want you to imagine that you're planting a garden, and each day you work so hard to get it ready. You till the soil, you set up the watering system, you do all these things, only to come back the next day and see it's kind of been undone, or someone's taken it in a new direction that you hadn't quite understood that that's what it was going to be. I have to say, in several cases, including today, with the emphasis on philanthropy, there's a feeling often that the work we're doing, the ideas we're sharing are heard and acknowledged and recognized, and we leave feeling really good. And then we come back, we're like, wait, hang on, did I miss a meeting? Was there conversations had that I wasn't part of? And so I guess given the gap in trust that I think many of us are having, I want to strongly encourage the commission to be doubly, triply transparent, to bend over backwards, to paint the picture for us of how decisions are being made, because there's not a lot of trust after we've seen many of the projects.
Your time is up.
Yep, I'm almost there. Many of the projects having the rug pulled out from under them, including money for the CRDP and the governor's revised. So I just really want to beg for you to not only tell us that you're going to engage us, but to demonstrate it powerfully and authentically, because we've been sold a bill of goods a lot of times, and we're kind of getting tired of it. So again, thank you. We're offering our faith, we're offering trust, but please help us feel like it's a good investment.
Thank you, Joel. Our next comment is from Jay. Your line is open.
Can you all hear me?
Yes, we can hear you.
Perfect. Thank you. Good afternoon, Commissioners. Jay Kilkenny with the California Behavioral Health Association, a membership association of community-based mental health and substance use providers. We want to first thank the Commission for the extensive, thoughtful discussion around the Innovation Partnership Fund, and we wanted to echo the previous comments around the community desire for greater transparency and involvement. We encourage the Commission to review and adopt the recommendations that were put forward in the coalition letter authored by REMCO on May 15th. These include opportunities for robust community participation and input with a transparent planning and implementation process, the inclusion of CDEPs as a funding priority as part of the Commission's broader focus on serving marginalized populations and communities, and as well as prioritizing public, nonprofit, and tribal entities for Innovation Partnership Fund funding. Thank you.
Thank you. Our next public comment is from Catherine. Your line is open.
Hey, everybody. Thank you for allowing me to speak. My name is Catherine Ferry. I'm a past member of the Cultural and Linguistic Competence Committee of the Commission all the way back in 2015, 2016. So it's good to be in this space again. I'm from UC Davis Center for Reducing Health Disparities. And I am also affiliated with the California Reducing Disparities Project. I wanted to react to some of the wonderful comments that were made by the commissioners, especially looking out for the stakeholders throughout the stakeholder process, right? And making sure to set expectations and really define early on what innovation looks like to this funding. I think that's critically important. And I know we have several project partners here, and there's a lot of passion. And I want to make sure that everybody has the context that the final year of the California Reducing Disparities Project, which funds over 35 agencies, was eliminated from the governor's budget midstream. So contracts will not receive their final year of funding, which amounts to over $300,000 each for a lot of CBOs. So if people are a little passionate today, it may be coming from that place. So I think it's particularly important, and I really, heard you loud and clear, Chair Alvarez, that, the commission is eager to listen to stakeholders and is actively seeking opportunities, including this one. So I really appreciate that. And we got lots of people who can talk to you. And I think that the CRDP project could be something to read about and know about in more detail, because it hits a lot of the points that were discussed today. It has a robust evaluation that was carried out by Loyola Marymount University. It had a capacity building component for community-based organizations that involve technical assistance providers. My agency is one of them. So I think that, taking maybe some time to review the statewide evaluation report, it's available online, reporting on the project years 2016 to 2022, would be really a great thing to look at. And we're happy to, any of us I know is happy to share more, but we look forward to this funding. I know people are really hungry for information for us, and I appreciate your dedication to listening to the public. I think you'll find there are many representatives from the small agencies that, are being considered as possible project partners, and that they have a lot of great data to share with you. Yeah, in particular, on the topic of data infrastructure, all the things you guys talked about this afternoon, I think there are a lot.
Thank you, Catherine. Your time is up.
Thank you, Catherine. Our next comment is from Rakaya. Your line is open.
Hi, everyone. My name is Rukaya Ahmed. I am a policy manager at the California Pan-Ethnic Health Network, or CPEN. I just wanted to express appreciation for, the Commission's efforts to facilitate today's discussion on the Partnership Fund. And I think it's very clear that there is like a genuine commitment to really considering the fund's goals and structure. That said, I also want to echo the sentiment that's been shared by a lot of the community partners, that the current structure of the discussions, while I know they are well-intentioned, they can sometimes feel a little limiting because the meeting format doesn't really allow for that open and organic dialogue of the communities. And so it kind of feels like we're like being asked to respond to a framework that's already been shaped rather than being invited in as like co-designers from the start. And so that's why I think we are really looking forward to the program committee meetings, and like really digging into these questions more. And I also just wanted to highlight CPEN, along with more than 24 organizations submitted a letter of principles last week where we outlined some of the core values that we think should guide the fund, including like ensuring a participatory design process, and also really prioritizing meaningful support for CDEPs, which were also like most frequently mentioned in the concept submission survey that the commission had released, and then are now also they're unfortunately being threatened even more with the elimination of the funding for the final year of the CRDP project and the May revision. So just wanted to make sure everyone saw that letter, and also just wanted to say we really value the opportunity to partner with the commission, and we're looking forward to continuing this work in ways that are going to center the communities.
Thank you. Our next comment is from Sarah. Your line is open.
Hi, everyone. My name is Sarah. I use she, her pronouns, and I am a local evaluator with the California Reducing Disparities Project, working with a Trans Thrive at San Francisco Community Health Center. And I also work with a lot of other queer health and immigrant justice organizations. I want to comment on somebody asked, like, what is the problem that we want to solve and what is the innovation that we need? And I think like an innovation that we really need is political clarity and commitment to values. Like now is not the time for California to backtrack on its commitment to undocumented people's healthcare, to being a trans sanctuary state. Like we're seeing the governor make discriminatory comments towards trans youth. Like the innovation we need is the clarity to say that that's wrong and that we stand with undocumented and trans people, and that we stand with organizations like California Reducing Disparities Project and the really, really innovative, amazing work that's happening at the state level. I also wanted to offer for consideration the Targeted Universalism Framework by John Powell at the Othering and Belonging Institute. I think it's really important. People have commented about different groups being like pitted against each other, or like how do we weigh different priorities? And I think targeted universalism is really powerful because it's about like what are universal rights and like what kind of thriving does everyone deserve, and what are the targeted strategies to get there. And I'm hoping that we can like keep that forward. And I hope there can also be conversations about what levers of influence that commission members and all of us have to change the conversation so that we're not so frequently dealing with scarcity and thinking about like the right to universal thriving and these universal rights for people regardless of immigration status or gender identity to have access to care, like especially when we know that Medi-Cal funding is going to be targeting gender affirming care. Like how can we be innovative in terms of staying true to the values of our state?
Thank you. Our next comment is from Alex. Your line is open.
Thank you. My name is Alex Filippelli. My pronouns are they and he, and I'm with the Center for Applied Research Solutions. I'm a TA provider for the LGBTQ CDEPs that are part of the California Reducing Disparities Project. Thank you for your engagement about the Innovation Partnership Fund and the opportunity to speak. I would like to urge you to prioritize CDEPs in the development of this structure. They were the #1 choice in your online survey, and the research findings from the California Reducing Disparities Project show that CDEPs are effective at improving the behavioral health among 5 priority populations: African Americans, Latinx, API, Native American, and LGBTQ. I also want to, just as Catherine stated, encourage you to look to CRDP for examples of utilizing TA and evaluation in innovations work. And then I just really want to mention that like impacted communities, like the 5 that are part of our project, really need to be empowered as co-creators in the funds design and strategy, and not just consulted in surveys or in opportunities like public comment. It's really important to prioritize transparency and public trust. And there are, just as it's been mentioned by other folks here during public comment, other decisions and choices that are being made that are eroding trust and eroding people's faith that California is a safe place for them, and that they have the right to be able to live and thrive here. And so I want to encourage you to also think about defining innovation through an equity and systems change lens. And that innovation must be defined broadly to include community-defined and non-clinical approaches, and not only medical models. And that also that definition should reflect the lived experiences and healing practices of BIPOC, immigrant, trans, queer, disabled, and low-income communities. And to also think about systems change in a way that centers equity and sustainability and long-term community impact, that we're not just coming in with 5-year funding and then there isn't a pathway to sustainability for the communities that are being served by the organizations where they're receiving care. And again, as it's been mentioned by Joel, we're seeing that happen at the state level with cutting CRDP while we're in contract. That's it. Thank you very much.
Thank you, Alex. Our next public comment is from Imelda. Your line is open.
Good afternoon, Imelda Vera with Humanidad Therapy and Education Services in Santa Rosa, Sonoma County. We are one of the 35 organizations within the California Reducing Disparities Project. I first of all, thank you so much for the opportunity for public comment. I want to share too that I'm also a commissioner for First 5 Sonoma County, so I know I kind of wear both hats right now. I understand you commissioners and chair the role that you're taking. Today I want to stand for the California Reducing Disparities Project within the Latinx Hub. And more so in the last 3 years within the California Reducing Disparities Project, within phase 2, our organization repivoted to work with youth. And innovatively, that gave us an opportunity to work with youth within our local high schools. And so almost for these 3 last years, we've been able to provide group therapy to newcomer students in this country. And so in our organization, within our community, in the grounds of mental health services, we've been able to create a model of services for therapy to youth where a lot of the times they're being brushed under the rug because of their not having the language of this country, the understanding of community, not having the understanding of how to engage in a community where they're here with loved ones, not with the whole family unit. So again, innovatively, our project has been able to serve close to over 100 youth just in these last 3 years. And we stand with this project that these students within their high schools, they continue to need support because as within the Latino community, we are Latino, we are community. And with our help, they have been able to thrive and really voice that they would like to seek more services, both for mental health supports through therapy, but also that our services have been able to provide for them to understand kind of their day-to-day understanding of this model of coming into a high school world where they completely come from a world non-existent of what we have here in this country through the school system. So again, thank you so much. And just for transparency and the reality is that where these fundings are going and how are they being distributed is really important. As you know, this is a time to really voice these concerns, given the May revision of the governor's proposals. Thank you.
Thank you. Our next public comment is from Erica. Your line is open.
Good afternoon. My name is Erica Jun. I work as a technical assistance provider with various Asian American and Pacific Islander serving organizations in the California Reducing Disparities Project. Thank you for your time and this really important discussion, commissioners. I appreciate the diversity of comments that I heard. I wanted to encourage the commissioners to have more public input into this discussion, especially from the many diverse communities that we have in California on what constitutes innovation and what should be funded under this Innovation Partnership Fund. I appreciate the mention of ensuring community buy-in and administrative support. Both are very important for community organizations to survive. I also heard your comments on wanting meaningful data and lasting outcomes. Many community organizations do have those lasting outcomes because they invest in community relationships that take time. I asked you to invest in communities by supporting community-defined programs which prioritize building on existing relationships and trust that ensure that people are connected to supports and resources. Thank you so much.
Thank you. Our next comment is from Laurel.
Hello, I'm Laurel Ben Hamida, and as I said earlier, I'm with Mass Social Services Foundation and with RIMCO. I'd like to challenge the commissioners to incorporate philanthropy, to double the money that the government is giving by approaching philanthropists. Well, where does philanthropic money come from? It comes from people who profit. So jump in the Shark Tank and come back with more money for this project and maybe make up the other things that the government's cutting from your budget. I'm serious. The government's not going to be, the way it has been for a while. Second, I'd like to see you pay and provide technical assistance to the small CBOs in the California Reducing Disparities Project who fill gaps in access to culturally and linguistically appropriate services that millions of people in California need to achieve their goals. So these organizations need to achieve their goals of sustainability by billing, insurance, or by some other means. And that saves the government and taxpayers a lot of money. But it's time for you to step up and help them make that transition. This was, in any case, going to be the last year of that project, the CRDP. So this is the time when organizations are mature enough, have built capacity to need technical assistance. Now, the other side of that story is streamlining the billing bureaucracy. A lot of California counties are currently streamlining building granny flats, also known as ADUs. How do they do it? They give people pre-approved building plans. There needs to be a creative way to remove the bureaucracy in health insurance billing in California. Thank you.
Thank you, Laurel. That was our last public comment.
Thanks so much, Mariani. And thank you to our commission and to members of the public for engaging in this important dialogue. Marco, thank you for your facilitation and for your continued partnership in this effort moving forward. I will emphasize that we are looking forward to our community dialogue sessions. There are at least 2 scheduled with Marco and his facilitation. I want to be mindful that we're limited in the number of commissioners that can attend those sessions to under 3, right?
Unless we notice it publicly as a public meeting, and then we can adjust the numbers.
Even better, let's do that, because then all of us can join. And I would encourage our commissioners to join those sessions, because that's the opportunity to really engage in that dialogue. We're not going to be voting on anything, so we can all attend, but we're not required to. Thanks, Sandra, for clarifying that. Any other questions, comments, reflections from commissioners? All right, thank you. Again, Marco, thanks so much. Members of the public, thank you. We're not done yet. Okay, for agenda item 7 now, the commission will hear a presentation on grant opportunities to strengthen full service partnerships. As we heard earlier, this is a critical opportunity to continue the commission's leadership in this important resource for community members. As a reminder, the commission previously approved the allocation of $10 million in Mental Health Wellness Act funds to be used towards strengthening performance management and improved service delivery for FSPs. This presentation outlines the proposed distribution of those funds through a competitive bid process. I would like to invite Dr. Callie Clark, Research Scientist Supervisor, to present on this item. Dr. Clark, please.
Thank you so much. Let's see if I can, there we go. So like some of you, a few hours ago, I wasn't feeling so great listening to Norma's presentation. And I actually was wondering how I was going to get up here and talk to you all about this. And then I remembered something very key, which is that I can get up every day and I can do my work being afraid of what might happen, or I can get up and I can do my work fighting for what I know is right to happen. So that's why I'm here, because I know what's right, and here we are. So that made sitting here easy for me today. As a reminder, full service partnerships are our last stopgap in our preventative efforts to divert individuals with serious mental illness away from hospitalization, unnecessary hospitalization, incarceration, and homelessness. They are a major part of the BHSA in funding. They serve tens of thousands of individuals every year and have served more than 250,000 Californians since their inception. But they are running at about 70% capacity, so we know that we can find ways to help them meet the need even better. Starting in January, we will see FSPs expand to provide services to individuals with a primary diagnosis of SUDs as well. In our research, we found that individuals who participated in a full service partnership saw reduced crisis service usage, reduced psychiatric admissions, reduced hospital inpatient stays. We know that they can help people. That's an interesting color. All right. So we've been doing work for years. So in 2023, our first report to the legislature, which is part of our mandated reporting through SB 465, identified data collection and reporting and a lack of technical assistance as key ways that we could support the improvement of FSP. So we've known what needs to be done for years now, and we've continued to build on that work. We've come to the commission with numerous panels. We've brought individuals from DHCS, from counties. We've brought service providers. We've done our own internal research. We've engaged hundreds of clients, family members, service providers. We've done a statewide survey, all to come to conclusions about what's needed to improve full service partnerships. Back in February of 2024, we came here before you and we asked to set aside $20 million in Mental Health Wellness Act funds to specifically for FSPs. And at the time, the commission approved that. And then we came back in August and we said, you know, we'd like to take 10 million of that and focus specifically around capacity building and technical assistance for performance management and improved service delivery. Our findings at that time had already been pretty developed by our research, and so we felt that that was a very strong area to focus in. We then were here, I was here just a couple months ago, and I presented to you our FSP report and was able to lay out before you all the work we've done, how we came to our conclusions, and where we plan to go moving forward, including our future work with looking at child and youth FSPs. And now today, I feel exceedingly excited that we are finally at a place where I can ask you if we can release this RFP that we've outlined. And I want to go over some of the details in that RFP with you today. So we've established some minimum qualifications around this RFP. So this is a technical assistance and capacity building RFP for performance management. And just as a refresher, performance management is not a new concept. It might be a new name, but it's not a new concept. It's really providing individuals with the tools necessary to reflect on where they are, identify future goals, and then follow those future goals and meet them. And then it's an iterative process so that you can see improvement over long periods of time. We want to approach this in a unique way in our RFP. So we do have minimum qualifications. We're looking for people that have significant experience in the public health sector, particularly in California. And we have a minimum number of counties. We are looking for a critical mass of movement here. So a minimum of 8 counties and 20 FSP providers, with the RFP set up so that as you serve more and more, there would be a greater compensation there. And then there are 3 components to this that I think are key to its success that I'm very excited about. One is that it would establish a learning collaborative made up of clients, family members, peers, service providers that would self-identify and self-define what success and performance looks like. And that is key because individuals have the knowledge about what success looks like for them, and we need to listen to those that have the direct knowledge. So that would be a critical component to defining the measures that individuals would then track and help inform the goals that they set. We also would ask for the development of training tools that would live on beyond this project. So I am a strong believer in change that stays and lasts. So not just something that we're doing now that will then die out, but I want to see change that happens and lasts and continues on. And so if we develop training materials now from the learnings that come out of this work, and we make them available moving forward, then new staff that come on or new counties or new providers that join in will have access to those, and it can only grow and grow over time. And then the last is that we plan to be extremely involved in watching and learning what is actually happening and measuring the gains and the skills and knowledge of the individuals as they go through this performance management, technical assistance, and capacity building learning. And so those are 3 areas that I think are really key to what sets this, this RFP apart and would help make it successful for those who are participating. And I would like to, that was the fastest summary I've ever done of anything in my, I feel like there's so much more I could say on this, but I need to be cognizant of time. But I do want to answer any questions that we have in relation to this. I do want to preface this by saying we did take a step back from releasing this RFP for a minute because we were aware that DHCS had released their own RFP and we wanted to take a look at it and make sure about alignment and that we weren't duplicating anything. And after looking at it, we're very confident that we're not. So these are efforts that could happen to complement each other, but in no way are they going to be duplicative. And I can answer more questions about that as well.
Thank you so much, Dr. Clark. I just want to clarify, I just asked Brenda, is this one of the programs that's at risk with the cuts? And so yes, commissioners, this $10 million would go away if the May revised proposal moves forward. However, in the spirit of keeping hope alive, we want to make sure we vote to move this forward in the event that that does not happen. I want to pick up where you closed, Dr. Clark, particularly around the lack of duplication with the DHCS effort. And can you outline a little bit more about why we're not duplicating, what the difference is?
Absolutely. So I think it was really important that we did take a step back and we waited and we read. Once we heard that it was being released, we waited until it was released. And then we saw that really those efforts are looking at behavioral health transformation at the county level, and those supports are really different than what we're doing at the provider level with FSPs right now. So although there is a component in those around performance management, the manifestation and who those are hitting are vastly different. And so we don't feel like it's duplicative in any way. So the individuals that are going to be getting these services would not be the same individuals, and it would not be happening at the same time even. So by the time that the DHCS RFP would even hit providers, it would be years further than where we are now. We're immediately going to be hitting service provider, FSP service providers out of the gate.
Thanks for that clarification. That's an important one, especially given the environment that we're living in right now.
Yeah.
Yes, Commissioner Bontrager?
Can you clarify what's the interplay between this effort and these evidence-based practices, Act, FACT, CSC, et cetera, and the Centers for Excellence? What's the interplay between all of this?
Thank you so much. In my speed, so one of the things that we want to do is give people the ability to be successful in implementing the new mandates under Prop 1 BHSA. And so we have a number of them. And adhering to model fidelity is one of them, right? So we want to give people the tools to be able to identify whether or not they are implementing act and fact with fidelity within their own organizations. And in order to do that, we have to first start with providing people the tools to be able to track what they're doing internally and be able to self-reflect and be able to set goals around. So although we are not giving direct technical assistance around models in this RFP, we're trying to provide people with the tools so that no matter what the goal is in implementing Prop 1 or outside of Prop 1, that they're able to do that. So quite frankly, if we set the foundation correctly, then not only would the new implementations under Prop 1, but also the individual goals of the clients and the individual goals that are unique to the region or the FSP provider would also be able to be encompassed in that. So we're allowing for not only adhering to BHSA, but we're also allowing for the flexibility that's necessary to understand that people are unique and they should be able to self-determine and set goals for themselves. So it allows for both, I think.
Just my experience of implementing coordinated specialty care, it has pretty robust processes around this already embedded in the evidence-based practice. So I just, again, try to understand, is this concurrent with that? Or, I mean, help me understand the difference between this and the Centers
Yes, so
of
this does
Excellence.
not take the place of that at all. This is definitely concurrent. Yeah, this is not trying to supersede. I don't see this as competitive in any way. This is just basically the root foundation of allowing providers to know what's going on inside their building. And that is everything from staffing to how staffing is being allocated to what services are being provided, which is fundamental to then being able to ask even larger questions. So it includes everything from finances to staffing to client goals to provider goals. It's really comprehensive. And in doing so, it allows for multiple goals, both those set out by Prop 1 and those that are identified elsewhere.
Can I just
Yes.
ask a
Commissioner Pomano and then Commissioner
clarifying question? What did you discover that necessitated this proposal, and how this proposal will actually lead to some form of success in implementation? I wasn't here, I think, when you were in 2024, so I just some basic background would be helpful.
Sure. So we did a lot of research in talking with individuals who are directly affected by FSP service providers. So that is clients, family members, service providers themselves, county staff. We did a lot of deep diving into understanding how FSPs can be improved and what success looks like. And in doing so, some very clear voices came out that said, we need help in key areas. And those were the key areas that we outlined in our report. And one of those is what we're bringing to you today, which is what was approved back in 2024, which was to focus on performance management, which is really at its foundation, help us get our house in order so that we can do better. That's really what it is. And it's providing people the tools to be able to do that. But it was directly requested from the work that we've done. So everything that we have brought forward is reflective of our community partners and family members and service providers.
Commissioner Swartz and then Commissioner Fairweather.
Oh, sorry.
How will the counties be selected? Who's going to select them?
So we have, give me one second, okay. So the way that we have this set up is that we are requesting letters of interest as a part of our application process. So we would have interest already designated when we're reviewing the applications. And then there's a recruitment process in the first phase of this work, which is to bring all the counties on board. So as far as choosing them, we have great capacity to serve a large number of counties. So this isn't necessarily something where we're going to have a small number of slots and there's going to be competition. We can serve a large number of counties with the funding that we have, and we do not want there to be a barrier to a county that's participating. So we've set this up so that if you want to participate, there should be room for you at the table.
Thank you. Thank you. Commissioner Fairweather?
Yeah, I wasn't around for the beginning of this either, and I mean, I guess since so much of the county money, well, a third of it, is designated for FSPs, why doesn't the Department of Healthcare Services, why aren't they responsible for funding this? You know, it just seems like, you know, the people who are getting the most money from the counties you know, are also getting, and, you know, I'm all for technical support, I'm all for better services. I just, you know, structurally, it kind of, I'm perplexed.
No, I hear you. I think one of the things that we did first was we took a step back to see where support was already going to be provided. And so there is immense support coming through, for instance, the centers of excellence that are going to be established, which will support counties in a number of ways in implementing BH Connect and in making behavioral health transformation. So there's a lot of work that's going to be done. And then we asked ourselves, and how can we further this even more? And with our learnings, what we saw is this is an area where there is space for us to fill. So this is our opportunity to stand in and make what I feel is critical change for the efforts of everyone else to see even greater payoffs.
Commissioner Chambers?
I just want to commend the fact that you're finding the gaps. I've been a part of the implementation with the counties in the state of the Prop 1 implementation and heard about the centers of excellence and all the support that's coming down the line. I know that I know Commissioner Bunch is familiar with FSP being one of the hardest modalities of service to implement. I mean, as a family member of someone that's currently in FSPs, I have my own ways in which I think we could be supportive. So I would love the commission to continue to work across the board with the multiple departments that are doing this and find the gaps, because this is a huge program. It's not, one department is not going to be able to lift up all 58 counties and entities to implement one of the most complex modalities of treatment for severe and persistent mentally ill and a clinical workforce that is already beat up and fragmented. So I really believe that we do need to have performance management outcomes, and the amount of evidence-based practices that these clinicians are going to have, the fidelity to these models that they're going to be tracking now, and the amount of data, I think we're going to need a whole bunch of support to help these clinicians in the county to even to figure out if it's even like working. So I just commend our work and just being able for you to even articulate where the gap is, so that, because I keep hearing this duplication and all these things being done. But yeah, thank you.
Thank you.
Vice Chair, please.
You know, one of the things I'm hearing, Brenda, is, and Dr. Clark, thank you, in future presentations, how is this TA process going to advance the need for community stakeholders and that are engaged in providing FSP type services or supportive of FSP type services? How is the TA helping them? How is the TA helping the consumer? And should we be doing what a couple of commissioners are suggesting, what maybe DHCS should be doing? And then the question about the funding reduction kind of looms, not large, but in my head, because I know we're going to continue to advocate why it's important to the people that we serve to continue the funding. But those questions, I think we want to address as we do presentations, because there is sort of a unique experience. Okay, I've been on the commission 4 years in the gap of knowledge, and you're speaking to it. So sort of bring me up to speed in your presentation around how we are addressing those fundamental pillars with this funding. Because again, as a commissioner, it sounds like a great idea, but help me to appreciate, as I'm repeating myself, how it helps the individuals that we're privileged to serve and the individuals that provide the community-defined, evidence-based practices that make a difference in FSPs. And we know FSPs, they got a third of the funding. Everybody, they're important. Okay, but how is this TA going to help ensure that the goals associated with FSPs being important gets advanced?
You are eager. Go
Well,
for
just
it.
a comment. I mean, I guess, given the looming budget situation, if for some reason there would be money restored and we had $10 million, and we're evaluating this effort compared to peer respite or something, I mean, to me, I feel uncomfortable moving forward with this. If we were told that certain Mental Health Wellness Act money was restored, and then I could make a decision based upon, do I want to put forward this effort or this effort? I mean, hence the whole issue, when you have finite resources, you have to make a judgment. I hate to make it in a vacuum here when I don't know that. So that makes me uncomfortable about voting on this, quite frankly.
Oh, thank you, Myra. So if the money was restored, then all of that, so we'd still have the peer respite. There's 20 million for the peer respite piece of it, 20 million for FSP, of which this project's 10 million. And then there's the other 20 million for the 0 to 5 that is almost about ready to get awarded. So if it gets restored, it's all restored.
But it's all or nothing? I would think that there would be.
No, if you guys are not like, that's a different issue. So I was like, I don't feel like you're having to make choices between these things, but if it's like truly the project itself, like that you're concerned about or want to learn more about before voting on it.
No, I think the question is if the legislature decides to restore 40 million instead of, right, a portion of.
Then a decision would need to be made, yes.
Legislature.
That's a different thing. Exactly. Yeah, if it's piecemeal restored, yeah.
I'm not sure if it makes, but this part, just to reiterate, is for, does not touch the other 10 million that had been set aside for FSP. So that still has not been allocated. This is for 10 of the 20.
I do think, though, in response to Commissioner Bontrager, we could qualify the motion that allows for another vote if we have limited resources.
The only concern is our timeline on releasing the RFP, like that will, if we, I don't know when we're targeted to release it. So in terms of wanting to make sure that we would shift it and amend it appropriately if the funds were cut. No, there isn't. So we can hold on releasing it till later. So.
I mean, you could release the RFP saying pending availability of resources.
That too.
If there's money for it, I still don't understand, if the governor or the legislature decides.
Oh, I'm so sorry. I think your mic's not on.
Oh, I'm sorry. It's late in the day, sorry. I'm still not clear about if right now, as the budget revises now, is right now, that it's $60 million gone. In my understanding, you fight, and so maybe you got $25 million, maybe you get $10 million, maybe you get nothing. So why don't we just wait to vote on it until we know? And if we did vote on it now, would that, I mean, I didn't understand an answer to your question about how that would impact other priorities and other fundings. If we wanted, because to me, like, the mental health wellness stuff, so I don't understand.
Well, one thing I can clarify is that this vote here only gives us the authority to, at a future date, release the RFP. Without this vote of the general outline, like the high-level outline, we will have to, come back to the commission at a future date if that is what we wanted to do with it. But that is, we could condition it on the availability of money, which would mean that we would wait to see if there was where the legislature landed on this, and that we would know that by July 1st. But again, I understand your point, and it is a commission decision on whether or not you want to hit pause or if you want to go forward with a pending language and have it, have us come back.
If we vote, it's encumbered money. If the money's there. And that's where I think that's my challenge with it.
Isn't the money, clarify for me, is the money already set aside though? Or this is for the release of the RFP, correct?
Yeah, I do want to clarify that this commission has selected FSPs as a priority. We have voted on that. We have made that clear. So this is a procedural vote. Dr. Clark is bringing the RFP and its structure to us. So it's not necessarily that we're voting on if this is a priority. It's more so the procedure of moving forward with the RFP if we have those resources. So I do think pending the release of the RFP on the availability of resources gets at your concern, Commissioner Bontrager, but I want to be clear that it does because it's a good flag.
As far as I'm aware, as long as, once the money is, if it's restored, so if the money's not taken away, so we have it, and we have this vote, we can release the RFP. However, if we get the vote and we don't end up getting the money, no RFP. Because we don't have money.
Questions?
And I can restate the motion as amended. So I would say that the commission authorized staff to release an RFP to award $10 million in Mental Health Wellness Act funding through a competitive bid with the new language. So we'd be inserting pending on the availability of resources, comma, designed to coordinate the recruitment, technical assistance, and training for county behavioral health departments and FSP service providers to build internal capacity and performance management. So we would insert that language if you chose to, someone bring the motion and it got seconded.
Did we make the motion before? No, not yet. Public comment. Any additional commissioner questions or thoughts before we open it up? Okay, Amariani, will you please help us?
Yes, we currently have one in-room comment from Richard. If you could go up to the podium. Yes. Oh, and then there's a small button right there.
Yeah. Good afternoon, commissioners. I know you've had a very long day. If I could just try and provide a little bit of further context for this. I'm the Chief Executive of the Healthy Brains Global Initiative. My name's Richard Johnson. We've been partnering with the Commission for over 2 years now, exploring full-service partnerships and trying to review the level of performance across the system and where there might be opportunities to improve it. And we wrote a report, I co-authored it with my Chief Medical Officer, Dr. John Sherrin, who some of you may know. He was the Director of Behavioral Health for Los Angeles for 6 years. Our key observations were that whilst there is a high level of commitment and some very good services being delivered across the piece, there is also a significant gap in the potential of these programs. Dr. Clark talked about 30% in terms of lost capacity. Some of that is as a result of a lack of staffing. That represents about $400 million of delivery each year, a large proportion of which, of course, is drawn down in federal funds. And it's in part as a result of staffing, but not entirely. Our biggest observation, in fact, was that these FSPs generally track their performance right now in terms of hospitalization and incarceration rates across the population, and they lose sight of the experience of each individual through that program. We have high fidelity to many evidence-based models. There's a high degree of compliance to those models, but we still lose sight of the individual on the program and the outcomes that matter to them. Over the last year, we were asked to work with 2 of your counties to try and introduce some performance management. And by performance management, we mean each month tracking, reporting, and reviewing what is happening on that program. And sitting down at the end of the month and going, so what did we do last month? Who did we see? Who didn't we see? What did each of those individuals want, and did they progress towards that? One of the things that we found was that on a number of the FSPs we were looking at, the adult FSPs, nearly half of the people there had been on the program for over 5 years. The distribution curve of participation was actually very interesting. People went onto the program and they left within 2 to 3 years, but there was this big rump of people stuck on the program and going nowhere. Now, maybe they need to continue to have some sort of level of support to sustain them, to maintain them. But it might be relatively light touch. An FSP costs, it varies, $30,000 to $50,000 per person per year. These people who've been there for 5 years, do they need that level of attention? Or do they need someone to take their medication to them on a regular basis? Can we move them on to something else? In order to do so, we have to understand who they are and what they need. It's also the case that for a number of these people, our service is wrapping their arms around them and maintaining them as victims, because we continue to treat them and not to move them towards recovery. This is the context for this desire, this RFP, to try and across the piece ask each month or each quarter, who do we see, who haven't we seen, and who are we moving towards outcomes that actually matter to them? Thank you.
Thank you. That was our last public comment.
Thank you, Amariani. At this time, we don't have any more public comments, and we don't have any more commissioner comments unless they're...
I have a question.
Yes.
Based on what we just heard. What is the, I guess, what's your connection with what he just said?
Oh, no, I don't have a light.
They're all
Let me try that one. Okay. So connection to what he said? Or, doesn't matter. I'll be broad. How about this? We'll do it all. Okay, so basically what Richard just spoke about was being able to really take a look, when he says who we're serving and how we're serving them, it helps to, for instance, go to each service provider in the FSP, really give them the tools necessary to identify how often they're having touch points with each client. What does that look like? What does each client need? And when we've done this, and when we've gone and we've gone around and we've sat with FSP providers who have done the performance management and watched and listened to this process, and what happens is that you will hear them say, oh, I just assumed, or oh, I didn't realize, because they're filling in the gaps for their clients, the way that we all do when we're going through our day. And so it provides them the tools to actually listen and pay attention to what the client is saying they want and what the client is saying they need. And sometimes, for instance, you just assume somebody's in the same spot they were last year or last month, and they're not.
So I understand that. I'm trying to understand what Richard described, how that connects to the RFP.
Oh, okay. So in being able to do that, that is one component of what performance management is. So I think what Richard was doing was giving an example of how it manifests. So being able to look at service provisions is one example of how it manifests. We also look at staffing, funding, and then client specified outcomes as a part of what we look at when we do that. So there are a number of ways that we build in goals at both the provider and the client level in that. And one of those goals is often, are we serving people in a timely manner for them? And so that'd be one goal that you would look at. Sure.
If I may, real quickly, Keandra, one of the experiences I have with TA as associated with Richard is that Richard, because the organization that I used to be a part of is a part of the partnership, is that this collaboration. Richard comes in and there's a question that Richard has asked us here, and I'm going to paraphrase. I don't think I get it every time. Is what does a client say? How does a client feel about hope or happiness or their own happiness? And that question isn't really the always the most salient. It's not always the question that that's in the forefront of the provider's thinking, because as Richard said, one of the things that we get contracted to do is really monitor hospitalization and jail and housing and all those things. And so it's really making sure that we bring together that conversation plus a myriad of other very important components associated with the delivery of FSP services that they provide us with technical assistance and support in taking a look at. So yes, every month they look at the FSP roster and talk to you about not just those key performance outcomes, but also in addition, the perspective of the individual on their care, and I'm summarizing, and what are we doing to support those individuals that have been with us for multiple years, more than 5 in Richard's example, and are we creating a system of care that makes them dependent on specialty mental health services for the rest of their lives? And that's not the goal.
And those are all things I wholeheartedly agree with and love to hear. I was just trying to understand if we vote for this, is that contributing and is that helping this goal?
That's the example of technical assistance that I've experienced.
Perfect. So, and then what I want to clarify is part of what we have in the RFP is that those goals will be created through that learning group that includes clients, peers, service providers together. And so, and in that area, they'll be able to define what's important to them. And clearly, that's an opportunity that we have to listen to them about what success looks like. And so we do have these FSP goals that we all have and follow, which is reduce incarceration, hospitalization, et cetera. But we want to move beyond that. We really want to get to some more holistic goals.
Questions, comments? Yes, please.
This was a very difficult agenda item to actually understand, and I totally get the struggle because I had to reread. But the way I conceptualize this in my head is the FSP population is a very difficult population. They have serious mental illness, they are unhoused or at risk of being unhoused. And so the role of the staff, which we are trying to provide technical assistance, I suppose under RFP, is really going to assist them on how to communicate with these individuals, how to do the warm handoff if necessary, how they help them navigate, am I understanding this right, through this system of FSPs that counties are responsible for implementing in a very simple understanding. Is that at least one of the purposes of this RFP?
Yeah, I think it is in that we are taking what I think is often a system that's seen as really convoluted, and we're trying to get to some really crystal clear, steps and measurable ways that we can help providers and clients get to outcomes that they choose and that they like. And that's really the bottom goal of this. So in its essence, yes.
Oh, yes, go for it. Oh, just kidding.
You can choose to either vote on it now contingent on funds, or you can just say we will revisit this once we have clarity on the May revision. I mean, and you don't need a vote for that. You just move it forward for a future agenda item.
And right now, there's funds available.
No.
I don't need it
Can
anymore.
can I go ahead and, can I make the motion? Okay.
Oh, you have a mic.
I have one. Mine is the only one that's still working. Let's take that as a sign.
You're one of the only ones practicing FSP as a doctor.
Do I have to read the whole thing, or can I just say I'll make the motion? I'll make it like this. The commission authorizes staff to release an RFP to award $10 million in mental health Wellness Act funding through a competitive bid process designed to coordinate the recruitment, technical assistance, and training for county behavioral health departments and FSP service providers to build internal capacity and performance management.
You didn't include, just to clarify, the language of pending on availability of resources.
On purpose.
Okay. Is there a second?
I'd like to second.
Okay.
We have a first and a second. Please call the roll.
Okay. All right, folks. Folks online, please unmute yourself so that you're ready to vote. And I will need a verbal vote from you, so please get prepared for that. And I hope I don't lose mics, so I'll go quickly. Commissioner Bear.
Yay.
Commissioner Burnick.
Yes.
Commissioner Bontrager. Commissioner Brown. I need to be able to hear votes. So Commissioner Brown is not here. Commissioner Bunch.
Aye.
Commissioner Callan.
Yes.
Commissioner Carnevale. Commissioner Chambers.
Yes.
Commissioner Contreras. Commissioner Designee Swartz. Commissioner Cross.
Aye.
Commissioner Fairweather.
Nope.
Commissioner Fernandez.
Nay.
What did you say?
No.
No, okay. Commissioner Gordon. Not here. Commissioner Designee Pulmano. Aye. Commissioner Larson.
Aye.
Commissioner Madrigal Weiss.
Aye.
Commissioner Mitchell. I can't hear you. She said no. She said no, okay. Commissioner Robinson. No. Commissioner Southard. You're not here. Commissioner Thomas Beckett. No. Commissioner Sy. Is he gone? Okay. Commissioner Wilks. Abstain, okay. Vice Chair Roulette.
Yes.
Chair Alvarez. Aye. Give me a second. I want to see how many we have here. 3, 4, 5, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So we need 9 to. 3, 4, 5, 6, 7, 8, 9, 10, 12. The motion passes.
Thank you, and thanks for that robust discussion. At this time, it is 4 o'clock, and I want to sincerely apologize to the McKinsey team and to the commissioners that have worked so carefully on this item, the Early Psychosis Intervention Strategic Plan, as well as some important partnership conversations that Kendra has been engaged with the Department of Managed Healthcare. We are going to punt this issue to our next meeting. So appreciate your patience and understanding around that. And hopefully be able to allocate the time necessary to better understand this item and the opportunity for the commission's engagement in it moving forward. Before we close and before you all jet out of here to enjoy the 80-degree weather, I want to circle back to the conversation around the staff town hall. Commissioner Robinson, I'm looking at you. One of the opportunities we have in front of us with our new executive director is to utilize her performance as part of our collective commitment to improving the commission as a whole. It is not on our executive director alone. It's truly a partnership between her, the entire team, and the commission to help improve the culture in all the ways of this organization. However, we got to start somewhere, and starting with the executive director's goals is one area. So with the leadership of Commissioner Robinson, who led our executive director search committee, we are planning to evolve that committee into a workforce optimization committee to really have leadership and direction around how to improve our operations as an organization, our culture, our commitment to staff, well-being, our overall communications. We talk a lot about transparency and communication to our external stakeholders. That value is just as important internally. I'm saying that out loud as the chair of this commission, but also as someone who's been in multiple conversations with commissioners around that commitment and what we want to see happen. So thank you, Commissioner Robinson, for your leadership on that. That committee is rather large right now, so we are looking to slim it down a bit and add new members. So we will reach out. Exactly. So we're going to reach out to commissioners that are currently on that committee to generate or to ask your continued interest, as well as follow up with those that expressed interest in joining the committee.
I emailed both you, Chair, and Commissioner Robinson to be a part of the committee. I'm also curious how it's already large when it just got formed.
No. It's the ED Search Committee. So the existing one that was created. Yes, exactly. And this will be an agendized item at the next meeting so that we can engage in further discussion around that. This is really hard work. And I just want to, this is really hard work as well. And I just want to acknowledge that and appreciate the leadership and commitment of both the team, the leadership, and this commission in the work ahead. Thank you. Have a wonderful evening and a great long weekend. Oh, meeting is adjourned.